just an incredibly difficult year for everybody. And from the beginning, I would call CBIA and say, listen, I've got this issue, help me understand, clarify, translate for me. They are my go-to source. We're talking, plus 20 years for sure. O&G is close to celebrating their 100th anniversary in 2023. We have organizations and construction sites throughout the state of Connecticut. There's a strong focus on the education market, particularly our schools. At the end of the day, as an HR practitioner, you have a core set of trusted resources, and CBIA is one of them for me.
Fuss & O'Neill is very safety conscious. I love coming to work every day. My job is primarily safety, and if I can help somebody go home without being hurt, I've accomplished my job. I've done training. I've probably seen over 3,000 or 4,000 people, different individuals I've trained, and I don't think anybody's gotten hurt. Works of life, it's again, me going out and making a difference in somebody's life. They might not even know it. But if I've trained them and I train them correctly in whatever I'm training them on and they don't get injured, I've accomplished my task.
Good morning and welcome to the 2021 Safety and Health Conference hosted by CBIA, the Connecticut Business and Industry Association. I'm Philip Montgomery, Director of Compensation and Safety Services here at CBIA. This year's conference is made possible with the generous support of our friends at the engineering and safety consultant firm of Fuss & O'Neill. We'll hear from Fuss & O'Neill's President and CEO, Kevin Grigg, in just a few minutes. We have an extraordinary and extremely informed group of presenters today who will share with us crucial information on the significant issues impacting the world of health and safety over the last year, especially the impact of the COVID-19 virus and the steps as safety professionals you can take in promoting the safety of your workforce. As you've dealt with the challenging and incredibly complex past 12 months, not only have you had to handle the usual health and safety issues, you've also had to master the seemingly constantly changing scenarios brought on by the COVID-19 pandemic. Additionally, you've had to learn new ways of assuring the safety and health of not just your employees, but your vendors, contractors, and in many cases, your customers. With the state scheduled to reopen on May 19th, you'll face a host of new concerns and challenges as we move forward. Many businesses will be able to open at full capacity for the first time since the pandemic began about a year ago. Well, what does that really mean for your employees if they're still too nervous about working in person? From a safety standpoint, how can you continue to help them put those fears aside? We hope the conference will assist you in setting a new and safe path as more and more employees return to work. We're deeply honored to have as the opening speakers of the Regional Administrator of OSHA, Galen Blanton, and the Head of CONN-OSHA, Ken Tucker, who will update us on the government's activities of the past 12 months and the safety initiatives and policies planned by the Biden administration. They'll be followed by the president of Fuss & O'Neill's Manufacturing Solutions, Robert Lewandowski, who will comment on how companies in general have addressed the numerous challenges brought by the pandemic and the steps they're taking to move forward. We're also very excited to hear from the safety heads of 5 of the most prominent companies in the area: DATCO, Bartlett, Brainerd and Ecot, Legrand, TTM Technologies, and Command, who will discuss in detail how they have risen to the COVID challenge and how they'll move forward. As mentioned, the safety world is not just about COVID. So we'll also hear from Chris Main of GZA, speaking on training in this new environment, and Mike Ziskin of Field Safety Corporation will speak about innovations in the personal protective equipment arena. And finally, one of the more interesting relationship changes in the area of safety over the past 12 months has been how we deal with our contractors and vendors. Megan Baroni of Robinson Cole will speak to developments in this area. We're going to do all that and finish at about 3:30. We'll take several breaks throughout the program so you can grab some coffee and stretch your legs. We'll also stop for a 30-minute lunch break at about noon. If you have questions at any time throughout the program, we want to hear them. You can submit them through the Q&A function on your screen. Please be aware that you can communicate with us and with each other through the chat function, but we will only address questions that come in through the Q&A. We've got a lot to get to, and I would like to get the day started by introducing to you Chris DiPentima, who became president and CEO of CBIA just last August in the midst of this pandemic. He has spent much of his time navigating this phenomenon for CBIA staff, but also in his role as business representative to many of the governor's task force on this issue. Chris also chairs the Connecticut Manufacturers Collaborative and serves on the board of the Connecticut Manufacturing Innovation Fund and the governor's COVID-19 Advisory Council. He's now going to give us his perspective on the business community efforts during these difficult times. Chris, good morning.
Thank you, Philip, for those opening remarks, and good morning to you all. I want to start by saying how grateful I am for the way you and your company stepped up and supported your employees, your communities, and our home state over these past 14 months. I am incredibly proud to be part of Connecticut's business community, to see firsthand the difference you all make in your communities, and to have the opportunity to hear and share some incredible stories. From manufacturers retooling production lines to make urgently needed PPE and medical equipment, to the tens of millions of dollars in time and resources businesses poured back into their communities, to the spectacular development of the COVID-19 vaccines. This past year tested our stamina, our willpower, and our inner fortitude, and much, much more. But instead of running from the challenge, Connecticut met it head-on, turning adversity into opportunity. And CBIA has been your voice and your partner throughout the pandemic. From Philip and Diane McCrisky and Mark Soicher before he retired, fielding your calls and emails, to distributing PPE to small businesses, to the unprecedented 1.5 million visits the CBIA website hosted last year, and of course, advocating on your behalf to the administration and legislation. The resiliency and perseverance of our residents and businesses is inspiring, and I've seen and heard so many remarkable stories that reinforce my optimism and belief that Connecticut will emerge from the pandemic stronger and better than ever before. The COVID-19 vaccines have changed the game, and what an incredible testament to the ability of businesses to innovate. It normally takes 12 to 13 years to bring a vaccine to market, but in less than a year, Pfizer, Moderna, and Johnson & Johnson have brought hope to Connecticut, the country, and the world. And we've seen positive indicators as a result, driven in part by our response to the health crisis. 70% of the state's over 18 population has now received at least one vaccine dose, and 50% are fully vaccinated, the first state in the country to reach that milestone. We are the leader in the vaccine distribution, and I cannot stress how important it is for every person in the state to get the shot. We all play a role in this. 2 weeks ago, the governor called on the business community once again, this time to help shut the door on COVID by educating and incentivizing our amazing employees to get vaccinated. Think of it as a relief pitcher being summoned in the 9th inning to get the final outs in a critical victory. Let's answer the call. In less than 2 weeks, assuming virus cases continue to decline and vaccination rates continue to increase, all restrictions on business operations, excluding indoor mask mandate, will be lifted. We will be one of the first states in the Northeast to be fully reopened. While we cannot afford to let our guard down, it is remarkable to consider where we are now compared with last spring. In addressing the health crisis, Connecticut returned to its spot as a leader in the country and the world when it comes to public-private collaboration, resilience, and innovation, or as some around here like to call it, Yankee ingenuity. And now it's on all of us to ensure Connecticut continues to be a leader. Speaking of leadership, I'm delighted to have the opportunity to introduce our next speaker, Fuss & O'Neill President and CEO, and CBIA board member Kevin Grigg. Fuss & O'Neill not only helped make today's event happen through their generous report, but the company engages at multiple levels with CBIA and is one of the reasons our organization remains vibrant, strong, and is so effective. Kevin's leadership plays a key role. Kevin, good morning. It is great to see you, and let me say firsthand how thankful we are not only for your support of this event, but for how engaged you and your team are with CBIA.
Well, thank you, Chris. It's a pleasure and a privilege to be here, and certainly a pleasure and a privilege to be a part of such a great organization. It's, first of all, good morning and happy Friday to all of our attendees. As Philip mentioned earlier, it's my pleasure and privilege to introduce our two keynote speakers for today's conference. Galen Blanton, who's OSHA's administrator for the New England region, and Ken Tucker, CONN-OSHA director. By way of introduction, Galen has worked for OSHA for over 25 years, starting his career in Milwaukee, Wisconsin as a health clerk after graduating from the University of Wisconsin-Milwaukee with a Bachelor of Science degree in science. He worked as an industrial hygienist in Wisconsin, the regional audit coordinator in Chicago, the area director in Honolulu, and the deputy regional administrator in Seattle. He was also the acting career deputy assistant secretary for part of 2018 and has been the regional administrator in Boston for the last 4 years. Ken Tucker was appointed as the director for the Connecticut Labor Department's Division of Occupational Safety and Health in 2012. He's been employed by the Connecticut Labor Department since 1986, beginning his career as an occupational hygienist, primarily working as a health compliance officer in the public sector. In 2004, Ken was promoted to the position of an occupational health and safety manager. He coordinated efforts in both the public and private sectors, being responsible for on-site consultation, their on-site consultation program. Ken also managed the Safety and Health Achievement Recognition Program for 8 years and has served in the field of occupational and safety and health since 1974, when he enlisted in the U.S. Air Force, and that same year and served 2 enlistments. When in the military, he was responsible for the safety and health of base military personnel. Galen and Ken are the region's top OSHA and CONN-OSHA officials. They'll be sharing their thoughts and insights on safety in Connecticut, including assessments of the region's most challenging enforcement and compliance issues, the status of pandemic-related temporary standards, the Biden administration's safety and enforcement initiatives, and they'll be reviewing with us the issues that officers encounter in the field and the ongoing emphasis on pandemic-related challenges. So with that, by way of introduction, Galen and Ken, please feel free to take the floor.
Great. Thank you so much. I really appreciate being invited here to speak to all of you. I really need to first start off a little bit talking about what happened probably about a week or so ago, April 28th, Work Memorial Day. Many of you probably participated in some events or had known about some of those events. It's the time of the year that we reflect back to honor those or remember those who died on the job. It's one of OSHA's main goals is to prevent fatalities from happening, and every year we reflect back on that. That day was also the 50th anniversary of OSHA itself. 50 years ago, workplaces were very different. There weren't a lot of workplace protections. OSHA opened its doors and started its journey to increasing the safety and health of workplaces throughout America. It's and really, aside from some public sector workers who are still aren't covered under the OSHA Act, most workers in this country have never had to do their jobs in an environment without workplace safety and health protections. But our grandparents did, And like I said, it's a very different world. In fact, it was a very different world about a year ago, or more than a year ago. The pandemic has really changed what we do. With the new administration, I think the majority of the work, or the talk that I'm going to talk to you today, is going to be about the new administration and the changes in the direction that we are going to be moving as an agency, mainly to address the challenges that have happened within the last year regarding the pandemic. One of the biggest challenges we must address is better protecting vulnerable workers. We know that many workers are at an increased risk, and sometimes because of the jobs that they do, but also because of the factors of color of their skin, their ethnicity, and the fact that English may not be their primary language. And too often, these workers are the ones who aren't aware of their rights or feel uncomfortable raising safety concerns. From the very first day on the job, every worker is entitled to a safe and healthy workplace free of hazards. A safe workplace isn't a privilege, it's every worker's rights. And the agency, this administration is really going to be focusing in on that in the next 4 years. On the first day in office, President Biden issued an executive order on advancing racial equity and support for underserved communities through the federal government. This executive order revoked an executive order from the previous administration combating race and sex stereotyping, which, amongst things, prohibited federal contractors and subcontractors from providing certain workplace diversity training programs. The new executive order under President Obama has affirmed that equal opportunity is the bedrock of American democracy, and our diversity is one of our country's greatest strengths. It also directs federal agencies to assess whether underserved communities and their members face systemic barriers in accessing benefits and opportunities created by our programs. This includes examining whether new policies, regulations, or guidance documents may be necessary to advance equity in agency actions and programs. So you'll see a lot of emphasis on that within the agency, working out with maybe underserved groups, hoping to increase knowledge to share that information with employer groups, and getting everybody on board as far as equity and ensuring a level playing field for our employees. And there's a lot to do for OSHA to kind of reaffirm this commitment to workers' safety and health and reestablish trust with a lot of these groups. And it's really starting by building some relationships with stakeholders, relationships that we've had in the past that may have withered a little bit in the past couple of years, but re-engaging not only with employer groups, but employee groups, but employer groups as well too. We really need to do a better job of educating workers and employers on hazards. We have to make sure that they're following through in addressing them. COVID being really the top of everybody's conversation lately. There's a lot of guidance coming out. We'll talk about that in a little bit as well too. Things are changing. Workplaces are changing. The world is changing. Things are improving. But managing those changes are what we need to do. Not letting our guard up. Even though there's some restrictions that are being lifted, it's still making sure that we're taking control of our work sites and ensuring worker safety as we move to the end of this pandemic. So ever since the pandemic, and you may have heard some of the news reports that OSHA has kind of been sleeping and not doing anything, but I can reassure you that OSHA has been working nonstop to ensure that we have been and are addressing the COVID pandemic, responding to complaints. May have been overwhelmed. There's a lot of uncertainty. OSHA went through the same learning curve as everybody else in the country as far as what this pandemic is, how to protect ourselves, how it transmits, and how to protect ourselves from the virus itself. CDC, the guidelines, they were evolving from the beginning. We kept up with that and followed it and tried to update our guidance as things did progress. Some of the changes, starting with the new administration. So there's another executive order signed on January 21st calling for increased protection for workers as we continue to battle the COVID-19 pandemic. As outlined in the president's executive order, it is morally and economically imperative that we ensure the health and safety of our workers. Can't get the job done if employees are sick and dying. It just really doesn't make sense. And following the guidelines that are provided is in the benefit of all. Stopping the spread and protecting workers from COVID-19 without a question is the only way to get the economy and our lives back where we all want to be. This executive order did a few things. One, it issued revised guidelines to employers on workplace safety during the pandemic. It reviewed our OSHA's enforcement efforts related to COVID-19 and identified any changes that could better protect workers and ensure equity in enforcement. It launched a national emphasis program on COVID-19 to focus OSHA's efforts on violations that put the largest number of workers at serious risk or are contrary to anti-retaliation principles. And it also directed the agency to consider if an emergency temporary standard on COVID-19 is necessary. And it also encouraged the agency to engage with labor unions, community organizations, and industries on a multi-language outreach campaign to inform workers and the representatives of their rights, placing a special emphasis on communities hardest hit by the pandemic. Part of the executive order, OSHA will also coordinate with states that operate their own occupational safety and health plans to ensure that workers are covered by those plans are adequately protected from COVID-19. In states without a state plan, OSHA will consult with state and local governments to help bolster their protection and ensure that they are as protective as OSHA's guidance and protections are. And we'll also are planning on consulting and working with other federal departments to kind of have that synergistic approach to safety and health, health and human services, agriculture, transportation, and exploring ways to protect workers where safety and health are not currently covered, so that they too can remain healthy and safe on the job during the pandemic. On January 29th, OSHA took that first step towards improving protections by issuing the updated guidance. The guidance is designed to help businesses decrease risk and improve worker safety so that they can safely reopen. It provides a roadmap for businesses to protect the health of their workers, which must be ours and yours, everybody's top priority. OSHA took an important second step on March 12th with the issuance of a national emphasis program on COVID-19. We'll go into depth about that just in a little bit. And we also updated our interim enforcement response plan, which was developed in the midst of the COVID pandemic in order to protect not only workers in the workplace, but our own workers, our own inspectors who go out into the field. The NEP, the National Emphasis Program, is going to help focus our enforcement efforts on companies that put the largest number of workers at serious risk of contracting the coronavirus. It also prioritizes employers that retaliate against workers for complaints about unsafe or unhealthy conditions, or for exercising other rights protected by federal law. The updated enforcement response plan prioritizes the use of on-site inspections with proper protections for our compliance officers, and tries to identify areas in which we can do off-site, to further reduce the amount of time, in the field or in an area where there's still a potential spread for COVID. As far as the emergency temporary standard, that's still being worked on. Nothing's come out yet. It's still in the process of review. OSHA and the government's taking its time to make sure that we get it right, especially in the light of changing guidance and as of the pandemic kind of works through its course and more people are being vaccinated. So go back and start and talk about that first step back on January 29th. Talk about the revised guidance that came out. The biggest takeaway from this updated guidance is that implementing a COVID-19 prevention program is the most effective way to reduce the spread of the virus. Employers throughout the country should be implementing these COVID-19 protection programs tailored to your own workplace, because every workplace is different. And the most effective programs, as with anything, really engage workers and the representatives in the development and include the following key elements. 1, conducting a hazard assessment. 2, identifying a combination of measures that will limit the spread of COVID-19 in the workplace. 3rd, adopting measures to ensure that workers who are contagious or potentially contagious are excluded from the workplace. 4th, implementing protections from retaliation for workers who raise COVID concerns, making sure that you don't have any kind of retaliation or retaliatory practices, intentional or not, in your workplace. Review those. Make sure that employees do feel comfortable and free to raise concerns, not only to you, but to a government agency. And finally, the education and training of workers for COVID-19 policies and procedures in a language they understand, and ensuring that that knowledge is transferred to them. The guidance that has been updated and provides additional details on key measures for limiting the spread of COVID-19. Again, starting with separating and sending home infected or potentially infected people from the workplace. Implementing physical distancing. Suppressing the spread by using surgical masks or cloth face coverings. And the use of personal protective equipment. OSHA will continue to update this guidance over time to reflect developments in science, best practices, and standards, and will keep track of changes to ensure transparency. We want to make sure that we will be doing this through outreach, newsletters, through our partnerships and alliances that we have to share this information as much as possible. Throughout the pandemic, and you can ask your local area office, we've been inundated with phone calls, questions, concerns. I mean, even our own people have a lot of questions, concerns as things were developing. We've collected a lot of these and created these frequently asked questions, FAQs, that we've posted on our website. And if you haven't been to the OSHA's website, please do so. It's the most up-to-date and informative place for information. Everything you wanted to know about coronavirus is on www.osha.gov/coronavirus. So a lot of these things I'm talking about, you can access yourself there. But these frequently asked questions and answers have a variety of topics: cleaning and disinfection, cloth face coverings, healthcare, employer requirements, PPE, hand washing, retaliation, return to work plans, testing. These are based on the most recent CDC, NIOSH guidelines and are updated as needed. The other thing that OSHA has done to help kind of spread information about the pandemic and how to protect your employees, these OSHA alerts available in both English and Spanish for specific occupations, as well as general guidance on worker risks and preventing worker exposure to COVID-19. Some of the OSHA alerts include, nursing homes and long-term care facility workers, retail pharmacies, dental practitioners, stockroom and loading dock workers, package delivery workers, a variety of vocations and jobs and hazards. That second step we talked about, the National Emphasis Program on March 12th, OSHA released the NEP on COVID-19, as well as updating the interim enforcement response plan. The interim enforcement response plan, again, was a way to conduct OSHA business during the height of the pandemic, modifying how we did things. That's where a lot of confusion as far as OSHA, not really doing the work that they had done in the past came to be. The fact that, people allege that complaints were going unaddressed is completely false. Complaints were handled differently. We were trying to minimize our risk. We didn't want to be a super spreader event by going from workplace to workplace to workplace, potentially spreading COVID-19. So we modified our practices. We had tried to address things as much as possible through off-site measures, remote inspections, through some of the already tried and true practices of it used to be called the non-formal complaint or form of facts, where we'd call the employer. Many of you may have experienced this. Let the employer know about the alleged complaint or there are hazards that are in the workplace, and gave the employer 5 days to respond back how they were going to address that, and then evaluate the response to ensure that employees were protected. I did a lot of those over the past 13 months. But now the NEP is really it's augmenting some of the efforts addressing these unprogrammed inspections. And unprogrammed inspections are really like the complaints that come through, referrals from other agencies, the severe illness reports that employers respond to OSHA with. And it added a component to target specific high hazard industries or activities where COVID-19 is prevalent. The NEP also, again, and I've said this a few times now, really focusing on anti-retaliation to make sure that employees feel free and comfortable enough to bring up concerns to employers, to a federal agency, to ensure that there is no retaliation. And it also directs the agency, the NEP does, to make sure that this is brought up during outreach events, through publications, to really get the word out there to both employees and employers. The National Emphasis Program really focuses on enforcement. Inspections will continue to focus on industries and workplaces expected to perform tasks associated with high frequency, close contact exposure with an increased potential exposure to the SARS-CoV virus. The highest priority is always going to be given to unprogrammed inspections. So those complaints, referrals, severe incident reports will be our main priority to respond to and address. The NEP, as far as focusing OSHA's efforts on the coronavirus pandemic, really expects us to do a certain percentage of our inspections should be focused towards that, so that we are using our resources to combat that. Other things are happening in the workplaces too that are non-COVID related, and those are going to pop up as well too. But as far as COVID-19, this NEP also asks us to conduct follow-up inspections for facilities that may have had a non-formal complaint and said, and the employer corrected or made corrections or told OSHA that they were making these corrections. These follow-ups will go back and just verify that the condition is still being addressed, that is no longer happening in the workplace. And if we can't get to that certain percentage of inspections that we do of our work that we're doing, OSHA, local office, region, country is really going to rely on some programmed inspections. And these programmed inspections are really based on conducting inspections in areas that may have had in the past either high instances in 2020 of respiratory illnesses, which typically are going to be COVID, or industries through the NAICS code where we've had the most activity. But trust me, the unprogrammed and follow-ups are probably going to keep us pretty busy. I'm not sure how many of the program inspections we're actually going to get to. OSHA as a whole with our resources have really, we've switched quite a bit. We used to be about probably, I'd say 40% of the inspections that we did were unprogrammed, where we were able to actually do some programmed inspections. For the last few years, it's really switched quite a bit into more like 60 to almost 80% in some cases that the work that we do are unprogrammed inspections. As I mentioned before, and I may have said some of this already, the interim enforcement response plan is kind of wrapped up into this national emphasis program as far as how we conduct our work during the pandemic. It's really going to focus in on in-person inspections rather than trying to determine how we can do our inspections remotely. So it's identifying our main purpose really is to identify exposures to COVID-19, ensure that appropriate control measures are implemented, and address any violations of OSHA standards or the general duty clause. And I said, the plan really prioritizes the use of on-site inspections, or even a combination of on-site and remote methods for formal complaints, hospitalizations, and fatalities, regardless of COVID-19. Also prioritizes COVID-19 related inspections involving death or multiple hospitalizations or other unprogrammed activities, so complaints and referrals, alleging potential exposures to COVID-19. And it also allows and kind of codifies the use of remote methods for employee interviews and collection of documentation to really minimize the amount of person-to-person contact as we do these inspections. Outreach and compliance assistance is also a huge part of this national emphasis program. We do as much as we can to get the word out there. There's the kind of the information that's always available on the OSHA website, but the national office is going to conduct some national outreach with media, industry and labor stakeholders, alliances, the partnerships that we have. We're working through them to distribute the information as many ways as possible. OSHA will continue to conduct outreach again too, using different products and activities like letters, the news releases, quick takes, seminars tailored for specific audiences, such as something as today that I'm doing here for you. For both employers, employee groups, unions, in focusing in mainly on industries such as, but not limited to, healthcare, meat and poultry, correctional institutions, and also working with national and regional offices for federal agencies with similar outreach goals, EEOC, the USDA, wage and hour, to help disseminate this information that we have. The other part, so OSHA is focused on the important work that needs to be done now to stop the spread of spread of COVID-19 and ensure the health and safety of all workers, including protecting its own employees so that they can do their job safely. Our compliance officers, COSHOs, are instrumental in helping OSHA achieve its mission, and their work often takes us to workplaces where hazards have been alleged. The agency is working very hard to ensure that the COSHOs, the compliance officers, have every protection necessary. When on-site inspections are conducted, risk is evaluated ahead of time through a job hazard analysis. Appropriate protective measures are utilized. Make sure that our staff have all the PPE that is available. And we're also working with local and state agencies to ensure that our compliance officers are being vaccinated. Are trying to get them to the top of the list to kind of fit in with the same hazards or the same job classifications where the hazards are the greatest. You're going to have to re-emphasize the fact that the OSHA.gov website should be the first place you go to if you have questions. OSHA.gov/coronavirus, the most up-to-date information, pulls information from many other agencies and focuses just on workplace hazards and how to protect. Again, we're trying to do everything that we can to reaffirm the agency's commitment to worker safety and establish a trust that we are working to protect America's workplaces, including those that are most vulnerable to COVID-19. OSHA as an agency is going to continue to work hard to ensure that every worker is protected so that the nation's economy can get back to business safely. With that, I can turn that over to Mr. Ken Tucker.
Good morning, everyone. I'm honored and privileged to be here today to talk to you about what's going on with the state of Connecticut Labor Department CONN-OSHA division efforts with regards to not only the pandemic, but things that we are doing. By way of introduction, I'm the CONN-OSHA director for the office. I started back in 1986 with CONN-OSHA. I was a health compliance officer and served in that role for 18 years and subsequently was promoted into management. And I ran our consultation program for the private sector for several years. And then in 2009, took over, assumed the position of director after several changes internally with retirements and the like. So as Galen indicated, our world has been turned upside down significantly for the last year or so. And the pandemic has put a huge strain not only on each one of us individually, but on our resources and how we do things. Everything that we do now kind of evolves around the pandemic. But Galen made a point that I want to just emphasize. The workers in the state of Connecticut and particularly in the public sector for my jurisdiction never stopped working to a great extent. So in addition to all the pandemic related concerns that we certainly have seen over this last year, people were still going to work every day. They were getting hurt. There were injuries. There were fatalities. There were accidents. There were other types of complaints that were non-pandemic. And OSHA never stopped that mission of making sure that these workplaces were safe. And at the same time, CONN-OSHA has not stopped any of that action also. As we all know, for the first 2 or 3 months of this pandemic, it seemed like everything shut down, all the workplaces shut down, and we limited everything that happened in the CONN-OSHA office for sure. All the guys were sent home. They were working remotely, and quite frankly, even today, they're still working remotely for a great part of it. But the mission and the work that we do have not changed one iota. In fact, it's increased tremendously just because of all the complaints and accidents and unfortunately fatalities that have happened in the workplace. CONN-OSHA and OSHA has never lost sight of their mission to protect Connecticut's workers and the workers throughout our country. So the workload has increased quite a bit. Our division at CONN-OSHA is kind of set up into 3 different areas. We have enforcement in the public sector, which is state and town and municipal governments and the subdivisions thereof. We have a program that runs our consultation, that performs consultation for our employers, and that's kind of divided into 2 different groups that they impact. One is our private sector folks, and the other one is our public sector folks. And then we have a training and education unit that goes out and tries to do some of the same things that Galen's folks are doing throughout the region, particularly their compliance assistant specialist. Our enforcement is robust, and we're going to talk a little bit about that, but I wanted to just kind of go back a little bit and kind of talk a little bit about what's happened with this pandemic. As Galen indicated, things have morphed and changed over time. We've got better in understanding the dynamics of how the coronavirus has affected us, not only individually, but our workers that we have jurisdiction over. And CDC and NIOSH have updated their guidance and refined their guidance based on information that they've gleaned over that year, and they've got more specific and better with that. So at first, when the virus hit, we're all kind of hunkered down at home trying to figure out what the next step was. And in spite of that, from the very beginning and even years prior to that, we have always been part of the state's emergency response task force and commission for any type of natural disasters. And the pandemic just kind of led into that as far as how that was handled. We immediately, through the state, was part of the unified command. And I can tell you that we were doing multiple unified command calls. Matter of fact, it was twice a day, 7 days a week for quite a long period of time. Shortly thereafter, as the nation found that the personal protective equipment was going to be in short supply, we sure seen that in Connecticut, where our employers could not provide the employees that they needed with N95 masks. And then the question is, how do we handle that? So immediately, we were put on the Logistics Task Force through the Unified Command, ESF 7, Emergency Support Function 7, which is really logistics. And we became subject matter experts very specifically for personal protective equipment and even more specifically, respiratory protection. And I can tell you that the stories are just unbelievable, and the work that logistic team has done over this last year or 15 months to get to where we are today. But at the beginning, every manufacturer in the state and the country was unable to provide the respirators that were needed for the workplaces. They ran out almost immediately. So then the next thing is they started a worldwide search. And if you can imagine that all 50 states, employers throughout the country were all trying to find out how we can get the right type of respiratory protection, they started going to the world market. And we were involved, particularly through this ESF task force, of vetting out respirators that came in, particularly from overseas in China and Korea and the like. And there were so many fraudulent respirators that were being touted as the respirator that our workers were supposed to get, that it was unbelievable. So we played a huge part in ESF 7 and looking at a myriad of different types of respirators and the approvals and how that all happened. Throughout that, also, besides the Unified Command and ESF 7, we got to a point where we started looking at the state level of how we got to start to reopen. And we're talking the different phases that happened way back in last early summer of how we got to start to reopen our manufacturing facilities that weren't open already. How are we going to start to open our restaurants and our service areas like barbershops and hair salons and all the like. And we were asked at CONN-OSHA to be part of Connecticut's Reopen Committee. It was a daunting task, and myself and one of my staff members actually sat on that, which we could continue to do as of today. But with that, we looked at so many different things that weren't specifically related to health and safety in the workplace, that it transformed the way that we had to look at things. Health and safety in the workplace was critical. We know that. But at the same time, we've got restaurants saying, how do we open? And we physically looked at social distancing with 6 feet inside a restaurant. The plexiglass that you see in most of those restaurants, a lot of that came out of this committee that I sat on and that my coworkers sat on. Barbershops and limiting that to no walk-ins and to make sure that every other chair was occupied. The sanitation solutions, the discrimination practices in the workplace to make sure people were sent home. All that was part of the Connecticut Reopen Committee for our state. And we met weekly on that, and we agonized over everything from those industries that we talked about, to school openings, to summer camps, to daycare, to childcare, just everything that you can imagine we're involved in. And it's a rewarding thing, knowing that we're a part of something that was much bigger than just safety and health in the workplace, really put a good perspective in my life of what this pandemic really meant to the folks and our workers in Connecticut. And then we also started out on the early part, and Galen kind of mentioned that we kind of took a hands off and did a lot of remote work and some of that type of thing. But we need to get our people vaccinated. And at first, and as you all know, we went to an age-based vaccination program here in Connecticut, and a lot of states did follow that. But original CDC came out with a protocol that talked about the essential workers. And as we looked at NAICS codes and as we looked at classification of workers, at one point we're looking at one group trying to reopen at the same time that was over 2 million people in Connecticut. And we found that was going to be very unwieldy to try to say who's more important, a UPS driver, a worker that's in a manufacturing facility, or someone in our supermarket that's frontline. Never mind our nurses and the hospitals and nursing home. So the governor and the committee decided that they were going to not do it by occupation, not do it by any other metric than age-based. And we've seen that one of the criteria that they use is to look at who was getting sick and who was dying from COVID-19. And we certainly knew it was in the hospitals and the nursing homes, but the metrics showed that a high percentage of these deaths were over the age of 70. So the very first group, once we got through the healthcare workers and the essential workers in that category, where the vaccine went to the 70. That was all part of the vaccine committee that we sat on. So it gets us kind of to non-COVID stuff and where we're at today, particularly with CONN-OSHA. Throughout this whole pandemic, we've had complaints come in. We've had accidents come in. We've had complaints of fatalities in the workplace. And a lot of the fatalities that we dealt with, particularly with COVID, were not directly related for where the causation was at the workplace, but it happened to be that a worker at the workplace got sick, but he was infected from either his home environment or something that was non-work related. So we had to work through all of that to investigate the different types of aspects that we're involved with for our work. We certainly had our share of COVID inspections. I don't think we had nowhere near the amount that the U.S. Department of Labor had in the federal OSHA units, in Connecticut, of course, to the Hartford and Bridgeport office. But part of that was designed or ended up happening that way because the governor had, at that point, decided that any COVID complaints that came in for mask or social distancing, the responsibility for ensuring that the guidelines were followed did not come from the Department of Labor and CONN-OSHA. It actually came through the local communities, through the top official that was designated in their community, and through the local health departments. So when complaints came in for social distancing or not wearing masks, and I want to differentiate the difference between masks and respirators, because OSHA and my mandate was respiratory protection, but the masks themselves, that whether you're talking about the surgical mask or the cloth coverings, when people were not following those rules in the workplace, the governor mandated that the local health directors and the municipalities would enforce that. So when things came into us, we had to kind of screen them out, vet them out to find out which ones were directly related to safety and health and which ones were some of the COVID-related social distancing aspects, and refer them to the appropriate aspects. The Department of Education actually, when complaints came in through the Department of Education and it was related to that, those complaints either went to the local Board of Education or the State Department of Education. So with that, we didn't handle every COVID complaint that came to our office, but we did funnel them to an appropriate agency. Those that came to us that were directly related to safety and health, and Galen had mentioned hazard assessments in the workplace, and we certainly looked at those. Personal protective equipment was certainly a very specific, something that CONN-OSHA did look at, and we had some very specific inspections that we did early on. And then the question is, how do you do these inspections? You don't want your guys creating the super spreader event that that Galen mentioned when we're out in the field, but at the same time, we've got to investigate these. We got people with dermatitis cleaning buses without the right protective equipment. That's under our jurisdiction. We went out and did a couple of those type of inspections, and we started them virtually. And we gained as much information as we can through a virtual process, whether it's through a means like we're doing now, whether it's through phone calls, whether it's going to the site and staying a certain distance away to try to ascertain what we had. We did not meet in person for quite a long period of time, but somehow our effectiveness was able to get done, and we're able to try to protect the workers that had filed the complaints and the concerns in our office. So we've done our share of COVID inspections. With regards to the National Emphasis Program, OSHA mandates that any state plan that's an approved state plan, and Connecticut was the very first approved state plan in the nation back in the 80s, has an option to either adopt the laws identical, and this includes the National Emphasis Program Directive, identically to how it's been published either in the Federal Register or through the guidelines that has come out, or we can have an alternative plan as long as it's equal to and at least as effective as what the OSHA has. So Galen kind of indicated through the National Emphasis Program that there's an outreach component, certainly a huge retaliation component, and there was a list of hazardous industries that were put into the appendix of that National Emphasis Program. The great majority of those didn't apply to us in the public sector. So we had to make a determination with that National Emphasis Program of whether we are going to adopt it or not. And we chose not to. And the reason for that is we had programs in place that were at least as effective as what that National Emphasis Program mandated. The mandates and the requirements of that program are being carried forth in CONN-OSHA and to our mandate. We continue to do outreach, as does OSHA. We continue to have retaliation protection through our state statute 31-379, similar to what the OSHA has under their 11C requirements. So we maintain that. The difference really had to do with the high hazard establishments and the list of establishments that we needed to be targeted. And we couldn't cross that nexus of, if we adopted it, of bridging that gap. And part of the reason for that is back in October of 2020, we had to come up with a new 5-year strategic plan. So with that 5-year strategic plan, we changed our metrics of trying to look at those areas with high injuries and illness rates. And the metric that we had for the previous several years was to reduce the injury and illness rate lower. And that's great in concept, but when you look at data as it comes out through the BLS, and you find out, for example, I'll use an example of public works garages. They fall into a certain AX category, but the BLS only surveys in Connecticut, 169 towns have public works garages, and only 5 get surveyed. The data gets skewed right off the beginning. So when I'm trying to determine if I lowered rates from a certain number to a different number, all the work that we've done in public works garages may or may not impact that number, because I only had a basis of 5 garages that started the baseline for that. So we changed our strategic plan to look at high hazard industries. And we've identified them as fire, as police, as public works, as parks and rec. Those industries that or environments that we have in Connecticut in the public sector that certainly have the highest injuries. But our metric this time is not to reduce the injuries, even though that's a lofty goal and we would love to do that on a continual basis, but it was difficult in measuring that. What we decided that we were going to do is we're going to reduce the amount of people exposed to hazards, similar to the trenching emphasis program that Fed OSHA established when they came out with their new trench emphasis program, and reducing the number of hazards found and the number of people exposed to those hazards in trenching. So we use that same metric in CONN-OSHA under our targeting for those high hazard areas, that we're going to reduce the number of hazards to the folks that work in those high hazard areas. And so far, we've been fairly successful in that. So instead of using the list of high hazards that were in that national emphasis program, we ended up
Can I go to a question to Galen? Hi, we're experiencing a little bit of technical difficulties here. In the meantime, we're all set to go back to Ken. Thank you.
sorry about that. Somehow my computer got muted here. So with that, we have found that our strategic plan on hitting those high hazard industries seems to be effective in reducing the number of injuries and illnesses, but the exposures to the hazards that are found in the workplace. The last thing that I want to say is similar to what Galen said, the best location that we have for reference information is off of the websites. We have our own website at Connecticut OSHA. It's www.connosha.com. We don't take the same information that is put on Federal's OSHA website and put it onto ours, because most people know that they can go to OSHA.gov and get that information. So we link to things that are very specific in CONN-OSHA that relate to our program, whether it's how to file a complaint, the worker protection that's on there, but general COVID information and general safety and health information links that are found on the U.S. Department of Labor website, OSHA.gov. We just link to those sites also. So with that, I'll finish up and I'll pass this back over to Phil. And I think with Phil, we're going to open it up for any questions.
Yes. Thank you very much, Ken and Galen. We have a number of questions now I'm going to pass on to you. The first one being, how can it be proven that COVID-19 is a workers' compensation claim? Both of you would like to comment.
Well, the Workers' Comp in Connecticut, certainly there's a Working Compensation Commission that vets that out. Generally, it has to be an injury that has happened in the workplace, and it has to be attributed to an event or causation that happened at work. So the employer is required to fill out a first report of injury. The employee has the right to fill out a Form 30C, which is the workers' comp form, and that gets vetted at the local level. And if the employee seems not to get the response that they want from their local employer, they have I believe it's up to 1 year. It's a workers' comp law, so I'm not totally familiar with it, but 1 year to file with the Workers' Comp Commission. And then the Workers' Comp Commission will determine whether or not there's a work-relatedness aspect of it and whether it's compensable.
Thank you, Ken. This one is directed at Galen. You mentioned the discussion about the National Program Assessment Plan. Could you give us more details as to the industries that are impacted most likely by that?
Sure. Like Ken said, in the program itself, there is an appendix that lists those, but the top ones really are in the healthcare industry, meat packing, um, those type of industries where there have in the past been a larger report of spread throughout the workplace. I don't have a list right off the top of right with me at the moment.
Okay. Is there a program template that we could that you would suggest?
It's more of a. Oh, go ahead.
Go ahead. Go ahead, Gay. I'll let you answer, and then I'll respond after that.
Yeah, I was going to say, it's kind of a performance based. So there's outlines or guidelines of what should be involved. Kind of talk about that. The workplace assessment. Involving the employees, looking at your PPE, job hazard analysis, but not like a fill in the blank type program that I'm aware of that provided by OSHA. Ken might have some insight.
Yeah. So the good thing is when the OSHA Act was established way back in 1970, Congress also said, listen, we don't want to do just enforcement out there. We want to be able to help employers. So every state, and my office runs it for Connecticut, but has a consultation program. And through that, the consultants come out to a workplace and they're divided into public and private consultants, health and safety consultants. But we can come out and assist an employer in determining what a hazard assessment should look like. And we do have several different types of forms and mechanisms because it's not hard and fast. There's not one mandate that you have to do it a certain way as long as the hazards have been assessed and looked at to determine what type of protective equipment needs to be worn. So we give some assistance to the employers to saying, this is what a hazard assessment is, and this is how you may want to literally do that. And we have a couple of templates that we've kind of worked up over the course of the years since that part of the standard was enacted. So 860-263 6900 is the main phone number for CONN-OSHA, and you can get to one of my consultants that way.
Thank you, Ken. Are there compliance officers who are doing planned LEP also looking at COVID? Ken?
Yeah. Ask your question one, but
yes.
The compliance officers, are you saying are they?
Who are looking?
Are they? Go ahead.
Looking at LEP inspections, are they also looking at COVID?
And I think we all are when we go out into the workplace. Generally, with that national emphasis program, there's a certain number of inspections that have to be COVID related. And I think we're all meeting those metrics on the OSHA family side of it. So when we're out there, some of those inspections are strictly related to COVID type activities.
Okay, thank you. And the last one, CONN-OSHA has a program to assess the OSHA concerns. Are companies involved in that assessment, will they be penalized by OSHA?
That's a great question. So under that same consultation law that Congress enacted, it requires that program be confidential. And when I say confidential, that means that the work that we do stays between my consultants and the employer. That information is not shared to any enforcement, whether it's my public sector enforcement or whether it's Galen's federal OSHA enforcement folks. So it is confidential. Any hazards that we identify, they're considered recommendations. They're not considered a citation. We do identify them. They do get written up in the report as a recommendation. We do mandate correction action for anything that's a serious recommendation that we find, very similar to the corrective action that enforcement would require. And we work with abatement dates. There are no citations. There are no penalties. But the one hook that we do have in our consultation program, and we state this right up front with our employers, that if we find anything that would be considered a serious violation of an OSHA standard, the employer has to fix it. That's not an option. And as long as the employer fixes it and provides us with the information, it stays confidential in our office. If the employer reneges on that promise to fix it, we're obligated to turn it over to enforcement. But I can tell you that since 2009, since I have been the director, we have yet to turn over either a private sector or a public sector employer over to OSHA. We've got 100% compliance on those recommendations that we found. We've had a couple of tough ones where not only the consultant was unable to get the corrective action, but their manager couldn't, and I had to call that employer myself. And somewhere down the line, by hook or by crook, we're able to strong arm them to follow through with that agreement. But ultimately, these recommendations, as we find them, which are serious hazards, are protecting the workers in the workplace. And I think the employer kind of gets that at the end. The great majority of them want to comply because they've called us for assistance. But no citations, no penalties.
Great, thank you.
I was going to say, and I can second that too. And there's a hard line between consultation and enforcement. And in my 25 plus years, I've never had a consultation program refer to us any kind of a hazard. So it's never gotten to that level. I think mainly because the people who are calling consultation do care about the safety and health in their workplaces, and they're trying to address the hazards. The consultation programs are a fantastic resource for employers, completely free. I think more people really need to start using them. It's only for smaller employers. Typically, I think the cutoff is 250 employees, though there may be some room for that. But honestly, that should be with the utmost confidence that there is no, hey, you need to come to this workplace because they've got X, all these things are wrong. We don't hear that. And secondly, I do want to kind of follow up on the previous comment that came up. The workplaces that are listed as far as for the National Emphasis Program. So really, it's any kind of healthcare that you can think of as the main number one. That's including assisted living centers, hospitals, ambulance services, home healthcare services, dentists, physicians. And the other part of that is the non-healthcare ones. It is the top ones: meat processing, animal slaughtering, poultry processing, supermarkets and other grocery stores, discount department stores, general warehousing and storage, full service restaurants, correctional institutions, and temporary health services.
Thank you, Galen. We do have a couple more. Is sickness considered an injury now? Galen?
No, it's an illness. So injury illness reports, so it's always going to be considered an illness.
Fair enough. And finally, to wrap things up, could you give details about any May 19 changes, Ken?
I'm sorry, any what changes?
Any May 19 changes after the reopening, May 19th. Will there be any changes on your part?
I think what we'll see, not so much in the workplace. We're going to still go out and protect the workers in Connecticut, and particularly the public sector under our jurisdiction. I think what we'll end up seeing is as things progress through our journey with COVID, that some of the restrictions will be relaxed a little bit more. With that, so it'll allow us to do that. We are working on a couple of initiatives, particularly in the fire service. We've got a bill that's in the legislature now that went through committee, specifically talking about coverage for volunteer fire departments. And we're also looking at trying to expand a little bit of the training aspects that we can get our cadet firefighters ready so when they turn 18, they become full-fledged firefighters. We all know that volunteer service in Connecticut is very difficult, and I'm working with the State Fire Commission and with a couple of other entities to see if we can expand some of the requirements to allow these kids to kind of get ready so when they turn 18, they can actually join a fire department.
If I can touch on that as well too, revocation of state mandates doesn't mean the same things as workplace protections. So employers are still required to follow OSHA guidelines, CDC guidelines for workplace protections. So it's not a, it doesn't mean when the state guidelines are lifted that all of a sudden workplaces are exempt from COVID protections as well too. So keep that in mind. Refer to the state and federal guidelines as far as workplace protections are concerned.
Great. Thank you. I'd like to thank Galen and Ken for the guidance and insights they have just provided. The information, I'm sure, will be helpful as companies address the safety of their workers over the next few months and years, and as the regulations of the new administration become finalized. Before we break, I'd also like to express CBIA's appreciation of its alliance with OSHA and CONN-OSHA over the past few years. It has been invaluable in assisting our members in their safety efforts. I'd also like to take time to personally thank the state's OSHA area directors, Dale Varney of the Hartford office and Steve Biasi of the Bridgeport office, and their staff. In particular, Paul Mangiafico and Marianne Bonito, who have been very helpful in addressing the needs of our members' OSHA inquiries. And I'd also like to express our thanks to CONN-OSHA's Catherine Zinser, who has been a tremendous assistance to our members. In a few moments, you'll notice an introduction for our 10:50 session, which provides you with a basis of the panel's presentation. Please take a moment to review it and submit questions you have for the panelists. But first, please join me in viewing this message from our sponsor, Fuss & O'Neill, followed by a refreshing break to stretch your legs. We'll come back in 10 minutes, and when you return, Robert Lemdowski, president of Fuss & O'Neill Manufacturing Solutions, will begin his presentation. Thank you.
looking for additional training resources for your company? Let CBIA help through our partnership with Training Network Now. Training Network Now has thousands of safety and health videos on topics ranging from sexual harassment prevention to ergonomics in the workplace working remotely. For more information regarding pricing, please contact CBIA Membership Director Joe Diaz at 860-244-1118.
Our company has always had a long history of sustainability, and to that fact, we look to CBIA to enhance a number of the other programs that we've been working on, which would include solar, rail, make-up air systems to heat our facility. We were also able to reduce our power cost consumption by hundreds of thousands of dollars. Our business is mainly centered around supplying a value-added raw material for both medical and food applications. I like to utilize them not just for the energy benefits, but especially during the pandemic, there was an awful lot of regulatory issues that we needed someone to use as a sounding board and to really just get through all the red tape and tell us exactly what we need to do so that our employees were safe and that we were in compliance.
Welcome back. Few events have impacted the safety of companies as much as the pandemic. The problems it presented were all-encompassing, causing companies to totally re-examine how they provided for their workforce safety in the face of numerous unforeseen obstacles. Robert Lewandowski, president of Manufacturing Solutions for Fuss & O'Neill, will speak to these challenges and how companies have created the appropriate safety systems in dealing with them and moving forward. Robert? Thank you.
Thank you very much, Philip. As Philip mentioned, as we go through the challenges that have been created by COVID-19, there have been numerous standards and challenges that we've had to deal with. And this presentation is going to go through some of those challenges. First, I have an off-take here. So some of the objectives that I have 4 key objectives that I just want to make sure that we recognize as part of this presentation. I want to walk through and identify some of the historical policy and procedure challenges that we've had to deal with throughout this 12 to 15 months. Want to provide an overview of the common workplace practices that I've experienced across the country based upon some state, federal, and other COVID guidance that we've all been recognizing. And then we'll walk through and look at how different companies have adjusted their safety culture and some of the things that they've been focusing on. And then finally, at the end of the presentation, I'll be looking and reviewing some of the things that we need to consider and what we need to watch for as we go into this next evolution dealing with the COVID situation. So again, you know, we had to deal with this whole coronavirus rollout. It happened, if we remember, back in the February-March timeframe. And again, it's something that surely we didn't expect, but that we've had to react to. So as we go through and deal with Corona, what have we been doing? There's been some very standardized and structured recommendations that have come out. This is obviously from the CDC website, but again, the standard recommendations included things like regular hand washing, covering our mouth and nose when coughing or sneezing, and then there are some other general recommendations related to virus control. Back in the early part of the pandemic, OSHA did put out, and they published back in April, they published an enforcement guidance for cases related to the COVID-19. And I would reiterate what Galen had mentioned in his presentation. The OSHA website, the www.osha.gov, is a great resource for going back to look for documentation and reference support for dealing with the COVID-19. So back in April, what OSHA did is they put out some enforcement guidance. And part of that enforcement guidance, which I think is important to recognize, and that I would still recommend that we review today, is that COVID-19 is a recordable illness, and we are responsible for recording cases of COVID-19, but there are some conditions that we must need to meet. In other words, the case needs to be a confirmed case of COVID-19. In other words, that there's been medical testing and verification that, in fact, the employee has COVID-19. The second step is that we have to confirm that the case is work-related. Galen talked about your investigation and your information collection. And what I would suggest is that talk to your employees, verify that, in fact, that they were in a situation where they were exposed to another person who was also diagnosed with COVID-19. And we need to work through validating that, in fact, the case is work-related. And there are some references that you can go back to where they talk about and substantiate what is work-related by definition. The third condition is that the case involves one or more of the general record-keeping criteria. In other words, the case is reported to be an illness, and all illnesses are recordable, that there was medical treatment, and that there was either loss or restricted work time. So again, that gets you into validation that it is in fact a recordable case for your record-keeping purposes. When there's ongoing community transmission, employers other than those in the healthcare industry, so you're seeing now they're taking a more broad approach, and what they're saying here is it is very reasonable that employers in other than the healthcare industry may have difficulty trying to determine and validate whether or not their worker or their employee contracted COVID as part of their work assignment. And what they're saying is OSHA will start to use some enforcement discretion trying to establish and validate that in fact the person did receive COVID as a result of a work-related exposure. OSHA will not enforce the record-keeping and some of the other obligations we have to make the work-related determination similar to what they would be responsible for in the healthcare. What OSHA is looking for an employer to do is to substantiate that there is objective evidence that in fact that the COVID-19 case was work-related. In other words, going back and doing your due diligence, interviewing your employee, and getting more information on either where they thought they were exposed or information that you have to substantiate that they were in fact exposed. The evidence is reasonably available to the employer. In other words, you can take the information and you can say that on a certain time, on a certain date, that the employee was exposed and that it is a work-related case. And then some of the enforcement obligations we still have is that employers, we still need to assure that our efforts within the workplace continually focus and reassure that we have implemented good hygiene practices in the workplace. Again, going back to information provided and published by the CDC is one of those ways to meet that obligation. All right? One of the changes that came out was back in April 16, a couple of days later, OSHA put out some additional information. And let's see if we can look at this. I apologize. OSHA understands that there are still challenges trying to figure out what is going on with the OSHA standards related to the health of their employees. And compliance officers are available to help with this, and they will provide you the information that you need to help make that determination. As part of the screening that an employer will use as part of these efforts, compliance health and safety officers will also evaluate whether the employer thoroughly exposed the employee to COVID-19 and that they have collected enough information to protect future exposures to those employees. So again, area offices, as Galen mentioned, are surely available to support that determination for employers. And those folks are willing to help you make that determination. We've had several challenges that we've had to deal with, and we'll go over a couple of those challenges that we've observed in different companies, again, across the country and surely in Connecticut. We've had a whole bunch of different rules that we've had to deal with. Surely OSHA has published some guidance information for us, but there are many other organizations that have put out information, many of which have been adopted by states. For example, the CDC has put out documentation, and I think it's safe to say that the CDC is really driving some of the compliance obligations and some of the best practices that are being implemented not only by states but also by workplaces. In our state, the state of Connecticut Department of Public Health put out some very good guidance information. There was specific information related to higher education, and there were some obligations that were needed depending upon the type of industry that you're in. I'm also aware of some companies that put out company-specific requirements related to specific rules that their employees needed to follow throughout this whole 12 to 15 month period, whether it was stay-at-home protocols, whether it was medical exams, pre-work screening, and some of those common types of things. So again, which rules are we following? Some of the challenges that we had was trying to meet the obligations of all of those rules while at the same time trying to stay in business. And some of those rules were in conflict and made it very difficult to do what some of us were trying to do. So when we look at where we've been, our success and our program success has been directly related to the planning. And you can see the quote from President Eisenhower or General Eisenhower at the time, but planning is more important than the plan. And I would say, even in my time in the manufacturing environment, I don't know that I would have ever planned for a pandemic such as this, but there are many other plans that we would have implemented or would have established where we would have been in pretty good shape. And I think we need to go back to start to look at the planning, because in many cases our planning was not sufficient to address this, and I think we've all experienced that. When we look at some of the things that where we didn't plan for, when we look at resource capacity, and surely this is a photograph of an ED, but we surely never had encountered anything like this where we would expect the level and the quantity of personal protective equipment that we were going to need, surely in the hospital setting, but even in the workplace setting. Might be very common for us to have, some boxes of N95 respirators, or maybe we have filtering face pieces for the dusty environment, but we surely were not prepared for the capacity need that turned into what we were experiencing in March and April and sort of down into the summer. And we'll talk about some of the medical supplies that we've been challenged to get, as well as space requirements. Think about the 6-foot rule and how that has affected our ability to do in-house training, or to have meetings, or to at least collaborate in the workplace. So the 6-foot rule has really changed the way we've been doing business. And one example of that is the forum that we're in today. I can remember years ago where the Safety and Health Conference was back at the AquaTurf, and we were doing this in person. So just the space and the obligations that we have today have really affected our resource capability and the resource capacity that we have, something that we never planned for. Going to step back a little bit. Here's a February publication, again, from the CDC. And we're going to talk about some of the things that have been changing, because the environment continues to change. Even today, almost 15 months later, things are changing, right? The goalposts are moving. But back in February, the CDC was not recommending the use of facial coverings among the general public. And we can see, boy, has that changed, right? We can't go into the general public without having some type of face covering on. They did qualify that there may be the need for facial coverings for people who have an increased risk of exposure, but generally speaking, facial coverings were not recommended. And again, boy, has that changed, right? So once facial coverings changed and the requirements and communication and different outlets, the reaction was this type of situation where we looked at material collection, I'll call it. I think that's the safe way to say. You couldn't go to the supermarket or to Costco or any other outlet to get the essential needs of what we would have from the home front. And when we look at not only this type of material, but who would imagine that we would be paying $10 for a roll of toilet paper, right? And again, they were now selling them by the roll and no longer by the case. And it's interestingly enough that there were these segments of how things changed over time, where there was, meat was a challenge to get. So then all of a sudden, nobody could get meat anywhere. So things really, really changed in our community. From the workforce perspective, the face covering challenge then emerged, right? And who would have imagined that you couldn't call Grainger and get a box of 3M N95s and have them overnighted to your workplace or to your facility so you could use them for respiratory protection of your employees. And, face masks now, and I'm talking a simple face mask, not an N95 respirator, a box of 10 face masks, as the illustration shows, was upwards of $50. And I know of more price increases above that during the period, right? So who would have thought that we would be having to deal with this type of exposure and this type of situation? Something that I would have never, ever thought about. So the shortage that we had by people and organizations and the lack of resources and the changing environment, right? The fabric for respiratory protection was changing and it was getting consumed for different purposes. But then we got into what do we do in the medical field, surely, for cleaning and reusing N95 respirators. And again, something that from an industrial hygiene standpoint, we would have never had a discussion about was reusing N95 respirators. And now there are full discussions and full studies on how long can we use an N95 respirator. And again, it's that changing environment. What do we do? How do we do it? And is it safe for us to do that? And then how do we react if we can't get more N95 respirators? I think Ken, when he talked about the ESF planning side, their information was very influential, trying to get other adopted standards sort of allowed into the industry. We would have never seen a KN95 in the workplace. Now, you can't go anywhere without seeing a KN95 respirator. Well, the standards are very similar for the NIOSH testing criteria for the respirator, but they're not really the same. They're close, but they're not really the same. But today, we've had to make those accommodations in order to meet the need that we have. So we've been pretty lucky. Again, we're still dealing with the shortage that we have of our equipment. So again, back to some of the challenges. We sure did recognize and see an outreach from the community. And I know from a Fuss and O'Neill perspective, when we were doing training for different type of EPA classes the HAZWOPER classes or the site worker classes, we had a backlog of respiratory protection, and we made donations to local area hospitals because there surely was the need. I know of quilting organizations who would work on sewing face coverings and all these other types of initiatives in order to do the right thing to protect the airborne exposure that was becoming more recognized as the pathway of exposure to address our needs in the community. So here's a school system that donated 1,600 face masks and goggles and surgical caps and all the other things that were needed surely by the medical personnel or the hospital personnel. So those donations were nice, and we pat ourselves on the back. The challenge that we create, though, is in the medical field. Now, how do you keep up with the fit testing or the equipment monitoring, the condition assessment, the employee training? Where are we going to store all this stuff, right? There are a lot of challenges that, while surely appreciated, that were definitely created by all of these donations and all of the outreach that came in. In discussions with several of our local area hospitals here in the Hartford area, what I experienced was that the hospitals were challenged with scheduling work assignments for people as they were working these 12, 14, 16-hour days. How do they share their resources amongst their different hospitals or different locations? So we might have an employee in a Hartford hospital that was fit tested for a certain type of respirator or a certain type of N95, and then tomorrow they're going to be relocated to another site which would have different N95s available. How do we keep up, or how does that hospital keep up with the retraining, re-education, fit testing, and assuring that that employee is safe to meet the obligations that that hospital has? And again, surely the hospital exposure is something that was significant. So again, back to the healthcare challenges, the donations were surely appreciated, but how now do we deal with this, and how do we keep that straight face test to say that we've done our due diligence to make sure that we're doing the right thing for our employees? So again, some of the challenges. Manufacturing had those challenges as well. Again, now that we've gone to less equipment that's readily available, we've used it, but now we can't get the replacement. How do we stay in business for the conditions or the work conditions that need that type or that level of protection? Again, what do we do for training? How do we maintain the equipment? And how do we manage our production obligations? So there are some new safety systems that we've observed over the past year. And again, there's been a lot of technology. There's been a lot of best practices that have been developed. And we're going to go through some of those best practices, and we'll talk about what companies have done to roll those out. And some of these have been very effective. They've been unique, and they've adjusted based upon different information that has come out either from their public health department or from the operations or the processes that those companies need for their workers. I'm going to go back to the success and our ability to plan. It was interesting that Ken talked about his role in the ESF function, in the logistics function. If you think about where we used to be back, I'm going to say in the mid 2000s, right, 2008, 2009. I'm sure many of us who are in this forum had to deal with or had to assess our workplace under the top screen, the Homeland Security program that was rolled out. And in that period, if you remember, we were very focused on chemical exposure, weapons of mass destruction, blistering agents, blood agents, those types of things. Our community did a very good job planning for those types of events. Viruses were never on our radar screen. We did a great job with the rollout or the acquisition of resources that were rolled out to our community. Mass decontamination trailers, they're sprinkled across the state. Chemical protective clothing, A-level suits, respiratory protection, meters, all this type of equipment that was rolled out for, again, this type of chemical exposure, but not for the virus exposure that we're dealing with today. It wasn't even on our radar screen. Well, it's surely on our radar screen today. So now when we look forward to how should we plan, what do we need to change? I understand that our planning for bacteria, we need to, and viruses, we still need to look at what's the pathway of exposure, how are people going to transmit it, person to person, as well as the flat surface to person or other different means of exposure. So again, our planning sequence has changed, and our success is going to be directly related to our ability for planning and identification. So again, it's going to be a change, and it's a great opportunity for us. And there's a lot of resources that are going into this. And I think we can see that as the vaccine is changing in response to how COVID is changing, right? We've seen surely an identification that COVID is morphing. Well, our vaccines probably will follow suit as our technology increases. This is a local workplace readiness guide. I don't know if it's readily available, but I will compliment Cushman and Wakefield. They really did a good rollout for their clients. And they came up with sort of this 6-step process for getting your workplace ready to deal with COVID, and then getting your workplace ready to get people back into the workplace so we could get back to some type of normal operation, normal condition. So there's a whole bunch of bullets here, but generally, I'm actually not sure how easy it is for you to read, but in generally, what they're doing is they're giving you some key considerations and key steps to prepare your building, going back and educating your workforce and preparing your workforce. And I think at the time, we surely didn't look at the vaccine or the vaccine programs that are out there today, but I think we should be adding another box to that related to preparing and educating the workforce for the vaccine. Controlling access into our facilities, not only for our employees, but also visitors, vendors, and other personnel who may be coming in, and creating that social distancing plan. Again, we've talked about the 6-foot rule, but really, how do you plan for that? And how do you roll that out in your facility? And again, Cushman and Wakefield did a pretty good job rolling out and putting in some meat to the program that they would recommend. Again, it was a good program. I think they've done a good job with that. A lot of other companies, and this is an electric boat safety bulletin, as you can see, a lot of companies put out their own standardized criteria, and they said, listen, if you're going to come to our facility, you're going to need to go through these steps. And I have multiple examples of this. But again, safety and health of the workplace really became paramount through the health side and the employee screening and the obligations that have really led to what I'm going to call standardized best practices. Think about it, we can't even go into the community today without seeing on every door or every entry or access platform that face coverings are required before entering this building or this work area, right? So again, a lot of companies like General Dynamics, put out a safety message, a safety bulletin that says if you want to continue to work here, these are going to be some of the things that you're going to need to do. So again, there's a lot of these. I don't know how many organizations set up protocols for doing this, but as I've gone around the country going to different companies, I don't know that I've gone to a company that didn't have some type of pre-entry obligation. So that was really good. Obviously, occupancy limitations and establishing occupancy restrictions in different work areas. This is from Fuss & O'Neill. This is an example of a posting that we generated that went into our different common space. So this was in our training rooms and in our kitchenette areas, obviously restrooms, and those types of areas in our facility where we needed to maintain that 6 foot distance. And actually, it's not just 6 feet, it's really 36 feet, right? You have 6 feet on each side, so it's really 36 square feet that we're looking at per person. So when we're planning for how to maintain that distance, we did it through occupancy limitations. Some of the other improvements that organizations have done, and they continue to do, include different improvements to their mechanical ventilation systems, whether it's through increased filtering or through other technologies, say as UV protection. When you looked at the HVA system improvements, the occupancy limitation surely improved the amount of fresh air per person as a percentage, right? If you have less people in a room, then there's more fresh air, more clean air for that person. So there's sort of a double benefit there. But many companies went back and looked at their HVAC system capacity, and they changed the settings on their HVAC systems so they were allowed to get more fresh air into different areas of their facility. So they would get more fresh air and air exchanges in different work areas. I'm going to go back up to filtering. I'm sure, and we'll go over filtering a little bit more here in a minute, but filtering was a big deal as well. Oftentimes, filters that are used in HVAC systems have a certain efficiency to them. Some are gross filters that are really filtering out just the big things, pieces of grass and leaves and that type of stuff. And what we're looking at now, and I'm sure you've seen, is to see filtering where people are trying to, or companies are trying to improve filtering to the HEPA 97% efficient or 99% efficient for their systems and fresh air that's getting returned back into the workplace. The one caution that I've always promoted is that you need to make sure that if you're going to increase the filtering efficiency, you need to validate that your HVAC system can actually take that amount of pressure drop across that filter. Are you still able to push through and move the fresh air needed for the occupancy that you're going to have in that building? But again, occupancy limitations, HVAC improvements, and then different technology that's being used has all been part of the changes that have come into the work environment. So on the mechanical systems, I wanted to throw up an image here. You can see in the upper right-hand side of that image the box filter for a HEPA filter or a higher efficiency filter is a much larger, it's a much thicker filter. They're increasing that surface area of that filter so they can get a greater efficiency value. So we talked about this minimum efficiency reporting value. You'll see that as a MERV value. So the MERV 6 filter surely does not have the filtering efficiency of a MERV 14 or a MERV 16 filter. So there's a particle size that we deal with when we look at the filtering efficiency. And you can see as particle size changes, and particle size in micrometers is down at the bottom of this chart. You can see that as particle size changes, that also influences the filter efficiency based upon that particle size. One of the questions, and I think I've put it on this slide, is what's the size of the coronavirus? Well, the coronavirus, there's different information, there's different measurements that have been used, but generally speaking, the coronavirus is around 0.1 micron. So if you use that that as the basis for your filter plans, you should be able to look at your mechanical system, and maybe something that you could consider would be looking at mechanical system improvements simply through better and increased filtration. And this would be increasing your filtration for air that's getting brought back into the workplace, and to make sure that any of that returned air is filtered much better. Some of the challenges that we have with mechanical systems, just to make sure that we come full circle, is that when we have mechanical systems being used, is that we validate that the system can use the filter, that the system has the capacity to use the filter, and that we have the ability of that the mechanical system has the ability to actually capture the virus. There have been many studies, many publications that show that, again, back to the 6-foot rule, that at about 6 feet, sort of the particles that we are exhaling sort of fall out. They drop to the floor, they drop to that flat surface at about 6 feet. So the challenge that we have is we've increased the filter efficiency for a unit that is probably located on our roof or above our ceiling. And how are we going to take in the air to capture something that has fallen to that flat surface? That's one of those challenges that we have. So we need to make sure that our mechanical system has the ability to capture that airborne virus. So that's something that you need to look at if you're considering looking at your mechanical systems as a means to improve ventilation in your facility. So a couple of the other things that are out there. So again, back to publications and employee communication. We're going to see many of these going across different companies, but symptoms of the coronavirus, and putting up symptoms so that people know what they should be looking for, not only for themselves, but also for their coworkers. And a common theme that I've seen in the workplace, and that's been out there, is, listen, if you feel sick, stay home. And if you see someone who is sick, send them home. And if you get sick while you are at work, go home. So again, keeping that communication going with employees and colleagues so that they know what's going on in the workplace. I think the CDC really has done a very good job providing publications that we can print and use and rotate through our workplace, so we can keep the information flowing with our colleagues in the workplace. So again, back to some ongoing information: seek medical care immediately if someone has some of these signs of the COVID-19, all right? So, and again, there's a great CDC. This is one of the publications that I think is very good, and again, we should keep these going. Back to some general education related to how to wear a face covering. And we see it all the time where people really haven't either thoroughly understood or have an appreciation for how to properly wear a face mask. Whether it's they position this face mask below their nose, or they don't have it stretched out below the chin, or they simply just wear it below their chin. But again, getting education out there so people understand how to properly wear a face mask. It sounds basic, but it's one of the things that if we didn't educate people correctly, then they really don't understand, because most people have never worn a face mask until now we have the COVID situation that we're dealing with. Screening programs. I'm sure many companies, and again, this is a local company over in Manchester, Connecticut. They have a temperature screening. So when you walk through the door, stand on the 2 feet, and they're going to take your picture. You can see the setup that they're using, where they have you stand on the yellow dot. They take your picture with the camera. It comes up on the computer screen. It's on that cart. And then if you have your temperature is below the magic, 100.9 or 101 or whatever the company may be using, they might be following the standard guidelines, or maybe they've put something more restrictive in place. Then they go through a whole bunch of different questionnaires while you're a captive audience behind the screen. I've been to this workplace many times, and every time that I've gone here, they ask the same questions and they do the same screening. And this company is very vigilant about their screening program, and it's been very effective for them. So again, one example of a screening program that's being used. Whoops, I passed by one. I apologize. I must hit the button too fast. See if I can keep this one. Here it is. Another form of temperature screening that has been used has been walking up to these iPod type devices or these camera devices where you stand in front and it gives you the go, no-go opportunity. There's a selfie of me with the I'm screened and I'm good, green is good. And you can see that it's reading right through the face covering, so the face covering is not an impediment to the temperature screening. It might be hard to see, but I had to get my head sort of in the optimum circle so it could really read my temperature. I can't even read my temperature in that. I just know that I was green, so green is good. But I thought this was a pretty good example. So before you even get through the door, you're being screened and recorded, and it's worked out well for them. This company, additionally, has had no positive cases of COVID since they've been implementing this temperature screening. There are some challenges related to temperature screening, obviously, that there are some asymptomatic or people who are not showing the signs or symptoms of COVID-19. But I think temperature screening is probably one of the easiest ways to at least do an initial assessment. There is a facility up by Bradley Airport, so a large manufacturing facility. They've performed over 275,000 temperature screenings, and they have identified 6 cases where they had to return the employee. They didn't allow the employee to enter the workplace. So again, 275,000 screenings has taken a great deal of resources, but this company absolutely is an essential worker or an essential company with essential workers, and they need to stay in business, as all of us do. And they took this very seriously, so they implemented the resources necessary to do the screening, the temperature screening that they put in place. One of the things that we did at Fuss & O'Neill as an example, and actually this is probably one of the more common plans that I've seen, and this was a screening that we implemented back. We revised it, and as of March, this was the newest thing. It's still posted on our facilities today, where we actually, before you even open the door, you need to do your own self-assessment. And if you answer yes to any of the questions, unfortunately, we're going to ask you to turn around and to not enter our facility. Our receptionist does the same thing. She's going to ask you the same questions. And again, if you answer anything in the positive or the affirmative, then we're gonna send you out of the facility. Pre-screening. Oh, so on the pre-screening side, one of the other things that we did is, and I'm sure many companies have this. Fuss & O'Neill, from a consulting perspective, we visit companies throughout New England and many areas in the United States. So one of the additional obligations that we implemented, we used this same assessment criteria, and we put it as a screening tool on your cell phone. So every day, if you were not working from home, you had to enter, it's one of our portals, you had to enter your portal on your cell phone, and you had to go through the screening questionnaire in order to substantiate that you were actually safe to go and do the jobs and the consulting services that we were doing. And if you answered no, and one of the examples of the question that we commonly ran into was, have you traveled to a state that was what Connecticut considered to be a red state, or a state that had a high rate of COVID-19? And if you answered yes, that you've been traveling, then that meant that you actually couldn't go out into the field. You then had to contact your supervisor, and you had to go through some additional screening obligations to substantiate why you went to that state and some of the things that you now needed to do. We were very active with testing for COVID. There were many of us who traveled and through Bradley Airport, and at the bottom of the escalator, take a right-hand turn to go get COVID testing. And then we needed to not return to work for the 3 days until we could get the results positive or negative. And if they were positive that, in fact, someone came back with COVID, then we had to then follow the restrictive protocol of the 2 weeks off. So those are some of the things that we did that worked out pretty well. And again, we made it easy for people to self-screen. Some of the companies that I've seen now are trying to figure out at what point they can return to what I'm going to call normal operations. A couple of weeks ago in Chicago, I was visiting this company, Trimtex, and they were arguing amongst themselves that at what rate were they going to, as their thermometer goes up, what rate were they going to allow people to come back to normal work? 50% was their initial target. I think they've raised it up a little bit higher, more in the 60% range. So when their employees are 60% of their employees are vaccinated, that's going to start to open up the door for more people to come back to work. And again, they are really strongly promoting the vaccine and getting their workplace and employees educated for the value of the COVID vaccine series, or whether it's the Moderna or the 2-shot with the Pfizer, or the single shot with the J&J. So again, this is a visual so that they could have their employees continue to promote their peers to get vaccinated. Following up with Ken and Galen, this is that national emphasis program that's out there. It might be a little hard for you to read, but as Galen had mentioned, these are the Appendix A and Appendix B companies who, if you're one of these companies, I would make sure that your ducks are in order based upon your NAICS code, your North American Industrial Classification Code. I've only taken a couple of snapshots here, but again, go to the OSHA website, the OSHA.gov, and print out this NEP. It's actually readable, and it's easy to follow. There's a lot of protective measures that they use for the compliance officers, but again, you can see some of the targeted NAICS codes that they're going to be looking at. And again, I think it's a good document to understand what they're looking for, and it gives you some insight as to what they're going to do. So some of the other focus that I think I would have offered to Galen and to Ken, just upon what I've been experiencing, is to assure that if you've had a COVID case, that you are logging it as an illness, and all illnesses are recordable. So going back into your 2020 and your current 2021 record keeping to make sure that it's accurate, and making sure that your investigations are thorough, and to go back and to make sure that if in fact medical treatment was offered or was administered, that in fact it now has become a recordable case. Your on-site inspection, if they are going to come on site, or maybe it's through some type of web-based or phone interview, is that you're prepared to talk about your fit testing protocols for your N95 and your training program. What have you done, and can you document and substantiate some of the things that you say that you've done in your workplace? I agree also with what Galen said. We were all required to do PPE assessments to determine what PPE was required in the workplace. We need to update those assessments to include now what we've been doing for COVID protection. So those are some of the, I think, from the OSHA focus side that I would have additionally offered for Galen and from the CONN-OSHA perspective as well, so that you're well prepared for any type of inspection or any type of inquiry that they may be making. And again, if you have a question, surely reach out to, whether you're in the Bridgeport office or in the Hartford area office, if you're in that region, reach out to the local area office and get the information that you're looking for. They're very helpful. Ergonomics, I believe this is probably one of the hidden exposures that we haven't really taken into account. Again, with all of the different telecommuters and all the different people working at home, we as employers don't have a great understanding of what the workplace looks like now. And the definition of workplace is really important. And this is our workplace. And so what have our employees been doing at their workplace? And do we in fact have to start to record any type of ergonomic related conditions that really were never considered for people when they were told to go home, the shelter in place mandates, right? Or if they were home because of some type of exposure. So again, I believe that ergonomics is really a place where we want to go. In the future, I think you're going to see movements to the sit-stand desk program, to a lot of standing rotation. That type of movement is really important, and I think we need to continue to roll this out to people who are working at home so that they're not in that static position, and if necessary, we get them the resources that they need. So again, I think ergonomics is one of those hidden things that we really do need to look at. There's been a lot of changes, and again, with people being home, we really don't know what that workplace looks like. So again, getting education programs out there, early intervention, getting people to understand some of the workplace ergonomics, and those types of different opportunities. And again, this is a screenshot that we used. It was an all-employee distribution. I'm sure everyone's familiar with those, where we've put this out so that people can understand, and we continually refresh this as part of our safety moment. We start every meeting with a safety moment, so we go through and we talk about ergonomics and our JHA process and that type of thing. So again, ergonomics is that hidden condition. Just a final thought before this is our last slide, and just one quick final thought that I wanted to offer. We have a variety of annual obligations that we want to consider and that we don't want to lose sight of, okay? So I just put up a couple of quick items here that I want to make sure that we don't lose sight. And again, I'm not going to go through all of these, but again, these are things that I think you would want to take away to make sure that, we didn't miss one of the details. And again, we talked about bloodborne pathogens or some type of toxic material where we've been dealing with a material that now we have to do an annual training obligation, or any of the confined space stuff depending upon your program. And again, you can see the list. There's a lot of things here that we have annual obligations for. I recommend we go back and take the time to make sure we've done our due diligence so that we don't miss anything. Thank you.
Robert, we do have a number of questions for you. The first one being, we spend a great deal of money to clean everyone's office and flat surface areas. Is this really the most effective approach, or is there something else you would suggest we consider?
You know, that's a good question that we continue to see. When we look at flat surface exposures, flat surface exposures are really, they've been proven to not really be the primary pathway of exposure. And if I were to make a recommendation, my recommendation would be to focus on cleaning the air. It's the work environment, it's the air environment. COVID-19 is an airborne exposure, and we need to focus on air as really the primary method of controlling exposure for our workplace. So I would look at whether it's filtering efficiency or the different technologies that are available. That's where I think companies should start to really focus on as we move forward and people start to come back to work.
Thank you. As you and Galen have emphasized the importance of communication, this question is in that light. Our company was lucky enough to acquire N95 masks, and we have ordered different types based on availability. We have never really trained anybody, but did post information on the communication board. Is that enough?
So N95s still are considered respiratory protection. And if you're going to be using N95s as a mechanism for airborne exposure control, then you do have that obligation for fit testing, training, and medical exams. Just making sure that people are qualified and medically qualified to wear that equipment. There are some provisions in the respiratory protection regulation that allow for respiratory protection use for convenience purposes. And if you can substantiate that you're using N95 respirators only for convenience purposes, then you could post the mandatory Appendix D that's in the regulation, and it's available, again, on the OSHA website. You could post Appendix D and then sort of validate that people are, in fact, wearing N95 respirators correctly. Not all respirators are the same, so I would continue to recommend that don't have just one brand of N95. I would reinforce that you really need to have a variety, and luckily today I think N95s are becoming more readily available, but again, N95s do have an obligation as respiratory protection.
We have a couple more. Do you have a few quick suggestions that we can use to promote a safety-conscious culture?
Yeah, I actually wrote a couple down. So again, I think when we go through the culture improvements, we need to stay focused on education, and I don't want to say it's training, but I want to say that let's use the term education. Making sure that people understand the value of maintaining social distancing, right? We've talked about it, but maybe we need to reinforce that in our workplace. So making sure that people understand those values. All too often, and I think we see this if you watch the news or if you just listen to the radio, the challenges that we have to for people to understand the value of vaccinations. So we need to educate people on vaccines and the value of the vaccination series that they should be performing or obtaining. And we should be supporting our employees to go get that vaccine. I have heard of some companies offering some time off that if, listen, you want to go get your vaccine and you can get an appointment at 2 o'clock, we will give you the time off so you can go get your vaccine. And I think that's been very well received. And again, just reminding people of personal space. I think those are the values that we could get out of education.
Thank you, Robert. You've given us much to think about and to incorporate in our safety initiatives in the months ahead. We thank you very much for this very informative presentation. Please take a 10-minute break, and then we will return with our panel. Remember to submit your questions to them using the Q&A function. We'll be right back.
not interesting to talk to anymore. Goodbye. But that real love, that love that sometimes is difficult to have, that's that love.
Are you aware of CBIA's extensive member savings offerings? Learn more about programs like our partnership with Training Network Now, an online service which offers safety and health training videos for your employees.
Just an incredibly difficult year for everybody. And from the beginning, I would call CBIA and say, listen, I've got this issue. Help me understand, clarify, translate for me. They are my go-to source. We're talking, plus 20 years for sure. O&G is close to celebrating their 100th anniversary in 2023. We have organizations and construction sites throughout the state of Connecticut. There's strong focus on the education market, particularly our schools. At the end of the day, as an HR practitioner, you have a core set of trusted resources, and CBIA is one of them for me.
I'm delighted to have as our panel on our how individual companies dealt with and plan on dealing with COVID and future such challenges. We have representatives from DATCO, Bartlett Brainerd and ECOT, LeGrand, TTM Technologies. We have Melissa Noyes, the safety manager of Comatics, who will serve as the moderator for this discussion. Good morning, Melissa.
Okay, ready to go? Hi, everyone. Thank you so much. All set? Okay, sorry about that. So thank you so much for being here today and listening to all the wonderful things that we just heard from all of the other presentations this morning. We will be touching on some of those today. The group, specifically our team, will be here. We'll be talking about how we can really help you all as a team and answer questions. So first off, I'm going to read through all of our bios, and we do have our Larry calling in as well. So we do have live and also virtual, so welcome Larry as well. So I'm going to go through the bios for each of the groups. So first I'll start with Marco Carr. He is the Director of Safety Operations for Bartlett, Brainerd, and ECOT. Marco is responsible for the day-to-day safety operations and oversight for Bartlett, Brainerd, and ECOT, a general contractor, construction manager with self-performed labor and carpentry operations. Key focus areas include pre-task planning, coordination, communication with project managers, superintendents, subcontractors, and employees to mitigate risk and control exposures, with special emphasis on identifying risk prior to work. He's also responsible for safety record keeping, training, and claims management. Mr. Carr has been working in the construction industry since 1983 and focused on construction safety as a career since 1989. He has worked with and for contractors large and small around the country, consulting, training, motivating, and driving the message of life, health, and safety as core values of any organization. His varied background and field experience give him a unique outlook on the concepts of safety culture, risk management, and employee engagement. Equally at home, in the field, or in the boardroom, he continually presses for change and improvement in our fast-paced industry. Also, as a side note, I think he's an excellent MC, so I'm very glad he's here today to help me through this process. So Marco, if you just want to say a quick hi.
Hi, everybody. It's funny to listen to a bio like that and realize all that we do and all that we balance. So many of us have so many tasks that we have to perform on a daily basis. And I know that the past year has been a struggle for many of us. I'm happy to be here and share the stories that I can and the insights that I have over the years. And it's kind of funny as we look out and we see ourselves on the monitor in front of us. We talk about being comfortable in the boardroom or on the job site, and I'm looking at myself with a suit jacket on and work boots because I just came off a job site. So,
yep.
Glad to be here.
Thank you so much. I'm going to go on to Larry, and Larry is the Director of Environmental Health and Safety Affairs for the North and Central American Business Unit of LeGrand Electric. Welcome, Larry. It's good to see you. Even you're on the screen here. I'm going to go through his bio real quick, and then I'll just have Larry do a quick intro similar to Marco. So LeGrand is a $7 billion manufacturer of electrical products and systems, headquartered locally in West Hartford, Connecticut. Larry has an electrical engineering background and over 35 years of experience in manufacturing in several industries, including high-volume device manufacturing, telecommunication, and aerospace. In his current role, Larry is responsible for the creation, implementation, and monitoring of LeGrand's COVID-19 response policies in over 50 North American locations. And a side note, Larry, so where are you right now, though?
Well, right now I'm working remotely like all of our people who can do that. So I'm based out of Florida. So it's rather nice here, but I'm happy to be with you all virtually. LeGrand's challenges are really around a distributed set of locations, variety of facility sizes and activities. So, it's been an interesting challenge, I guess. It's something that the company has had to really rethink how we do business. So happy to share what we've learned and with the group.
Definitely, yeah, and of course, being in Florida, that'll be maybe a topic that others who have other companies around the country may have some questions for that area. I'll move on to Frank. Frank is the Assistant Vice President Safety and Risk Management for DATCO Inc., Thermo King Northeast, and Accelerated Property Management. Wow. We were just talking today about this. So Frank is responsible for all areas of operational compliance for transportation and workplace safety security, HR support, and as a civil trial preparation specialist. Frank joined DATCO in 2012 after 25 years in law enforcement, retiring at the rank of lieutenant with the Connecticut Department of Motor Vehicles, Commercial Vehicle Safety Division, and other state agency executive level positions. He also served as commanding officer of various law enforcement and divisional units, including internal affairs, for auto theft, facility security, crime and loss prevention, OSHA compliance, traffic enforcement, automotive dealership investigation, liaison to the Connecticut Attorney General's Office, statutory regulatory review, transportation carrier compliance, vehicle inspections, standards, and commercial insurance. Frank held positions as Executive Officer and Chief of Staff for the Bureau Chief of Safety and Enforcement and command assignments in conjunction with the Department of Homeland Security as Agency Tourism Liaison Officer, Connecticut State Police Auto Theft and Motor Vehicle Fraud Task Forces, Police Officer Standards and Training Council Instructor, Division Manager, and Connecticut State Police Unit Citation Award recipient. He also served as a consultant to the Connecticut DMV and in private industry in various corporate clients on matters of business compliance and continuity, employee relations, change management, and managerial development. He's also provided professional services in areas such as advanced interview and interrogation, personality assessment, managerial counselor, performance coach, behavioral modification, and strategic plan facilitator. So, Frank, welcome. I will introduce, if you want to introduce yourself.
Well, I can't top that.
That was pretty
awesome.
I
wrote it myself. Thank you, everyone, for the opportunity to be here. Throughout my career, I've always felt that people are a business's greatest asset. No matter what we're talking about, the pride that I have in being able to explain and go through some of the things and the challenges that we faced, but also to showcase the tremendous resources brought to bear by the Connecticut Businesses and Industries Association, which we are a proud member. There's no way that any one person can know everything and every topic and become an expert facilitator on any one subject matter without the help of our colleagues, our coworkers, and the trade associations that we choose to belong to. So thank you for the opportunity to be here. I hope to learn as much as I can impart as far as the experiences that we've dealt with.
Definitely, I appreciate that. And I wanted to just mention, so Frank's aspect from the public factor, we did talk a lot about the public sector this morning, he and I think that for those of you who were waiting on maybe questions on the public sector could also benefit from talking to Frank about that as well. And then last but certainly not least, I will go with Charles here. Charles is the Senior Director of EH&S Sustainability for North America, TTM Technologies. Charles has worked for TTM since 2004 with EH&S responsibilities of 18 facilities in 10 states and Canada. His COVID-19 essential business response accomplishments include developing and leading the 10-person North American SLT comprised of leaders from operations, EH&S, HR, sales, and supply chain. He's been integral in guiding this SLT and directing manufacturing and office COVID-19 practices, preventative measures, routine site tasks such as audits and verifications, and best management practices. He is accountable for drafting all weekly and bi-weekly COVID-19 related communications, including communications to a population of over 6,000 employees. So, welcome, Charles.
Thank you. Nice to be here. I appreciate the opportunity. At TTM, we looked at COVID as an opportunity to measure our operational flexibility. And I think we're fairly pleased with how we came out the other side. It's made us a better company. It's made us a stronger company. And we really look forward to 2021 to be able to now exercise what we learned in 2020. Thank you.
No problem. And all of us on this panel, including Larry, I know that we all are just really glad to be here and share our experiences. We all have very varied backgrounds, but we all, when we started coming together for this panel, we actually realized that we all have a lot in common when it comes to COVID and how we've responded, which is why I think Philip was so glad to see us all come together and hopefully bring you all some good feedback. I know that for you on the call or on the computer, please get your questions ready. We do have some questions in case you're not sure or uncertain. Just to let you know, I'm sure I speak for everyone. There is no stupid question when it comes to COVID because we've all been through it and we're all still living it. And you heard from Rob and from OSHA, and all of these things ring true for all of us. Doesn't matter how big or how small your company is. So I really wanted to make sure many of us understand that, we're kind of representing pretty large companies, but there are smaller companies that are a part of CBIA, and a lot of us are actually responsible for even small, 10 to 15, offices with people that are just maybe 2 or 3 people in each one, and we still are supporting those people in their everyday. So please make sure you ask those questions, and this is we want to make this informal. We want to be able to answer your questions and be here for you. So now that you've seen our bio, one of the things that our team came together with is really how do we deal with the challenges? And one of the biggest things was we have sort of 4 topics we're going to talk through. One is we built a foundation. The second one is a business continuity plan. The third one is accountability. And then the fourth one is employee well-being. None of these are more important than the other. We all came together with this, and we'll talk a little bit more how each of us worked through these challenges for each of these. So, Larry, I'm going to start with you to talk about how at your organization you started with building a foundation once COVID started to really kind of hit our country and our companies.
Right. I think it started right at the top. Our senior executive team formed a working group. We call it the core team, really to coordinate all activities, to define policy, and then to make sure that the policy was implemented. Our situation is one of multiple locations of varying sizes. You mentioned small organizations. We have some sites that have 25 people in them, up to some that have 1,000. So really, it was important for us to send a message right from the top that we're all going to do this the same way. We're going to set a policy. We will keep an eye on it. So we were meeting daily initially. Now we've backed off to weekly, but these meetings still go on. So really, that was really the foundation, is setting a consistent message and then providing the tools via the policies for everybody to implement locally. And then we would copy that same model locally where the site leader would set up their team, and then we would coordinate through these teams. So, for an organization of our size, communication is a huge challenge. You have to make sure that message is consistent and clear and delivered when it needs to be delivered. Otherwise, people are going to do, what they think is right, which may not always be the case. So that's how we started.
Okay. All right. Thank you very much. Do any of you have a feedback on kind of what Larry was just talking about? I know each of us have talked individually about how our organizations really started at the top. So Frank, I'll actually start with you.
Sure, Melissa, I can only offer that the core business principles of whatever business we're talking about stay the same from the head down. So your executive team establishes what the business model would be. But intrinsic to that is each and every step of change. So reacting to whatever situation presents itself is going to be managed upstream. So in order for us to make sure that there's no dilution of effort, the executive team sets a path, it establishes a budget, and sets the marching orders. But the downstream portion of that has to be managed, and it has to be coached, and it has to be supported. So in this, I can only offer you an analogy that I remember many years ago is facilitating what they call the Toastmaster session. And they give you 5 minutes to prepare for a 5-minute speech. And you get your 5 minutes and you put your notes together and you put your timelines together and you get up and you go do that. And then the moderator would say, give me your notes, I'm tearing them up, start from scratch, you got to do this impromptu and make it work. We found ourselves doing that daily. And the aspect of communication and the levels of communication and the forms of communication were critical to that success. So each and every one of the high points that you hit, I would say, are intrinsic in any business as it exists, but any change under duress becomes increasingly more difficult and almost impossible at times if you cannot rely on what you've already established.
Okay. And so I guess the next point that I would ask you this, Charles. So when we start with the tone, like we just mentioned, you start from this top-down tone, changing on a regular basis, being adaptable. What were some of the things that you all did from a communication perspective throughout all the different locations to help with that?
So you have to have a single voice, and so we had typically, similar to what Larry indicated, we had an SLT, a senior leadership team, and there was a senior leadership team at the executive, at the North American, and at the local level. And all communication went through the SLT, and it was a single form of communication, single topic, and it only came out of one SLT. And then that was communicated to the local sites, and a set of expectations were laid out for those local sites, as well as a path to success. So the North American SLT was responsible for making the local SLT successful. Failure was not an option, and the changes happened very rapidly. Sometimes every 24-hour cycle, there would be a change to how we went about something because of what we reviewed during contact tracing in the prior 12 hours. Mm-hmm. And so that contact tracing drove changes in practices, and those changes in practices were rolled out to all sites in North America on a very rapid basis. And the North American team acted as a triage to kind of look at the data in North America from a total perspective, and then how did it impact our company and what we have to do as a company to respond to the changing landscape.
Definitely. And that was a daily first as well?
Daily, and there are a number of us in the beginning of the wave, we were essentially on call 24/7.
Right.
So if we had to have a call at 3 o'clock in the morning to go over something we just learned, then it was a call at 3 o'clock in the morning. Yep. That's what the situation required. That's what the situation brought.
Okay. So to you and Larry, I'll ask the question is, when did you start to pare back that daily communication with those teams?
We started to pare back when mean time between failure. We measured mean time between failure between cases. And as we saw an acceptable level of drop is when we decided to say, all right, we're not going to meet daily. We're going to start meeting weekly. We're not going to report case reviews individually. We're going to report them as a daily event.
Okay.
It all had to do with failure mode.
Larry, do you think that's similar for you as well?
Well, we took a little slightly different approach. I think initially it was just making sure that, we had the knowledge and information we needed. Our internal expertise was limited. We did bring in a third party initially. That was a time where things were moving quickly. We were trying to establish our presence as an essential business. So that day-to-day oversight was necessary. And that really focused activity, I would say the first, I'll say 4 to 6 months was where we focused and it really met daily. And then we slowly started to back off once, I can't say that once the situation stabilized, but once our response stabilized and we felt that we had a good plan in place and things were being implemented. So, our activity is primarily manufacturing, so we would meet and try to balance those needs. So it wasn't, we monitored it daily, but we had to break off and do our jobs, if you will, or so the teams would form and come back together pretty regularly throughout the day. So slightly different approach.
Okay. And so, Marco, I'm going to just shift to you for a minute, kind of bouncing off the idea of this daily communication more in the manufacturing sense. From a construction perspective, much different challenges. Well, not different per se, but it is different, right? So do you want to explain kind of how you communicated to that daily?
It's different in many ways, and it's very similar. I think we're by far the smallest organization here on the panel. We self-employ somewhere between 75 and 100 employees, both in the office and out in the field. And we have anywhere from 10 to 15 or 20 different job sites going at a time. So we're working in owner facilities. Folks like Command that we might work for you and you would have your own expectations of us, and we would pass those down to our subcontractors. Our workers share space with other subcontractors, so we have to manage that relationship. And then, we have, again, it's a different environment in our office. It's much easier to control from a hygienic perspective. Whereas job sites are constantly changing, locations are changing, and things are getting built out, and walls are moving. And the poster you put up yesterday is in a different location tomorrow. But I think, one continuity that we've talked about is leadership involvement. And I can say unequivocally that, having our CEO and president, Tom Panzner, being actively engaged in the conversation on a daily basis was critical to our success. He did the research that I do, and we would bounce things off of each other continually. One of the things over the years that I've tried to do is stay ahead of the curve in terms of educating myself and knowing what exposures will be, and rather than simply finding problems and calling them out, finding problems and bringing a solution to the table. And Tom and I have been able to bounce off each other doing that consistently over the past year or so. Thankfully, it's gotten a little bit easier.
Yeah.
We're not counting our chickens yet. But having that owner involvement, we have a small group of executives who are engaged with multiple owners. We are still learning as we go what owner expectations are as things transition, as we're getting, I think we talked about it this morning, as we move into the vaccination phase. How do we get people back to work if they're symptomatic as a result of their vaccine? And that's an ongoing conversation, and it's different with one owner versus another and internally. So continual contact, and it's funny, I have in my mind, I remember it was a Saturday morning talking with our general super and our CEO and a laborer whose wife was sick. And I'm sitting in the parking lot waiting for my son to take his SATs. And there's all this stuff going on at the same time. You're still working, you're still thinking about it continually throughout the course of the week, the weekend, the nights, et cetera. And I think all of us have had to be flexible in that way.
Yeah, it's interesting. I was actually going to mention that even though, same for Command, we were meeting daily, then weekly, SLTs, things like that. even though that's changed slightly, I feel like I'm still on call all the time, right? I feel like there's still a Saturday or a Sunday where something's going to come up. There's potential exposure, and that is something that we actually talked about before the presentation. That you all are watching us in this panel, and one of the biggest things is we're talking a lot about COVID. Well, COVID is still there, and our biggest goal is to answer your questions about, okay, we know it's there. We know about the hygiene. We learned a lot today from OSHA and from Rob and others. But how are we going to keep applying that? Because I don't think any of us on the panel feel like we can really loosen the reins too much. Like it's still happening. I mean, Larry's down in Florida. Florida has a very high case right now. I mean, every state's going to have a little bit different challenge. And I don't think any of us really feel like we can lessen our approaches. We just might need to change it a little bit, right? So one of we don't have any questions yet, so I do have a couple questions that our team did come up with that I hope you'll find interesting. The first one is, and Frank, I'll actually push this to you because I think this will be a good one, especially with the DATCO and the other the application there, is did you encounter any difficulty in identification of those core business functions and prioritization of the support that's required?
So we were fortunate because we have a very strategic business model throughout our 3 separate companies. And to Marco's point, we were looked upon as thrust into leadership roles because of the necessity for subcontractors, folks that weren't our employees, but we relied on to further our business. So in absence of their not having protocols or equipment or anything that was going to be instrumental in our success, the difficulty arose in those outside sources. So we were able to understand and take the business model that we had already established for our folks and say, we can help you in your role as a subcontractor or a vendor or as an independent that's coming in for a service related to what we do. So initially, and then of course, this all speaks to the position of benchmarking, knowing what your position is, what your success rate or your rate of efficiency and effectiveness was, and trying to continue on in that direction. So we took almost the holistic approach of dealing with the person, keeping that person healthy, daily monitoring, keeping abreast of the ever-changing litany of directions and guidelines and protocols, and trying to amalgamate those into what we were going to do, the equipment and the supplies we were going to procure, and then also as an adjunct supplying those to our subcontractors and vendors and people of a lesser resourced ability. And it was incumbent upon us to keep those folks healthy and productive and accountable. So we started with the voluntary method. If you don't have anything, here's what our expectation is. Here's what we do. If you're coming on our job or if you're going to be providing services to us, this is what we expect. Here's our protocol. With your certificate of insurance and your OSHA sign off for us, we also expect that you're going to follow these protocols. And they were very welcoming of that because a lot of these under-resourced or smaller companies just don't have the opportunity to stop what they're doing and dedicate efforts into another aspect that's equally as critical, but yet taking something away from the budget. I mean, we understood that. So we didn't have an internal struggle as much as the challenge of making the outreach to those on the outside.
Okay, so that's really good, and I think that's really good feedback because that really shows how that adjustability and adaptability, right? That I think we all have been talking about slightly today. That it isn't just a one-size-fits-all, right? And we still today, even this morning, I think, and Larry, I wish you were here. We heard our little panel conversation before, but we were really kind of even learning from each other, even today. And I mean, this is a year later after COVID, right? And we're still learning. And I think that's really the great feedback that I took from that. Something else, and actually just kind of piggybacks into what you were saying, what your organization did is you guys actually started making the face masks, right? So do you want to talk?
Yeah, so we're a manufacturer, we're a contract manufacturer. Operations is what we do, and we do it every day, 24 hours a day, 7 days a week. We took the approach that we didn't wait to be put against the wall on support, and we went out and looked for how do we make our own support. And that was contracting with chemical blenders that could formulate disinfectant and cleaning supplies at volumes that we wanted versus trying to go out to the market and buy it in prepackaged. Within the first 1 or 2 weeks of the pandemic, we had that accomplished. We had contracts signed, and we had volumes established and POs issued for that. We also, when we started doing the math on how many masks we were going to need on a weekly basis, because we took the approach from a kind of holistic standpoint, if we keep our employees healthy, we keep our employees' family healthy, then everybody stays healthy. So as many masks as we used, as many gloves and glasses we used in the facility, we used an equal number in everybody's household because we sent materials home with employees to keep their dependents healthy. When we ran the numbers, we realized that we had to take this into our own, and we went out and purchased 2 mask making machines and began to build our own masks. And for the only purpose to supply internally and to keep ourselves sustained throughout shortcomings in the market and the supply chain.
Right. And I don't know if anyone else picked up on the word holistic. That was one of the big items that our group was really touched on a lot, is helping the employees, not just at work, but also when they went home. Because many employees did not have access to cleaning supplies and masks. And Rob actually had shown the picture of the toilet paper pandemic, right? Part of the pandemic that it really hit those are all mental impacts to all of us, and people would come to work and that's all you would hear about, no supplies, no masks, no gloves. How do I get them? So Larry, how did you, in your multiple different locations, and how did you help your employees to kind of feel that comfort level both at work and at home, similar to what we heard from the group here?
Yeah, that was a challenge for us. Everyone suffered from material shortages. We actually had one of our manufacturing facilities start to make masks, which we distributed to all our employees, as many as we possibly could. It was a stopgap measure for sure, but we had to do something. So our purchasing team was very central to the effort. Just looking for supplies. We wanted to do the same kind of thing. It's number one, take care of people at work. But certainly if they needed assistance with things at home, they were free to do that as well. We also, with regard to helping people at home, changed our HR policies, put in paid quarantine leave, we would call it. So if you'd become affected or infected or in contact and you had to quarantine, then, we adjusted our HR policies. It was, an attempt to try to, take that stressor off of people. You don't have to worry about not getting paid. So luckily we were, able to establish ourselves as an essential business based on what we do. We make a lot of lighting and things for hospitals. And so, we did everything we were able to, but we were all competing for materials. So we tried to be, provide materials and then be flexible in how people worked, and then how they were compensated in those cases where they were affected. So it was a challenge. A lot of local efforts. So a lot of our facilities would step up and say, we can help our employees in this way, and certainly we empowered them to do that. And if we could support them with financial resources, we would. But it was all hands on deck, and we certainly didn't have all the ideas. We did rely a lot on our locations to try to solve their own problems and ask us what they needed. So.
Okay. So along with those things is helping people, and that's really, just as a safety professional, I think that's what most of us, we really do. That's the ultimate goal, right, is to help people because it's a team. And I really feel like, at least I'll speak for my company, that was our biggest goal, is to partner with our employees, having a lot of more cross-functional teams. And everything was virtual. at least from the team perspective. And that was an interesting challenge as well. I mean, just the challenges of technology. Who even has a laptop? Some people didn't. We had to really adjust because of this, okay, I want to call purchasing. Well, they're not even in the same state. So how do I reach them, right? So I definitely echo the conversation that you were just talking about, Larry, about getting everybody together, but how do you do that and do it well, right? And I'm certainly not saying that we're doing it perfectly, but you definitely learn a lot about, where you need to improve in your organization and really, adjust your procedures. And that's something that I think we all have talked about a couple times today. One of the things actually talking about PPE, is addressing how do we manage the budget, but also how do we manage what is comfortable for the employees. So Marco, I'm going to mention, because you actually brought a sample with you today of what you've done for your employees because of the challenges of getting the right PPE, right, that actually work, that they'll wear, right? So do you want to talk about what you've done for your employees?
Well, I did bring a prop. I like to have things and show things. This is a cask helmet, and basically what we found is that with the mandate for facial coverings and our mandate for safety glasses, the two do not go well together. And it frequently I would have conversations with guys and girls on the job site, and they'd say, which would you prefer that I wear? Would it be the mask or would it be the safety glasses? And invariably the answer is both. But you can't just walk away from that. You have to, again, provide resources, provide ideas, meet the challenges, and as you said, give people the stuff that works, that's comfortable, and gets the job done. So we did a lot of research with various manufacturers. We looked at the ANSI standards for eye protection. We looked at the ANSI standards for head protection. We looked at what's available in the market in terms of cost and applicability to the job site. And we found that with this specific helmet, we were able to meet the head protection requirements of a job site. We were able to meet the eye protection requirements of a job site, and with the visor down, it didn't fog. So we have kind of organically started to grow these into our organization. They're not mandated. We are not mandating them of our subcontractors, but we keep saying, guys, there is an option. There is an option, but you've got to be willing to invest in it. And I can tell you off the top of my head, it's about $120 for the helmet and it's $50 for the visor. It's a significant expenditure, but it does get the job done. And it looks cool too. They are being adopted more widely on job sites. A lot of people like them. They don't fall off. It's got a chin strap. So being flexible, and I think when we were in the planning process for this presentation, I sent out around a one-pager where I had gone and done the research and I had all the links and I put it together and I sent it out to our subcontractors did anybody else have a problem trying to get through the CDC regulations and knowing exactly what needed to be done when they posted something new?
On a daily basis.
So, I found over the past year that we've taken the multiple pages of guidance that's been given to us by the government, by the state government, by the feds, and try to put it together into one-pagers and say, this is what we think it means, and this is what we've found, and please avail yourself of these resources. So to Frank's point, leading the charge to the extent that we can, recognizing that there are folks that are informationally challenged, if you will, whether it's not having technology or not having time or not having resources. We tried to boil it down. So we've got a one-pager on these types of hard hats that say, here's where you can get them, here's how they work, here's the standards that they meet, consider it an option. And I think, we need to keep looking at that. And it's so funny, you're talking about manufacturing your own masks. We manufactured our own masks as well, which was a box of 600 bandanas and a pile of rubber bands and me with some Ziploc bags on a weekend, putting them together and giving them to our guys. That was our first response. So I think many of us have been through that, and we're learning and we're growing and we're changing. And it's been challenging. It's been challenging.
Yeah, it's been challenging, but I also, one of the things along those lines is you hear about all the versatility. Even Larry, even though he's in Florida, he has a lot of locations up in the New England area as well. And New England has done a fantastic job of really responding and helping companies. It's been a challenge, and it's no one today, whether it be OSHA or even Rob, no one's saying, oh, hey, this is great, we all have the answer, right? But we certainly are saying, wow, New England, I mean, 50%, vaccinated state in Connecticut. I mean, this is all great stuff. And that stuff doesn't happen without support from all of us working together and feeding off each other and being open to trying bandanas rolled up, right, at first. If that's all we could get, then at least it's something, right? And, really having that flexibility and also the acceptance that not everyone's in the same place, and I don't know, I mean, Frank, if you want to mention just how, you've addressed kind of that human aspect, right? Because it's,
we have found, and this I think is broad spectrum across, no matter if you're manufacturing and construction or service related, but in absence of a standard, in absence of a clearly communicated goal or objective, you're going to get improvisation, which is going to go against the message or against the policy that you sought to establish. And it's that same adage of delusion downstream. So, well, I saw them do that, so it must be okay. But if you didn't communicate the message that it wasn't okay, and I don't think there was ever a time in my career where we had the absolute mosaic of different modes of methods and methodologies of communication, because whether it was establishing virtual meetings for the people in the field, enforcing things site visits person to person, or getting word down from the executive level to the team leaders to say this is how we want to do it. But consistency applied, because if you didn't have that continuity and the consistency of your message, you would get downstream delusion, which means that you were not going to be as effective, you were not keeping your people as safe, and you were going to send the message that there was confusion. So we did. It was a struggle, getting those CDC and FEMA and Department of Health and putting them into concise bullet point information to get out to the field to say, we understand you're coming in with concerns. Every day there was a high level of anxiety, which affected the workplace, no matter where they were. So if we could consistently outreach to them, and we found it beneficial, and some of the smaller companies as well, not to take this on solely in-house, because there are so many resources, whether it's the resources from CBIA, whether it's your GL carrier or your workers' comp carrier or your employee benefits people, to come in and keep those greatest human assets well. And the level of anxiety can be dissipated if they had a chance to understand what was expected, what was out there, and the steps we were taking to keep them safe. So, and then, of course, the economies of scale come into play where we have to supply you with these materials and these products and the training to do it, but we want to make sure that you're using it as efficiency and as effective as possible. So the oversight was just incredible.
Definitely.
Yeah.
Especially with the changing requirements.
Of course.
But what didn't change, right, is the OSHA compliance piece. And we did hear about that today. And that's something that I know that our group, we talked a little bit about it, but there's a lot of planning and a lot of looking at here's the requirements, setting those expectations, and really making sure that we're continually reinforcing that and finding a way to do that. Because when you are adding face masks and everything else, and by the way, additional cleaning for construction crews, I mean, that was I can imagine the challenges of that. Potable water is already a challenge for construction, right? So it's definitely an interesting, it's been an interesting year, right? So I think I'm looking to see if there's any questions. So it looks like there was a question on, it says, how do you feel this applies to workforces that work primarily outdoors in the close proximity, I think, to truck travel in project areas? So maybe this is more like it sounds construction-based question. So the question again is, how do you feel this, I think as in COVID application, applies to workforces that work outdoors? So I don't know, Marco, if you, and Frank, if you...
Well, we're still, and again, the rules are changing. As of May 19th, things will be different here in the state relative to facial protection, and separating distances are still the same. Early on, one of the exposures that we anticipated was having two workers in a boom lift working together. In an 8-foot platform, you will be within 6 feet. And we felt that it wasn't enough simply to have a facial covering on. So we requested the use of face shields as well as a facial covering. So we went a little bit beyond what the expectation was, looking at the risk and looking at the hazard. Now I'm finding a lot more people dropping the masks and not being cognizant of their proximity to others. We get in and we help each other, and we're in the trench and we're putting catch basin components together, and it takes 2 people to place that load. So it's still a focus area. We're still talking about it. I think we still need to be cognizant of it, especially with the proximity issue, and it's going to get better hopefully with vaccinations. But when you consider, again, how much impact this disease has had on our families and our economy and our businesses, our coworkers, we can't let our guard down yet. It's not time yet. And again, looking at the panel and thinking about the exposures that you have across the country and in other countries as well. It's great here in Connecticut. We've done a really fabulous job, I think. But traveling is still a question mark for me. I don't want to go out of state.
So actually, that actually kind of what you're saying about not letting the guard down and really take what are the steps that we're taking. The panel, I think we all were consistent in the whole continuity plan and planning, right, and response plans, and how we stayed consistent with that once we set the tone at the top and float it down, because we don't want to let the guard down. So one of the questions that's come up is it started with a statement, but we have since added pandemics to our emergency response plan. Have you developed an emergency response plan for this? And I'm thinking that means for COVID. I'm actually, Larry, do you want to talk about kind of business continuity wise and how pandemics was built into your ERP?
Well, we spent the past year actually doing that. I mean, I can't say that we had a good plan before that, but we sure do now. The way our organization grows, we grow by acquisition. The role I'm in is relatively new. So at this point, we don't even have a corporate level emergency response plan. We now have a very strong foundation for that from this, pandemic response. I think you do a risk assessment. You focus on the things that you think are going to be the biggest issues. And I don't know about others, but certainly this was not the top emergency issue that we expected. So certainly our thinking has been readjusted, in so many ways. I'll say that we weren't as prepared for this as we really should have been.
Yeah, I don't know. I don't know how anybody could have been totally prepared. What do you think, Charles? I mean,
our business interruption plan, we pretty much use this. We use our business interruption plan to get through COVID. We didn't specifically call out COVID because no one saw it coming, but there are other similar issues that can come up that can impact your business in a similar manner. And so our business interruption plan, and that's what I would offer to everybody that's listening, is that I would try not to shoehorn yourself into something too specific. I would make your business interruption plan broad enough that it would pick up everything from a pandemic to, who knows, energy interruption or something along those lines. And then you take your playbook from there, and that's kind of what we followed, our own playbook. And we improvised because it was COVID.
Right. And you can rely on that, right? You
right.
kind of keep going back to that,
right,
correct?
Right, and that was the kind of the takeaway is don't rely on anything that's too prescriptive. You need to be able to reevaluate every 24 hours and say, are we doing the right thing?
Yeah.
Are we heading in the right direction? Are our employees protected? Is our business protected?
Do you feel like you changed that a lot, or was it just small tweaks along the way?
Tweaks.
Okay.
So we did tweaks, and we're going to take certain documents that came up out of necessity, and we look at them and go, that's really good. We did an okay job with that. Let's hold on to that one.
Yeah.
There are others that just It was an attempt and a failure.
Right.
And that's how you learn, and that's how you get better for the next thing that comes along.
Yeah. So, I mean, you just heard from Larry and from Charles saying that, it's been a year, trying to work on a pandemic plan, with Larry, who was mentioning, Charles is just saying how adapting it, making those mistakes along the way. As long as, of course, the goal is never make a huge mistake, right? We don't want to impact the safety of someone. But because there really isn't a strong playbook and it was changing so much for everybody, I was going to...
If I could add.
Yeah.
Charles was on the money. If you establish your columns and your silos, and then you pick and choose, whether it's a pandemic or a natural disaster or radiological or even a fire in a facility, you can adapt. But as you charge forward, there's always that need to come back and debrief and get insight from those that were most impacted and were tasked with remediating.
Yeah.
So we found that, as much as leaders as we are in the direction that we set, if you don't take into account the ones whose backs the burden is being placed on a daily basis, but more importantly, where I'm going with this is the critical nature of succession planning. We tasked people to come outside of their comfort zones to take on roles that they hadn't before, and some of it was very challenging, others was pretty impressive, but we got an opportunity to really assess what our future is going to be in the event that half the senior staff isn't able to come in and make these decisions. What's our next step? You can't stop. So you have to have, and I know people refer to as A, B, and C level players, but that's not the case. It's your succession plan. In the absence of your executive team, or in the absence of your team leaders, or in the absence of senior people that you relied on, where do you go? And how are you going to continue? So it was eye-opening for us to say, we got to start building a better bench. And we have to be able to have the talent in place in the event that this happens. Not to overload payroll and overload the employee roles, but to find those key people that can step up from maybe a managerial level to an executive level to oversight. And it was very telling for us, especially in the field. I mean, I can relate to the construction aspect of it, because in one of the previous questions was, how does it relate? It relates intrinsically for what you're doing. And the succession planning is something that we probably will be focusing on now, so that we can have a little bit better bulwark going forward. So that's what I would give you.
Yeah, and Marco, you wanted to add something to that, or?
Just to put it into perspective in terms of, I'm a visual person, and I'm looking at these two things in my mind of how we provide clear, positive guidance as we go forward, and then scale it as necessary. Scaling from a fall exposure relative to an opening versus the top of a building, or succession planning the loss of a critical employee to the loss of many employees in a pandemic. And the visual that I have is how in construction we have to have work zones set up with lots of cones and barrels and signs. And we want to positively guide the motorist through the workplace. We want to show them the way. And to take that and scale it to something like Rentschler Field as what I think is a fabulous example of using the resources that we have and getting the vaccine out there, and how that's organized and how it's run and how it presents itself. When you walk in there or when you drive in there, you know where you're going, you know what's expected of you. There are any number of people guiding you through the process. They tell you what's coming next. And that's pretty much what I think we all have to do, is we've got to understand that concept that people need to be given a clear, positive way to do things. And I think that's why we took everything and we concatenated it into smaller pieces and said, this is all we have to do today to get us through this.
To control the anxiety, or to try to minimize and not add to the anxiety.
Absolutely.
Right?
There is a comfort level, absolutely, in that guidance.
Yeah,
it's
for
okay.
sure.
It's a problem, but we've got you. We're going to get you through this.
Yeah. Actually, that's the question that's on the screen right now. Is the speaking of anxiety related to COVID-19, have you seen an increase in substance abuse in the workforce? And that is an really interesting question. And I'm actually going to put it to you all to see if anyone has any input to that.
Well, to the degree that it is reported, we haven't. That doesn't mean to say that we haven't encountered it subliminally or on a lower level. So in a regulated agency or a regulated business where you're subject to drug testing and internal screenings, we have a high degree of confidence that that is not in fact happening. However, those folks that are affected outside, which is why we say, listen, we're going to engage with whomever it is, our healthcare professionals, and say, outreach. At this point, what is our employee wellness program going to be to say, if you're having trouble? So I know I probably didn't give you a succinct answer, but to the degree that we could know, we haven't seen it.
Yeah, it's a tough.
Yeah.
It's definitely a tough, a tough thing to, especially during a pandemic where no one really, like I said, they're going back to that lack of a playbook, and we're creating the playbook and we're adjusting. I myself even know people who have passed away during this COVID time, and that's it's devastating to them. And some of them don't come back to work for months. And you don't know what's happening to them when they're at home. Are they spiraling into a despair? And it really, as an employer, it is our responsibility to make sure that they're okay. But we also have these lines that we have to be so careful about. So I'm going to go on to the next. I know we didn't answer that question directly, but I know it's a tough thing. And to me, I always rely on, comforting our employees and having that open communication and allowing them to really be that shoulder to cry on when they need it. That's how I would address that. But
if I could just say something to that quickly.
Yeah.
I think there are statistics out there that are saying that there is an increase in alcohol use and drug abuse. It's something we need to be cognizant of, but I think we also need to recognize the presenteeism that's out there from a mental health perspective. There may not be a specific substance that we can point the finger at that we can say is a problem or it's increasing, but I think it's very fair to say that our folks absolutely need help. They need that shoulder. They need to talk about it. And I have found myself in the field spending a lot more time just having conversations with people and trying to understand what their thoughts are about vaccination or about their loved ones and about missing work and am I going to get paid? There's a tremendous amount of anxiety out there. And whether there's a number that we can focus on and say, yep, that's a problem, I think we all have to recognize that the mental health aspect of this disease has had a tremendous impact on everybody in the workforce, including our children.
Including families, including, and to that point, even I find myself just getting to know my employees more. Like there are people that are going home and they have their, a pet at home, right? Okay, that's fine. You may not have a child or someone at home, like a human being at home, but you have someone you're going home to, and giving them that positive outlook to, this is why you need to be safe every day, but it's beyond that, right? It's what am I doing mentally to help you in your wellness? That's actually one of the questions that our team had come up with is, how do we, sustain employee wellness and outreach, because it's not easy to, especially even in larger organizations too, to get to everybody. Right? How do you make sure that they're not kind of slipping through the cracks, right? And that they didn't just lose a loved one or have something significant happen. Companies, unfortunately have had furloughs. That's a loss in pay for some people, right? That's a mental strain on some people. So I'm going to go on to the next question that I thought was a really good question. Is do we have any plan to evolve with any more changes, or what do we foresee as changes coming in the next say month, okay? That might be too long, but the next month, is there anything that we plan on evolving with? So Charles, I'll talk, if you want to cover what you're going to cover in the next month.
So we're watching infection rates, we're watching all that, and we have a plan to evolve based upon area infection rates.
Yeah.
So the answer is yes. I wouldn't want to get into any specifics, but you have to have a plan, and the plan has to be clear to the employees, because that's what, towards the mental health, that's what gives them hope.
Yeah.
Okay?
Definitely.
And we continue to drill down into our employees all the time. So if we make a change, we get out and we talk to the employees. We don't do an email and sign that you've read this.
Right.
It's small groups, talk, get feedback. That's how we gauge whether or not our evolution, for lack of a better word, is working.
Okay.
All right.
Okay. Yeah, no, I like that. I mean, do all of you kind of agree that that's the best approach? I don't know, Larry, what do you think for your population as far as talking to them and staying in touch with them?
Well, we focus a lot on communication. Very recently we've completed a survey looking forward. So we've been in this posture for over a year now. So we've learned some things. I think the thing that we've learned is people that are working remotely actually like it, for the majority. And so we're trying to understand, well, how do we change how we do business going forward? Looking at hybrid work models and those kinds of things. What sort of support would a remote worker need in terms of equipment? But I would say a year ago we weren't thinking about this, with much specificity. Now we view it as business continuity. We need to adapt, or it's going to affect us in the marketplace. People are going to want to work for companies now that are more flexible.
Agreed.
So, we don't have an answer yet. But one thing we have been consistent with is communication, admitting that we don't have answers yet, but that we're working on them, and that we want to find that balance. So, even if we don't know, we're pretty honest about the fact that we don't know. But we monitor things and report out regularly. Employees want to know. They want to know what we're thinking, or what direction we're heading. So it's communication has been constant in how we communicate, what we communicate. It's all planned and well thought through. We try not to make any inadvertent statements that might send the wrong message. So we're honestly interested in understanding what do we need to do to operate as successfully as we did before this all occurred.
Right. Yeah. Not making those promises, right, based on things that we're not even sure of, right? But being transparent. And actually, I think that's what our team actually had talked about early on for the communication. And you'll see that communication was a big item for all of us today. But transparent communication. If an employee is already anxious and they're already not sure, and we have our own families or not, or whatever, our own concerns, even for our own lives, how do we be transparent and say, yeah, I feel the same way. So how can we fix it, right? How do we come together? It doesn't matter what level of the organization, it doesn't matter who you are, if it's a contractor, if it's not, is that transparency, I know at least for us, and I think for this panel, has been really helpful, because that really establishes a really common ground, and I think it really ratchets that anxiety down, at least to a little bit. You may be anxious together, but at least you're having an open conversation. I don't know if you all kind of agree with that at all, but.
Melissa, if I could offer that, truly in the spirit of evolution, where you were, where we are now. We are going to be taking a look back now at the things and the environmental controls and the products and the protocols that we put in place, and seeing what needs to be adjusted. And I can offer you a specific on that with regard to the pandemic and the cleaning aspect of the products that we use and the application. And we are now testing out what they call hydrostatic sprayers. So we're going to take it out of the hands of the employee. You don't have to do this version, but we have to tell them why, because if it looks like a lessening of a standard or a vulnerability aspect, it's going to add to their anxiety. Yep. So we look at every change that we've put in place in response to the pandemic, and then either segueing off into something else, dialing it back to the degree necessary, or ratcheting up to the degree necessary, but letting the employees know and letting the supervisors and team leaders know that this is the reason why. So it's that mental aspect of planting the seed that we're doing this because it's better.
Right.
So.
Right. Definitely. No, I like that. One other thing I had actually put down as my last question for the panel today, and I'll ask each of you this. I'm starting with Mirko. What is the one best practice you've held on to throughout the pandemic?
Wow.
No wrong answer, remember?
Right, best. It sounds like a broken record, but I think it comes back to communication. Being open. I've been on multiple sides of the discussions, if you will, and sometimes they're not just discussions, but about the effectiveness of masks and the adequacy of vaccines and the dangers associated with anything and everything that we're doing. And I watched YouTube last night, and you know, I think we have to be cognizant of the pandemic situation we're in. I think we have to be cognizant of the social situation that we're in, how they are or are not intertwined, and how, from a safety perspective, our job is to be with people inside their heads. It's to understand what drives them on a daily basis and what allows them, if you will, and I'm not sure that that's the right term, but what allows them to make the mistakes or to perform the function improperly, or to use the defective piece of equipment. The more we understand about our charges, if you will, the people that we're responsible for, and what drives them on a daily basis, and the less we focus on regulation and compliance, I think the better off and the more effective we're going to be. And I think from the safety side of the industry, we've been talking about this for years: behavioral-based safety and emotional strength and support and hazard recognition for all. Even using the word competency. In the OSHA regulations for construction, I think there are 27 different places: a competent person for excavation and fall protection and respiratory protection and asbestos and lead and blah blah blah. And what is the definition of a competent person? It's a person who's knowledgeable and who has authority, basically, if you boil it down. So if we can support our people, give them the training that they need, and give them the authority to stop when there's a problem, it applies to the pandemic as well. Try to educate folks what the real issues are. Try to give them control over the decision-making process. Let them have options in terms of how many different vaccines there are. Let them make their own decisions, but be prepared to support them and guide them.
So they become the competent person, right? So they inherently become that competent person for the many parts of their job, right?
Yeah, it's, we have to be responsible for each other. And I think this is a great opportunity for us to kind of step back a little bit and say, we may have been losing control of that. And we may have forgotten about our brother or sister working alongside us. We may not have been so concerned about them. But this, I think, gives, if we can find light at the end of this very dark tunnel, it's that it gives us the opportunity to look at the human beings that we work with and around, and understand them as the very important, critical individuals that they are, not only in the workplace, but to their families, and supporting that. And I could go on for days, but it's talking to our people and then listening, asking, "Are you okay?" and then being prepared to listen.
Definitely,
and I think that's the critical part.
Which is, and it's definitely an interesting. I mean, Charles, you have a lot of people spread out across. How would you think? What is your one best practice you've held on to?
I think it's the contact tracing. And it's a tiered contact tracing that we do.
Okay.
Because it's a form of communication back to the floor.
Got it.
Back to everybody.
Okay.
And so it's the peer review on contact tracing. We use the same format, the same level of documentation. From the regulatory side, it helps us because we're in a bunch of different states and we have very good documentation of the contact tracing. Enough so that many of the health departments that we operate in don't contact trace our cases because they rely on ours. But I think it also is the key to communicate back to the individuals who may or may not have been involved, but are afraid that they were.
Right.
And so that contact tracing is the final step, or talking points that go back to the area, the production space, the shift, to let the employees know, all right, you were not put on quarantine for the following reasons. There were 2 people on quarantine for the following reasons. It's precautionary. And then the communication back that those quarantines were just precautionary, everybody's negative.
Yep.
It's that kind of the full step of what we do. So yes.
I do like that. We actually, I agree with you. I actually agree with both aspects because all different, the contact tracing is a great communication tool as long as you're using it that way, right? That you're having this open communication. There's nothing hidden. It's all transparent, right? And then getting to that employee base, right, it all ties in together. Frank, I'll ask you, what was your best practice?
So I would have to say, speaking globally, drilling down not so much to the pandemic, but the critical nature of decision-making and what your strategic plan is. So it's knowing what you are seeking to accomplish, what goals you're setting, how you absorb information to get those goals accomplished, how do you process that, discuss it with those affected, and then react or implement. And those key areas, regardless of what we do, are going to provide you with a success or failure rate. And it's also going to allow you to redirect based on what information you're getting back. So if we were if you asked me, the best practice would be the critical nature of the decision-making process and how it relates to whether it's a line item budget or whether it's an employee wellness or whether it's the bottom line production of whatever it is that we're seeking to accomplish. That strategic goal has to be critical, and that basic tenet of business overlay is what is going to cause you to succeed or fail.
Okay. Yeah, I think the planning part's really important. Larry, what was your best practice for the pandemic?
Well, based on the nature of how we grow by acquisition and our culture, we don't bring people to a single system. So I would say the thing that's really come out of this that we continue to use today is really this communication process. And I would keep beating that drum, but we, from that executive level core team, we now have, we had developed, I'll call them focused communication subjects, whether it's around operations or human resources issues. But we get a representative from every single location in these regular calls. They are hosted by senior executives. So we have brought people together now. We communicate, we behave like one organization, when before that we were really just an amalgamation of people doing their thing in their location. So this has continued. We now that the subject matter does include COVID, but now it includes other key high level issues that may be faced by other locations. All levels of our organization participate, so there's an access. We've improved access to our decision makers and our senior leaders. So, and it goes very well because we keep them to a half an hour, and only top issues are brought up. And it's also an opportunity for us to say, here's a policy change, or here's something that's going to affect everyone. And it's been very effective and well received. And we anticipate these to continue through the course of this year, and with any luck, they'll continue after that. But certainly have seen a transformation in terms of how we are now connected to each other and understand each other's issues a lot better than we did before, which, prior to this, with how we were set up and our culture, not sure we could have had a forcing function to bring us together like COVID-19 did. So we hope to continue that.
Yeah, the unfortunate side of this, right, is that we have to learn how to adapt. But what I'm just encouraged about is that, I loved your all's honesty, and I hope that everyone on the questions that we got, that you really heard that, and you heard that we were all honest and open, and not one of us said that we have it answered, right? None of us are perfect in saying all of our companies are great and we did everything perfectly. But it is possible to come together and work together and really sustain that. And that really, I hope, is what everyone came out of our panel today with. So I appreciate that. And I think we're out of time, right, Philip? So.
Thank you.
Thank you, Melissa, Charles, Marco, Frank, and Larry, for that insightful and informative discussion. At this moment, CBIA would also like to take a moment to thank its safety advisory board members who have been instrumental in planning our safety activities and programs. Also, we value your feedback and ask that you share with us your evaluation of the program, which can be found in the chat box. We've addressed a good deal this morning, so now we're going to take a 30-minute lunch break and look forward to you joining us in the afternoon. See you then.
should have something for us by now. Tell me, what were Lisa's last words? She said,
Are you looking for additional training resources for your company? Let CBIA help through our partnership with Training Network Now. Training Network Now has thousands of safety and health videos on topics ranging from sexual harassment prevention to ergonomics in the workplace working remotely. For more information regarding pricing, please contact CBIA Membership Director Joe Diaz at 860-244-2222 1118.
Our company has always had a long history of sustainability, and to that fact, we look to CBIA to enhance a number of the other programs that we've been working on, which would include solar, rail, makeup air systems, to heat our facility. We were also able to reduce our power cost consumption by hundreds of thousands of dollars. Our business is mainly centered around supplying a value-added raw material for both medical and food applications. I like to utilize them not just for the energy benefits, but especially during the pandemic, there was an awful lot of regulatory issues that we needed someone to use as a sounding board and to really just get through all the red tape and tell us exactly what we need to do so that our employees were safe and that we were in compliance.
Welcome back. We have a packed afternoon for you. We will begin with Chris Main of GZA on a discussion of advances in training in the virtual environment. Ironically, this issue has been gathering steam over the past few years, but the advent of COVID has made training under these circumstances even more relevant. Please join me in welcoming Chris Main, EHS Project Manager for GZA. Chris?
Thank you very much. Thank you. All right, it's good to be here. I hope everybody had a nice lunch and is ready to go. Today I want to talk to you a little bit about using virtual reality to enhance your safety program. Again, typically we use a lot of, lately we've been using a lot of PowerPoints and other methods like that to try to get the information we're trying to convey to our employees in our training sessions. Again, sometimes they don't always hit the mark, and sometimes we need a little something to inspire us and to give our students a little bit more hands-on experiences. And so, if you haven't tried virtual reality, had a virtual reality experience using this as far as a training program or just as far as a gaming program, it's definitely something that's on the horizon that's going to definitely be breaking into the safety industry as well as other industries. But it's definitely something you're going to be trying in the near future if you haven't had a chance to try it. And again, I'm really a proponent of this because we've taken it to a variety of different conferences. We've taken it to different clients, and we've seen the results of this, and it definitely is a big improvement in trying to get, again, the message that we're trying to relay to our employees, again, about working safely and the procedures that they need to follow. And so virtual reality is definitely going to be something that's here to stay, and it's really, again, when you get a chance to use it, you're going to see that it's definitely going to be a game changer. So what I'd like to do is kind of talk about virtual reality and mold it around fall protection. This is Fall Protection Safety Week, and so I wanted to kind of mold, like I said, mold this topic around how we can present this for fall protection. So we know fall protection is a big deal. When we look at OSHA's most cited violations, the top 10 list, we see fall protection's been number one for a little bit. We see other aspects of fall protection in this top 10 list here. So one of the things that's interesting, again, this list hasn't really changed much over the last 20 years. When we look at this list, again, going back 20 years or so, this list really hasn't changed too much. Some of the positions might have jockeyed back and forth, but the topics are pretty much the same. One thing that's definitely new that in the last 5 or 6 years or so is ladders. That's really made its way into the top 10, and we'll talk about that a little bit as we go on. But again, this just kind of shows us that fall protection isn't anything new. We know it's an issue, but we need to make sure, or try some different ways, I think, to get our message across of how we can protect our employees. So, okay. Again, looking at some more data from I have presented here from 2011 to 2018. We have the construction industry data, looking at their fatal falls and comparing that to other fatal injuries in the construction industry, you can see falls make up a large percentage of those fatalities. And then again, you compare it to total fatalities on a job site, or I mean, other fatal falls in other industries. Again, you can see the construction fatalities due to falls are definitely a big part of that number. So when we graph it out, like you can see in this chart, you can see that, again, the trend isn't that we're having less falls every year. We seem to be having more. And again, if I did my math right, between 2011 and 2016, the number of fatalities due to falls has actually increased by 45%. So again, the trend is really that the fatalities due to falls are increasing in the construction industry, not going down. We did see a little dip in 2018, but again, that hasn't been the trend lately. So, sorry about that. One more. Okay. If we look a little closer and we look at the 2007 data, again, we can see that this was definitely a higher year for falls in the construction industry. We had about 448 falls that led to fatalities that year. And general industry had about 48. Again, a fairly large percentage of that 835 of all the falls that were related throughout industry, all the various industries. So again, when we look at this data a little bit harder and dial down into it, why did we have these falls, or where did they come from? You can see we had falls from ladders, falls from roofs, falls from scaffolding. Those made up a large percentage of those falls. And so when we look at this data like this, again, we can dial in a little bit and kind of see where we're having issues, and then hopefully maybe we can again focus our efforts in those areas to reduce and try to eliminate those from happening. Okay. So I used that 2007 information because I came across a study here from, it was a Harvard study that was done, and they went into 65 different emergency rooms that year, and they interviewed people who had falls from ladders. And they wanted to try to get an idea of why these were happening, what happened, what led to these falls. And you can see 51% of those falls were due to people working on step or trestle ladders or A-frame ladders. 40% were due to people working on extension ladders. So again, when we know that kind of information, we can work with people and focus in and dial in on those types of ladders. Because again, there's a wide variety of ladders out there. So one of the more interesting stats is the average fall height. Again, I think people tend to think that you have to be really high up to have a significant or fatal fall, but you can see these average fall heights were less, 7.5 feet, less than 10 feet. And the majority of the falls were definitely less than 20 feet. So again, you don't have to be very high up in the air to have a potential problem. And then they asked these workers, why did you fall off the ladder? And 40% said the ladder moved on them. 24% said, they misplaced their foot or they slipped. They lost their balance or the ladder broke. So again, this type of data can really help us focus our training programs and where we need to spend maybe some more energy. Again, just to ring home that falls are a big deal. The Center for Construction Research and Training, they have these maps that they produce every year, and they kind of show locations where people have had fatal falls on construction sites. Again, this one's from 2018, and you can see a lot along the eastern coast and the southern border. But again, this just brings home, again, this is a big deal, and we still don't seem to have made a lot of progress in trying to reduce the numbers. So, and then when you start talking about money and fines and workers' compensation, again, you can see the numbers here. They're very large numbers. Again, Oregon OSHA said their average cost for an incident in 2017 was over $23,000. And their penalties related to fall protection from their violations were over $900,000 that year, in 2018, I'm sorry. So again, we could definitely be spending this money better putting it back into our safety systems, trying to enhance, again, our safety programs. There's a lot better ways we can use this money versus trying to help people recover from injuries and those sort of things. So again, it leads to us asking the questions, why are there so many falls on our job site? Is it our safety culture? Is it because our safety culture is non-existent or very poor, or there just isn't a lot of emphasis put on it? It's not our priority at work. Maybe our work procedures are poor, or we don't have any work procedures, and people don't really know how to do their job safely because they haven't been instructed properly. Again, it's no secret that, again, people are working into longer, their careers are longer, they're working later into their life. So again, that may play a potential role. And the resources that employees are given, are they given the proper resources to protect themselves? Do they have what they need to do their job safely, effectively, and efficiently? Or do they have to, again, like this person's doing, is kind of be creative and trying to get their job done? So, or it may come down to, again, we've got great training, we've got a safety culture that's good, we've got great procedures, but for whatever reason we decide to make a bad decision, we decide not to follow those procedures, and so we make bad choices. So again, that also plays into this as well. So again, the idea is that, we know fall protection is a big issue. We know we want to focus in on it. But again, we really haven't made much progress in reducing those potential falls and those incidents. So, what are the elements we need to get across to our employees and our management? How can we help people work safer, work better, and again, go home in the same condition that they came to work in? So, one of the first things we need to do is a risk assessment. Again, especially like on a construction site, it's always dynamic, it's always changing. So we know we're going to need to do a risk assessment and try to identify where those potential hazards are on a job site. And again, identify things like, again, can that elevated surface support the number of people and equipment we're going to be putting up there? And then once we've identified those hazards, again, what are the controls that we should be putting in place? What type of equipment should we be using? How do people actually put that equipment on? How do they do an inspection? What is this equipment good for? What situations should we not use it in? And again, how long should we expect this equipment to last us? So these are all things that we need to, again, kind of get across to our employees and our workers. And ultimately, the idea is we need to come up with a method of how do we verify that they have actually learned what we want them to learn, and they know what they need to know to do their job safely. So I just kind of want to dive into the regulations just a little bit again, a little bit further, just to make a point. But when we look at trigger heights for fall protection, I think most people know that general industry that we're talking about a 4-foot height. Construction, we're talking about 6 feet. If we're working on scaffoldings, we're talking about 10 feet. I think those are pretty common numbers to everybody. But when you start looking at the regulations themselves, there's a lot of different heights, and they vary between the different types of equipment we're working on or using, the areas that we're working on. And actually, CONN-OSHA put out a great paper or flyer indicating some of these. They pulled all the numbers out of those standards and kind of gave a nice fall protection by the numbers document. So you should look for that if you have an opportunity, because it lists a lot of these different types of situations and the numbers that go along with them. But you can see this is a lot of information to, number one, train people to, but also have them retain it and remember it. All right. Something else that can be confusing to people is, again, what is their responsibility? What is their role on a job site? Do they know what they need to do? And so, again, we start talking about things like competent person and qualified person, and what's the difference, and how do I know who the competent person on my job site is? who's the qualified person. So again, this can be an area of confusion, and if we don't know who these people are, again, we can't get the answers that we need and the direction that we need. All right. So when we're talking about fall protection and actually implementing fall protection, there's several different elements that we need to look at. And these include, the anchoring systems, the body harness itself for a personal fall arrest system, connection devices, and deceleration devices. So we'll talk about these in a little bit more detail, but you can see there's a variety of different things that are potentially available to us. And it's not just OSHA regulations, it's also manufacturers' recommendations. ANSI has some standards out there that talk about the different types of equipment and how they should be tested and rated, and how, again, people use these. And so, again, when we just start talking about lanyards, there's different types of lanyards. There's shock-absorbing lanyards, self-retracting lanyards. They're in different lengths, 6 feet, 3.5 feet. We start talking about having deceleration devices and how long those are, and again, how do they connect to the system that I'm using. Positioning devices that are designed to prevent us from falling in the first place. If you use a self-retracting lanyard, again, there's different classes of these types of materials or lanyards. So again, how do we pick the right one? How do we know that the one that we have is appropriate for what we're trying to do? If we're doing leading edge work, again, we may be working with horizontal lifelines. Again, these need to be engineered in place properly, so again, that they're going to perform the job that we expect them to, that they're going to help us from falling and protect us. So again, there's different lanyards that go along with those, double leg lanyards, double tie or Y lanyards that go in, that can be used with these. So again, a whole slew of different types of equipment that we could potentially choose from. Again, the question is, how do we know which one? And then there's different materials that this equipment's made out of. So again, is this type of material appropriate for the environment I'm going to be working in? These are the type of questions we need to ask. And again, how long will it survive or last in that type of scenario? So when we start talking about anchor points, again, it sounds simple enough, but when you start actually looking into these, there is a whole slew of these as well. So different types of anchors for different types of areas we're trying to put these anchors, and the construction material we're trying to tie into. It all makes a difference. So again, we need to make sure we're picking the right type of anchorage system for the project and the environment that we're working in. And again, we need to make sure that they're tested to a proper strength, so 5,000 pounds. So they do have a nice little unit that you can get that will test these anchorage systems. So it'll tell you if it's actually going to withstand 5,000 pounds. So again, there's equipment out there to help you. But again, the idea is there's a lot of different choices out there to look at. So again, how do we convey this information to our workers so that they understand what type of equipment to get? And again, that's working in association with your competent person and your qualified persons, right? So again, all that's great, but what happens if we actually have a fall? So again, we know if we have a fall, we're going to fall fast. We're going to cover a lot of distance if we start to fall. How do we know that the protective systems that we put in place are going to be adequate? They're not going to be too long. We're not going to hit the pavement below us or some other structure below us. We're not going to swing side to side and maybe hit some structures that are adjacent to our work area. So again, do our guys know how to calculate that out and make sure that, again, the equipment that they're wearing is going to actually protect them? All right. So again, we come back to our risk assessment. And again, obviously the greatest thing we could do is eliminate those potential hazards that we've identified. Again, that's not always feasible, right? So again, the next step is to prevent a fall in the first place. Are there things that we can put in place or use to help us to prevent from falling? So again, guardrails, fall restraints, those sort of more passive systems. But when that's not possible, again, we're probably going to be relying on things like a personal fall arrest system. So again, making sure we've selected the right kind of equipment. Warning lines, again, if we're maybe using warning lines or safety monitors, again, do we know how to use them and construct them and make sure they're designed for, again, our particular job site. And again, there's all kinds of other potential conditions that can affect us. Low sloped roofs, do we understand what that means? And, is a job site we're working on actually considered a low sloped roof? And again, do we understand what that means and what sort of controls come into play then, or what we can use? So there's a lot of different potential equipment, and there's a lot of different conditions and site conditions that will dictate what we use. And again, having the idea of knowing when to use what is very important. And again, it's not just about picking out the right equipment and putting it on properly, but it's also being able to inspect it. So we know we need to inspect our personal fall arrest gear every time we put it on. Looking at the different webbings and hooks and buckles and all those sort of things. Making sure that our guys know how to actually do that, and know when to take it out of service, when it's not right, and when to say, no, this isn't going to work for me, I need to get a new one or a different one. And then once that's all done, again, that's great, you got everything set up, you're good to go, but again, if you do have a fall, how are you going to get out of that situation? Again, I've got a buddy who had working through college. He was doing roofing, and he wound up falling off a roof and breaking his neck. And luckily he just laid there, but he had to lay there for 30 minutes before somebody came and found him and realized that he was injured. So again, that's where work procedures come in, not working alone, but it also tells us, we need to understand that we may not be rescued right away. So again, do we have ways to help ourselves out of that situation? And do we have a plan in place to get somebody out of that situation? And they are coming out with a lot of different types of technologies that you can self-rescue with these newer type of harnesses. But again, we should have a rescue plan in place so that we can get somebody out of that situation. And then, of course, OSHA is expecting that, we're going to cover certain topics and train people to their job and what they're going to be doing. And again, the equipment they're going to be using and the type of environment they're going to be working in and what the manufacturer is requiring and all these sort of things. So again, there's a lot of information in this fall protection standard. And so trying to convey that to our people and making sure they retain it and that can actually apply it on the job site, that's going to be a challenge. And that's probably why we do have a fair amount of falls every year and why we haven't made it a good inroads into reducing the number of falls that we have. But so again, the whole point of that wasn't really to go through the fall protection standard, but more just to tell you there's a lot of information we need to get across to people, and they need to be able to use it, apply it and use it in their job site. And just to throw in something else, again, there's been a lot of study in the last 40, 50 years on how people actually learn and what the best methods of trying to help people learn material. And so I'm by no means an expert in this area, but doing some research and looking into it, there's a couple nice papers out there that give you kind of a basic overview. But the idea is that people have different ways of learning, and so the traditional ways of maybe of going through a PowerPoint or a chalkboard or whiteboard and talking to people may not hit home with everybody. So when we understand that there's different ways that people learn, hopefully we can adjust the way we present the information and try to reach a larger crowd. And so this paper by Cassidy gives a nice overview of different types of learning styles and things that can affect learning. So like cognitive style, that's really the process of how we think and how we interpret information that we're seeing in our environment. So it's really how we're hardwired. It's really that basic processes that we're mentally going through. Versus learning style is kind of like how we apply that process of learning in different situations. And then there's preferences. Again, not everybody, you know, we may be able to learn by reading a book and watching a video, but maybe we prefer reading a book in certain situations. So again, we all might have certain preferences that we tend to draw on from different, again, from time to time. Again, sometimes there's different reasons why we want to pick up a book versus seeing somebody actually do it. And so again, those preferences may be different for the different times, different things we're trying to learn. Curry also gives a different viewpoint of learning. It's more, to her, it's more like an onion where there's layers of learning. And again, that base, that number 4 is that cognitive style. Again, that's sort of where we're hardwired. It's who we are. It's how we think. And then we go up from there. We go kind of from our inner being to being more affected by things outside of us. So, you know, our social interaction, are people better at learning when they're working in a group, or are they better working independently? And so again, these are some things that we kind of have to consider if we're trying to really reach a larger audience, because again, we don't have just typically one age group or one, you know, we have different people that we're trying to cater to and trying to reach. So again, we need to understand that we may need to use different levels of learning styles and presenting our information to people so that they, you know, we can hit on these different learning styles that people have. So writing in China, they also had broke out learning out into the more like a holistic analytical version and verbalizer and imager. So they put these more as two different dimensions where, again, if you're a holist, you really want to see the whole big picture as you're learning to know how your piece fits in that whole big picture, where maybe if you're more analytical, you don't really care about the big picture. You're more looking at what's affecting me, how, you know, I just want to know what my job is, and that's all I care about. Versus somebody who learns by verbalization, so seeing the written word, hearing people talk, that really hits home with them. Or people may be more inclined to learn by seeing somebody do something, watching videos, seeing a demonstration. And again, these are definitely not independent of each other. They definitely mix and overlap with each other. And so again, different situations, different types of information, we may fall into one of these categories. And I kind of wanted to speed up a little bit and get into this bottom section here. This Bloom's taxonomy, you may have heard of this. This was established in the 50s and it was reworked in the early 2000s. But the idea is there's 6 major elements of learning, and it really starts in remembering. Let's just get some information to people that they can remember. And then it goes up the chain as far as how we can take that information and actually apply it, evaluate our working conditions, and then also use that information to maybe create solutions. So again, I think what we're trying to get when we're talking about fall protection and trying to relay all that information to people is not just that they remember that there's a standard out there, but understanding the standard and being able to apply it in their actual real world environment. So again, I just really wanted to touch on that a little bit just to show that you know, there's a lot of information in the fall protection standard, but there's also a lot of different ways people learn. And so how do we do that? It'd be great if there was a tool out there that would help us do that, right? So that's where virtual reality comes in. And again, like I said, I'm a real believer in this. I think this is going to be a game changer for the safety industry. I think it's really going to be the wave of the future. It's what people are going to be using. Again, it's a tool. It's not going to be the only thing we use, of course. But it definitely, for certain types of topics, it's going to be very useful, and it's going to hit the message home. And for, again, the different types of learning styles and learning methods, it crosses a lot of those different barriers. So again, whether you learn by seeing or you learn by hearing, almost touching, all those sort of things, that's what virtual reality brings into this environment, and it lets you get across your message to a bigger audience. And I think it also, you know, like they say, pictures are worth 1,000 words, where, well, this is definitely worth a million words, because again, once you get into that environment, you're immersed in that environment. That becomes your new reality now. As long as you have that headset on, That's all you know. And again, if you've never tried it, it's hard to explain. And again, I wish we weren't in these COVID times and we were able to actually demonstrate and have you try it on, because it is definitely a different experience. Again, I've had people crawling around on the floor because they were afraid that they were going to fall off a 30, what they thought was 30-story high I-beam, So it really, again, it's definitely something that is very immersive. It's engaging. It gets people thinking about their environment. Again, one of the things that happens is it allows you to interact with the environment. So as you move, as you do something into the environment reacts, and that simulator will respond to what you're doing, so that, again, if it can detect where your head is, where you're looking, if you turn, if you duck, all those sort of things. It can track you and see what you're doing, which in the end is very interesting, because you can collect a lot of metrics on that, and you can see where people are looking. You can see if they're honing into particular hazards or particular situations that they should be focused in on. So if you're trying to, again, teach people about fall protection, and they should be wary of a particular, again, a harness that isn't in good shape, or again, something they should be locking into as far as connecting their lanyard to. This will really, you can get that feedback and you can get that data, and you can use it to hone in to say, all right, we're seeing a trend of people really, they keep missing this particular thing. Let's go back and train on that, so that we know that people are solid when it comes to X, Y, and Z. So again, how the software works, it really creates two images in your head. So you're looking at two images on both the left and, one on the left, one on the right side of your, what you're looking at, what your vision is looking at, and it creates your brain goes ahead and does the work for you and makes this 3D image. And again, you feel like you're really in that space, even though it looks like a cartoon, even though you know it's not real. Everything else is telling you it is real. And like I said, with fall protection, you definitely feel like you're at height. You get the jitters in your stomach, and again, I better use my harness or my lanyard and make sure I'm connected so that I don't fall, or if I do fall, I'm going to be protected. And it really it touches on all your senses, really. And like I said, it has this ability to detect your body movements, where you're looking, your head movements. And so again, your environment changes as you change, as you interact with it. And again, it really gives you this effect that you're in that environment, that it's real. And then again, if I don't do something, or if I make the wrong move, I'm going to feel the consequences of falling, or whatever we're training to. I know this seems like it's kind of new technology, but really virtual reality's been around since the 50s. Some of the most earliest types of technology of virtual reality were things where they'd show you a picture. You'd look like this picture shows you. You're looking in a booth, and they're showing you a 3D picture, and they're having things like the chair vibrates, and you have a fan blowing air into your face to simulate wind and those sort of things. And then over the years, again, we've advanced and made definitely gotten the technology to be better, to where we've gotten to 2016, where we had the HTC Vive and the Facebook's Oculus come out, where again the advancement in electronics have gotten small enough. We can store a lot of information, and again, it processes the information fast enough where it actually feels real to us as we wear in these portable devices. So now we can actually put things on our head and use controllers in our hands and actually be simulated like we're in that environment. All right. So again, like I said, if you haven't been exposed to virtual reality training, or again, virtual reality as a game, you will be in the next couple of years. It's definitely something that's not going away. Initially, this was put out there by the gaming industry. It was meant to, again, be for residential use, household use for games. It didn't really take off too well initially. But they found a niche in the safety environment. And so, again, you see a lot of these gaming industries creating the software for and the modules for different safety training topics. So that's why, again, the quality of the graphics is very high. It does cost a lot of money to make these modules. So right now, getting a customized module for your particular business or the situations that your employees may be working in is, it would definitely be a cost, and it'd be a lot of expense that you'd be investing. But they do have a lot of off-the-shelf solutions right now, and they're continuing to build their libraries and develop the modules that they do have. But you can see here, the estimated $8.5 billion industry by 2023. Again, I don't know how COVID slowed that number down and the advancements. Obviously, we haven't been able to do the types of trainings we had hoped to, but I'll talk about that in a few seconds. But again, I don't see this technology going anywhere. I think we're going to continue to incorporate it and use it more and more in our workspace. Again, like I said, when you see people use it for their work and see them actually get excited about safety and going through a topic and actually learning what you want them to learn, and maybe they don't realize they're learning, this is definitely a win-win for everybody. They enjoy going through the process. For the hundreds of people that we've walked through our demonstrations, I haven't had one person who had a bad experience. Everybody has seemed to enjoy it and really get a kick out of it, and really can't believe how realistic it actually feels. So again, there's been some studies by some third-party people like the University of Michigan, University of Maryland. Some other studies have been done, and they can show that there's been improvement in how people have learned information, how they've retained it over time. Because again, it's not just walking through and trying to memorize different parts of the standard or what I need to do. You're actually having an experience when you put this on. And so from that experience, that helps you remember and learn and retain that information. It's very realistic. And again, like especially with fall protection, it's kind of one of those things where your brain's fighting you, because again, it feels like a cartoon when you first put it on. But when you're, again, get in that elevator, it takes you 30 stories up, and you get off and you're walking on that I-beam, it doesn't feel like a cartoon anymore. It feels like the real thing. And like I said, you really feel like you need to make sure you're protected, locked in, so you don't potentially fall. So, and again, there's other things that help enhance that feeling and that immersion. Again, putting in sound effects and other kinds of things, birds flying by and cars driving by and all those sort of things. And again, like I said, the environment is engaged in what you're doing. So as you move, it moves and it reacts to what you're doing. So again, you feel like when you're doing something in that environment that it's actually happening, that you're making a difference, you're causing something to happen. So again, we've been working with a company called Pixo. There's a lot of different software companies out there. And like I said, they've all been trying to build their libraries at this point. Certain companies have different modules, and some are better than others. So again, there's a lot of different software that's starting to become available. There really wasn't a lot to begin with, but fall protection was definitely one of them that's been out there for a while. And it's definitely one that, like I said, hits the mark with just everybody that we've tried it on. So one thing I would say about the different types of software is you got to make sure that the hardware that you use is compatible with the software. So if you're expecting to work with a particular software company, that your hardware that you purchase will actually work with that company's software. Again, they're getting better at it, getting better at trying to work with people on that. But again, a lot of these platforms that they're building these modules on work with certain types of hardware. So that's just something you want to make sure that you investigate first before you go and invest in the software itself. So the other nice thing about virtual reality is that, again, you can put people in potentially really dangerous situations but again, they're never going to be injured because it's a simulated environment. So again, you can have them in a HAZWOPER situation, a fall protection situation, confined space. Again, they can go through the motions, they can make mistakes, see what the consequences are, but not really, again, have any bodily harm done to them. And then again, once they pick up on, what they did wrong, they can make corrections and they can go through it again and do the right thing. And then again, that gives verification that that they've picked up on, again, what they did wrong, and they're improving. They understand what's going on now. So you can make the software randomized, where again, every time they go through it, it's a different situation. They do different, the software and the environment will change in different ways. Or you can have it be like a process. You want them to understand how to do the specific task. You want it to be done the same way every time. So if they do make a mistake, you can go back and try it again until they get it right. And show that they're proficient in that. And so again, you can have it be randomized, or you can have it be the same every time. So again, there's a lot of good ways you can use this software to benefit your training and safety packages or programs that you're trying to put together. There's a lot of different types of hardware that's out there. So again, the ones we've been using are the Oculus is what we've been using, and the HTC Vive. But there are definitely other manufacturers that are out there. And again, the software companies have been building programs and modules to work with those different types of unit. But again, it really just depends. The HTC Vive comes with you're basically hardwired to a computer. So there's a hard line that connects to a computer, which is a little bit of a limitation. But being connected to an actual computer, you can have a very more powerful display, more higher end graphics. It works a lot faster. So again, the HTC Vive with that line gives you a overall better experience, but again, you are tethered to the computer with that. The Oculus is very good as well. Again, the quality, I would say, doesn't really, the drop off in quality, whatever there is, doesn't really come across that much. You really still feel like you're in that environment using the HTC Vive. But this is nice. I mean, I'm sorry, the Oculus. But again, it's really nice because it's portable. You're not connected to anything. Once you have the software loaded on there, and again, it's wireless as well, so you can download things over the internet into your headset. So you don't necessarily have to connect to a computer to get the information or get the module on there. But once it's loaded on there, again, you can use it wirelessly and you can move around as much as you need to, as much space as you have. So again, it's a little bit of a trade-off, but again, I think the Oculus is a little bit more portable and easier to use that way. And like I said, these software companies definitely make it so that the learning management systems that you're using, you can integrate them with this software so that, again, you can get the metrics that you're looking for. So again, if you're trying to make sure everybody sees these particular hazards in a simulated environment, that they're actually seeing those, and if they miss something, again, you've got that information to go back. Or if you're timing people to see how long it takes people to complete a particular task, again, you can record that information and see that for each individual person. Again, if you're starting to see trends, then you can go back and train on those specific items that maybe you need to hone in on. So again, like I said, we've been using or partnered with Pixel. There's a lot of other software companies coming out that are available. So again, I'm not trying to push Pixel, but they're just the ones I'm familiar with. They do have, and they're working on their library. They're expanding it. They do have a number of different solutions that are out there right now, available for everybody. One of the things about using virtual reality is you definitely need space to maneuver. So again, the best environment is like a 10 by 10 area that you can work within. You can work in smaller areas. It just sometimes the graphics go away, and again, if you're trying to get on that elevator or something, you can't actually push the button because you're in too small of a space. So you need some space to move around in. The other thing again is when you put the headset on, you are locked into that headset, and so you're not really seeing anything beyond what your environment is. If you do move beyond your border or your boundary that you set up inside the headset, it will transfer over so you can see your actual room, so to help you prevent from tripping and falling over things and those kinds of things. But really, once you put it on, you're kind of in that environment. So again, you want to make sure you have enough room to move. Typically, again, these also come with joysticks or hand grips. And again, those help you move throughout the environment, manipulate your gloves, manipulate tools, and those sort of things. There are some, if you're going to use a computer system to operate this type of technology, definitely some minimum requirements that you're going to need. Again, you want a good graphics card. You want a good amount of RAM. You want it to be able to process a good processor so that, again, these graphics can be done quickly, because if you get to below 90 frames a second, now you start to get, you could have the potential of getting motion sickness. So again, you want it to be fast enough that it can process the software and move through the different module portions or elements fast enough that you're not going to get that. All right. And like I said, they do create this software on different gaming platforms. So again, they're not all the same. So you really need to do a little homework before you start, again, investing your money. So so just remember that. I was going to show you a video, but again, I don't think we have enough time to really get into the video, but it really just kind of gives highlights what the environment looks like. And again, one of the nice things, if I get to this one here, again, this is another video. Again, COVID definitely put the brakes on trying to train this way. It made it very difficult to train people by putting a headset on them and then giving it to somebody else and putting the headset. Obviously that wasn't going to work. So one of the things that these systems offer, if you have equipment, if different people have equipment, you can do training across distance. So you don't have to be in the same room. People can do it just like we've been doing this video conferencing in different locations. They can be across the country, whatever. As long as everybody has a connection, everybody has the hardware, you can do training. And you can also have instructors actually come into that training module and help direct and guide people through that module to give them some assistance as needed. So again, when we start talking about COVID and stuff, there are some ways around it. They do have, there's protective barriers you can put on that are made out of paper, just like if you're going into a clean room or something, that would protect your head, that cover your head and most of your face. Again, they have goggle protectors that you can put on. They have what they call a clean box, which is basically like your phone soap or other devices that use ultraviolet UV rays to destroy viruses and bacteria and stuff. And so in between users, you can put them into devices like that to try to cleanse and sanitize the equipment before you let somebody else use it. So there are some things to help advance that. Again, I think it may be still a little while before people get comfortable doing that. But like I said, there are ways and equipment out there to help it, get us hopefully past that once we get to a more normal part of life, or back to what we would consider normal. So again, the advantages of using virtual reality technology, again, it really puts people into that learning or into that environment where, again, if you want them to learn about fall protection and when to use the harness, what type of harness to use, make sure they understand how to inspect it, the things to look for. Again, it really feels like a real environment. It's immersing. You're in that environment, even though it looks maybe initially like it's a cartoon. You definitely get pulled into it real quick. And again, the idea is that people will walk away remembering the information you wanted them to learn. And again, they've got studies that kind of that show that. And again, because they remember it because it's an experience. It's not just a session of sitting down and hearing people talk about it. You're actually living it. You're manipulating the environment and all those things. Some of the disadvantages, of course, right now the programs or the modules are expensive. It does take a lot to program these modules. And again, like I said, right now most of it's being done by gaming software manufacturers. So again, really high-end graphics, but it takes a lot to get it done. So again, it's expensive. So if you want to get something customized, it's not that it can't be done, but it's going to be a a good capital expense to get it done. So, if you use, I would say I would limit people to definitely 30 minutes or less probably at a time wearing these, because again, over a certain number of minutes wearing this, it can elicit some feelings of a headache or, again, nothing severe, but again, you want to keep people safe and healthy and feeling great about the experience. So, and again, if you're trying to run a number of people through a particular module, 10, 15 minutes is a good time frame. One of the other things I'll say is, even though you have somebody's wearing a headset, you can do this as a classroom setting, because as somebody's going through that environment, they can, you can cast it to a TV, and people can see actually what people are doing. So it is kind of interesting that way. And again, that brings up a lot of other conversations and discussions, and again, reinforces that training that you're trying to provide. Like I said, you do have some space requirements, and again, there's some Wi-Fi and other hardware requirements that are needed. So again, hopefully I did a fair job explaining virtual reality, and again, how we can take all that fall protection information and those different ways of learning and crossing those barriers by using virtual reality. Again, it doesn't really do it justice to talk about it. You really got to try it and experience it. And again, hopefully we'll be able to do that sometime soon, and really let people get back to experiencing how this technology works and how it can benefit your workers and your workforce. And again, I know you're going to be using this in the near future, one way or another. So with that, I'll turn it back over to Phil, and we'll take it from there.
Chris, we have the time for one quick question. I know you said the costs can vary.
Sure.
Could you give us an estimate as to what this may entail?
Sure. So right now, just working with this company, Pixel, that's what I'm familiar with. They have different platforms that you can get on. It depends on how many users you're going to use. So if you want to use 50, I think that the dollar amount is like $600 for that initial platform. So 50 people are able to use this particular software, and then they give you another package that actually includes the software. So $600 to set it up initially, and then another $600 for, I think they give you 3 different modules to use per month, and that's a monthly fee. So again, it ranges from about, if you think about $1,500, say you're thinking about doing a safety day and you want to have this on site and let people try it, you can expect about $1,500 for just the software. And then you're going to have to spend probably, I think the Oculus costs, $500 to $600 per unit. So however many units on site. So that's kind of gives you an initial ballpark. Again, if you expand it into having kiosks and other things like that at your site, it's going to cost a little bit more. So those are some of the initial costs, but it definitely can get much bigger.
Thank you, Chris. Very much appreciate that overview. We found with technological advances, often we are faced with new challenges. So we thank you for giving us some of the means to navigate this area. Thank you, Chris. The area of PPE has experienced a number of interesting developments over the last few years. We are extremely pleased to have an expert on this issue, Mike Ziskin of Field Safety Corporation, to speak on this topic. Mike? Okay. We'll be with Mike in 1 minute. And one of the things that we have found about this program has been the diversity of topics that we have been able to present today. The range of issues that's been discussed have been amazing, and we look forward to expanding on them in future months. In fact, we very much invite you to contact me at CBIA if there are other issues that you'd like us to explore. And we also invite you to let us know if there are other safety initiatives that CBIA should be involved with. We realize that often safety generates from the federal level, but we do get involved in these issues because they're pertinent to our members as well. So we do hope that you do get in contact with us when you feel these issues should be addressed. The other thing I'd like to remind you of is that we very much would like to hear your feedback as far as the evaluation. We want to know how this day has been for you, the issues were covered, were they relevant, and if they provided you with information that you felt you needed. And we will pause for a couple of minutes, and then we'll be right back with Mike. Thank you. Hello, and welcome back. Our tech issues have been resolved. We now have Mike in video and audio. Mike, if you could take it over.
Thank you, Phil. Good afternoon, everyone. Pleasure to be here. My presentation is entitled Personal Protective Equipment. It's not just about respirators. In fact, this presentation is going to focus more on wearable technology applications and advancement. We'll cover a variety of personal protective equipment that is integrated into wearable technology, and it will not cover traditional forms of personal protective equipment, and that will include respirators. A little bit of historical perspective. In the United States, companies will spend over $20 billion in direct costs each year on different levels of accident and injury cases. On a per case basis, these injuries carry a really hefty price tag from workers' comp claims and treatment. Back injuries alone can exceed up to $80,000 per case in direct costs, not including lost time to recovery and work hardening, which is preparing to go back to work. Carpal tunnel syndrome affects some 2 million workers per year. Average cost about $47,000 per case, leading to around 500,000 orthopedic injuries. And that's information provided to me from the CDC. As an example, in the UK, there has been about 8.3 million workdays are lost due to some type of musculoskeletal disorder. That's about 42% of all work-related illnesses in the UK. MSD has become a chronic condition affecting an individual's long-term health and quality of life. Yet other programs to prevent workplace injury are, on the whole, doing very little to curb the growing burden of workplace injury and recovery. So as a result, employers and insurers are actively looking for more effective, objective solutions based on fact and not guesswork. So this is where wearable technology comes in. It can offer employers an opportunity to take risk assessment to the next level, providing in-depth understanding of the demands that a given task or job is putting on the human body. That allows employers to gain a combination of accurate movement data and muscle activity information from real situations on site, whether it's in a warehouse, in an office, a hospital, or even a construction site. Wearable technology has given employers insight into where injury risks might occur, such as when a worker is lifting heavy objects, or if they twist and turn in a way that places strains on the body, helps them champion initiatives to address the risk and to prevent injuries from occurring, which leads to providing a safer workplace. So wearable technology is quickly becoming a critical new tool to significantly advance the work that ergonomists and occupational health and safety professionals do every day in reducing workplace risk. And it can add objective data about movement that the human eye simply cannot see, complex movement patterns, muscle activity, the effect of fatigue, especially over long periods of time. Wearable sensors enable monitoring over time, over a whole shift perhaps, which adds to a new depth to the data occupational health and safety professionals have on hand. This all allows companies to make important investment decisions to ensure they're creating and maintaining safest work environments possible. Relative to loss of productivity, wearable technology can establish the functional requirements of a job, and that's going to be the next step in improving return to work programs. Understanding the physical demands of a job accurately and objectively means that return to work can be better managed with risk controlled and better outcomes for the individual and the company. So as one example, and this is an aircraft manufacturer in Kansas, very impressive data. They discovered the benefits of wearable technology when they implemented a plan to tackle various types of rates of exertion causing injuries and chronic pain. Work required employees to work alongside and underneath aircraft fuselage. This work involved reaching overhead to perform welding, installation of equipment, or finishing tasks for extended periods of time. Continuous reach was creating back, neck, shoulder problems for employees reporting high levels of pain after work and on off days. Modular ergonomic exoskeletons designed to augment workers' natural strength and provide support for the upper extremities. Workers found it much easier to reach or look overhead. The employer reported reduced rates of MSDs, saving thousands of dollars or more on claim costs while improving productivity, health, and morale. Another example is a mason contractor. By using new and adjustable mortar boards, which happen to be developed by one of their own entrepreneurial employees, Wearable sensors placed on the worker's body documented an 80% reduction in low back muscle activity and up to a 70% reduction of high-risk movements, plus a 17% increase in productivity, and that was measured in bricks laid per minute when using the new adjustable mortarboard versus the old way of doing things. So as part of the overall health and safety process, wearable technology is a valuable tool in the life cycle of workplace health and safety, and therefore it should be a critical part of occupational health and safety plans of a business. Wearable technology provides an objective and accurate source of data on worker movement, potential injury, and by acting as an aid to rehabilitation. This technology takes the guesswork and high costs out of current workplace health and safety practices. Relative to where wearable uses and personal data need to be confidential, among the uses for wearables are proximity detection, ergonomics, and monitoring fatigue and stress levels. One concern is the confidentiality of data collected on a worker, much like personal exposure monitoring. NIOSH recommends alleviating privacy concerns through transparency and giving employees the opportunity to opt out of programs. A University of Michigan professor suggested that using data for self-assessment or through a group of workers might aid in the acceptance of wearables. So let's face it, you wear it, it measures. Attaching mobile electronics to the body, it can connect to the internet, can track personal data from small fitness devices on your wrist to full body exoskeleton for performing strenuous work tasks. If you will, smart PPE. Imagine glasses with heads-up displays and hard hats with sensors. Watchful eyes, a big concern to help ensure the workforce health and safety, but working alone no longer. Now we can use wearables. This isn't really new. If you think about gas monitors that have been worn by personnel for confined space entry and for other activities, this has been around for some time. Proximity measurement and or alarm when near equipment is technology that has been proven and has been implemented in numerous organizations, large and small, general industry, construction, what have you. There's been shown a decrease in events of unwanted human to machine and machine to machine interactions. So the industry is growing. It is expected that it's going to double in the course of 1 year. In 2022, the expectation is in US dollars, 27 to $60 billion will be spent on wearable technology. More than 3/4 of safety professionals that have been surveyed were either in favor of using wearable technology for workplace safety or at least had some interest. So when we talk about wearable technology, we're talking about devices that can perform numerous functions and thus can be placed at various regions of the body. Let's explore this a little bit more. The first application of wearable technology was a patent that was awarded back in 1924. Lie detector testing was a form of wearable technology that was invented many, many years ago. In 1965, telemetry systems involved with NASA assessed astronauts' medical data and performance, and that led to applications in healthcare and business. So this was transferable technology. The company Polar had a heart rate monitor. It was wireless. It provided scientific measurements out of the lab and was applied onto athletic fields. The company Volman The product Volman 1, which came out of Carnegie Mellon, was technology that could be worn by individuals that would allow them to view blueprints, and this was applicable for architects and contractors. The product Forget Me Not came out of Xerox research, registered movement and interactions for time management studies. In 1994, wrist computers were brought to market. These were worn by repair technicians and other mobile workers that could enter and analyze data on site with simplified keyboard display, one on each arm, as you can see in the upper right picture. Nike created a product which was actually the forerunner of Fitbit, and Jawbone, which are activity trackers, shoe-mounted accelerometers to record pace and distance. In 2009, Hitachi Business came out with a microscope, which gauges movement. Workers can identify when they're more focused. In 2009 as well, a product called Mindset EEG, which is the first commercial EEG monitor to identify brain patterns associated with creativity. So we today have a variety of technology with an abundance of different applications. What you see in this picture is an example of a survey that was conducted where people were asked, what would you accept as far as wearing wearable technologies? And you can see that wearing wearable technologies that's either clipped onto clothing or worn on the wrist was more favorable than some of these other applications. And then, any wearable technology where it was being tattooed on the skin was least popular of all. The winner thus far in wearable technology goes to the smartwatch, which in 2018 resulted in about $85 million worth of products sold, and that's worldwide. Today, we have various devices, computer or advanced electronic devices, if you will, that are worn on workers' body, their clothing, or personal protective equipment, designed to collect and deliver data about workers' environment, activities, and biometric conditions. This technology is also able to detect and warn employees of the potential for injury or reduce the seriousness of an injury when one occurs. It helps to prevent injuries and absenteeism by providing manual handling data. It's been shown to boost productivity and efficiency. Increasing safety in various industries has been established: automotive, chemical, oil and gas, and there's been much improvement in vision and hearing arena. Devices are getting cheaper, they're getting lighter, they're getting smaller. This is encouraging employer to consider investments in safety technology. As an example, 2018 Virgin Tech's report, found that 58% of the respondents regard industrial wearables. These are wearables that are wearable technology used in industrial settings to improve productivity, safety, and efficiency, that there was significant to their upcoming operational risk management initiatives. So some of the primary functions of wearables includes things like tracking worker location, overseeing vital signs and environmental risks, mitigating risk by issuing information remotely, reducing exposure to musculoskeletal injuries, and it also in improving staff training. As far as location training goes in this application, clips, equipment tags, worksite sensors can be used to detect location. And it comes with a lot of advantages. For instance, one construction company tracking worker location constantly responded to a worker fall and injury at a rate of 40% faster. Ranges of wearables monitor workers' vital signs, smart glasses detecting sleepiness, and smart clothing monitoring heart rate, variability, and breathing volume. One study on monitoring worker fatigue with wearables gave employers almost real-time intuition to worker fatigue and productivity. Moreover, wearables can identify natural gas. High-risk temperatures can also be identified to manage heat stress and to establish breaks for cooling off. Field staff have often required information when out on a location, and that's where wearables can also come into play. For instance, voice-activated and hand-free wearables give staff quick and easy access to documentation and information they need. So this boils down to portable and timely access to sensors, computers, and electronics. The industry's emerging access to multifunctional technology and its ability to collect and analyze relevant data, which is revolutionizing worker protection. And as you can see in this diagram, there is a definite, very strong relationship between what a worker is wearing and how that information can be transferred so that actions can be taken. Another example of wearables, which would be in providing audible and vibrational alarms to warn workers when they're getting too close to danger, such as moving equipment or working on a leading edge. So in these pictures, the top right, you can actually see technology that is both on a worker as well as technology that's actually mounted on a piece of equipment. This allows communication between the operator of the equipment and the worker so that if there is a potential risk of contact, there could be a sensing alarm that would determine of this condition that would warn the worker of the danger, as well as alerting the person operating the piece of equipment of the need to halt the use of that equipment. In the picture to the left of the piece of equipment, you'll notice a worker looking up at a pole, and that is an energized pole with electrical current. The worker is wearing wearable technology that would inform the worker of electrical energy levels that the worker would need to be warned to stay away from. We also see the application of technology, as you can see here with this powered industrial truck, that again would have a signaling system so that there would be distance maintained for specific operations. And this application can be utilized on virtually all types of situations where we have moving equipment and we have workers in close proximity. Wearable sensors can also be deployed in numerous configurations that make wearing them simple, easy, and unobstructed. Methods of employment can include attachments to hard hats, safety glasses, or personal protective equipment. Clip-on wearables can be attached to shirts, vests, and belts. Wearables can also be embedded in the soles of shoes or worn as insoles. And as you see in this picture, the technology has actually been integrated into the garment that this individual is wearing. Wearables can provide visibility to see and be seen, to warn others when workers are too close to danger. I mentioned this before, such as equipment operations. In these top two pictures, you notice an individual wearing a safety vest. But the safety vest is embedded with wearable technology, whereabout this reflective trim actually absorbs solar energy. And when the worker moves into darkened areas, it illuminates like you see here. On a personal note, all of Field Safety Corporation's personnel that perform field inspections have been outfitted with this technology, and it works quite well and has increased their level of safety as a result. The bottom left shows a light band that can actually be placed right over the hard hat. And this does two things. There's very strong illumination that occurs from the front, like you'd see on the picture to the right. But it also provides illumination 360 degrees, which, as you can see, the individuals in the background, just simply demonstrating how visible that they can become in darkened areas. Wearables can be used to warn the individual of hazardous physical movement, such as bending, twisting, reaching, or lifting. This can provide caution to a worker when they are nearing exhaustion, to alleviate muscular or skeletal joint stress by assisting with lifting, or working overhead. And in emergency situations, devices are designed to alert emergency personnel and lead rescuers to injured workers' locations. And these products have become commonly known as man-down alarms. Another category of wearables are called visual wearables. These are optical aids that can be in or on glasses, visors, or hard hats. They can produce images for remote viewers and or the wearer. Can bring value to training, to troubleshooting, quality control, other situations where visual representation of a concept is needed. This type of wearable connects field employees to remote technical supervisory employees, allowing both parties to view items simultaneously. Sharing visual information overlaid on actual work environments can enhance instructions, training, and verification practices and materials. Another benefit of this type of wearable is that field workers' hands remain free to work while they are discussing solutions or working through an issue. And you can see on the right an example of this technology where what the individual is seeing, they're also being provided technical data, which the individual can also view on the glasses. So these products then can be outfitted so that communication between individuals can be done wirelessly, hands-free, with complete interactivity. There are also technologies that are being developed as we speak. And that includes batteries that actually operate on your temperature. So at Colorado University in Boulder, research has developed this ring type object or bracelet. It could be embedded in other technologies, other accessories, where it touches the skin. And then there are thermoelectric generators that convert internal temperature, internal body temperature into electricity. Basically 1 volt per square centimeter of skin space. The application would be to power watches, fit trackers, and other small devices. There are also what are known as tactile wearables. And these are devices that work as an exoskeleton to increase the user's strength and durability. Tactile wearables are designed as exoskeletons that provide extra strength or endurance to the wearer. They also limit the force on the wearer's musculoskeletal frame. Force is constantly monitored, and the wearable responds to protect the wearer. The potential for strains, sprains, and back injuries can be reduced while simultaneously increasing a wearer's capability, capacity, and endurance. It's kind of like an Ironman in a way. So we call these exoskeletons workers that are exposed to repetitive heavy lifting, where there's difficult working environments and work positions are such that there's a risk in developing musculoskeletal disorders. In the UK, between 2017 and 2018, there were 6.6 million working days that were lost to work-related MSDs. The good news is that this type of technology that you see on the right can assist with the heavy lifting. It can monitor fatigue, and like all wearables, exoskeletons skeletons range hugely from full body armor to very discrete designs that might be placed on only certain regions of the body. And here you can see an example of a full body exoskeleton and an example of how that exoskeleton functions in harmony with the worker's movements. So if you will, it's like a computerized Iron Man shell. These are in use now in certain industries. So let's take a look at some of those examples. So you can see here a hand tool that this individual is holding, but you'll notice that there is assistance by this device so that the individual is actually using only part of their strength, not having to overexert, because that's being compensated by the wearable technology. Another example of an exoskeleton of limited coverage of the body, but again, able to offset the strain and stress of manual lifting. In aircraft manufacturing, this has proven very successful, and aircraft manufacturers have been integrating this technology to all workers on the production floor engaged in high-risk activities. So you can see in these two pictures the application of an exoskeleton, which is designed specific for certain types of work functions. This is another example in the manufacturing industry of different types of exoskeletons, again, that are designed and configured for certain types of work tasks. Now, mind you, some of these devices aren't cheap, but the price is dropping substantially as the integration of these devices into the workforce continues. This is a close-up of some of the technology that goes into the operation performed by the hands. The sensitivity range is exceptional, so that the technology can be programmed and calibrated to meet the needs of the work task, whether it's high level of dexterity, tactility, any kind of movement. In the construction industry, where there's a substantial amount of physical overexertion potential, you can see here is upper body exoskeleton being demonstrated to offset what would normally be very strenuous lifting, especially lifting that occurs above the shoulder line. Again, other examples of exoskeleton technology that are designed for specific work tasks, as you see here. The exoskeleton technology is also being applied to military and law enforcement. as you can see in the picture on the right here. Now, with regard to individuals that have disabilities or in the performance of certain types of work activities, there are a wide range of exoskeletons that have already been designed, developed, and have been in use for some time now. So here you see some examples for those that are disabled or partially disabled, where exoskeleton technology, improves their daily function. Here you can see an individual that is wearing an exoskeleton device that actually turns into a chair at will, whenever the individual needs to position their body at rest. There is simply a lever switch, if you will, that can be executed by the user that will reconfigure that exoskeleton into the shape of a chair, and the individual wearing it has complete balance. And then there are other applications that you can see which are perhaps more recreational in nature. Regarding wearable sensors, these are devices that can sense a worker's biological, environmental, and physical conditions. And I did mention these earlier, just want to go a little bit deeper here. So we're talking about sensors that perform that analyzes data using edge computing and warns the employee of hazardous situations that can lead to an injury. So these sensors include badges, actuators, biosensors, gyroscopes, and more. They record and evaluate the worker's physical condition, location, and environment. These wearables can sense location, impact, motion, temperature, vital signs, blood gases, and evaluate and interpret the data to provide actionable information. On the right, you can see a couple products that are currently on the market. This is called the E4 wristband. It provides physiological data. Here's the T1 smartwatch band. This performs body temperature, also heart rate, blood pressure, and both are designed in a bracelet configuration. This is another example of technology for wearable gas sensor for health and environmental monitoring. Penn State and Northeastern University have been partnering on this. So these will pick up various types of gases that could be present in the worker's environment. This is a product known as lightweight e-skin, developed. It's by Takeo Somiya, professor at the University of Tokyo's Graduate School of Engineering. It's ultra-thin polyvinyl alcohol, a very flexible material. It can be applied to the chest area with a water spray. It will last for about a week. And what it does is it picks up signals such as heart rate, electrical impulses from muscle movement. It will then transmit the data to a smartphone, laptop, or the cloud. It's thin, it's lightweight, it's stretchable, and it's durable. So these wearable sensors can be placed on the skin. It could be integrated into a hard hat design. It can be embedded into footwear as well. And all of this technology could then transmit data, as I mentioned already. And then that data, once collected, can then be filtered, analyzed, stored. Decisions can be made. And those decisions can be made based on such things as construction management, decisions involving emergency situations, or decisions that go into some kind of a database based on what the project is that might be being implemented. Wearables not only have value for individual workers, they can enhance a company's ability to manage safety experiences as well. Most wearables feed data to customized dashboards, which allows a company's leadership to view and evaluate performance data associated with the entire organization, specific job sites, job categories, job functions, and employees. The data and subsequent analysis helps identify specific areas of exposures that have the potential to increase injuries. It also provides the opportunity to alter operations prior to accidents or injuries. One insurance company's ongoing pilot program, wearables decreased unsafe lifting behaviors by up to 38%. The predictive analytics produced by wearable devices, combined with behavioral changes by employees and corrective measures by leadership, present new opportunities to significantly reduce, in this case, construction worker injuries. Implementing a wearable program does take time. It's a process. It requires upfront planning. Questions need to be answered relative to what data do you want to obtain. That's going to drive the selection of the technology to choose from. So as an example, stress and strains of heavy overhead work, the exoskeleton wearables might be applicable. For material handling exposures, the biomechanical wearables might be the selection. For the location of employees and their physical environment, biometric wearables might be chosen. So once the types of wearables are chosen, then a pilot program should be initiated. And that usually is done in partnering with stakeholders. That could include insurance carriers, your customers, and other types of industrial organizations for cost sharing, brand recognition, and to generate industry experience. Last but not least, wearables can be used for safety training. Virtual reality headsets allow users to experience a fictional environment and practice safety procedures. Saves the hassle of bringing in an in-person trainer for staff, may be applicable for certain types of learning experiences. Plus, workers can complete safety trainings without the real-life risk working at height or using dangerous tools. Limitations. So one significant limitation is that the wearer is concerned about how the data that's being generated about them is managed, how it's stored, how it's being used. Is it being used to their advantage, or could that data be used to terminate the individual? So the best way to go about, or not the best perhaps, but one way to go about dealing with that challenge is to be as transparent as possible in dealing with the workforce, being clear with staff about what data the wearables will track, and explain the reasons behind their introduction to the workplace. So in addition, bringing wearables into a company is a financial commitment. And wearable technology does vary widely in price right now. It's a new area that is being exploited. And I think, as we've seen with other new technology, the price will drop as the use increases, the demand increases. So, as an example, a simple fitness tracker has about a $40 starting price, but they're much more widely in use. Smart glasses, which are not of the same degree of popularity, they're going to have a higher price point. However, as we know, work-related injury is expensive. So, we look at one report, U.S. employees spend over $1 billion each week on work-related injuries and illnesses. In this sense, using wearables to lower injuries and in the long run, costs might be the right choice. So it's not a short-term investment. We need to be in for the long haul. At the end of the day, the wearables wave is gaining more momentum quickly and gathering speed. As job site connectivity, data aggregation, and edge computing evolve, wearables will become more prevalent. Every employer should be actively investigating and evaluating how this wave can enhance his or her business. So stay tuned. I want to thank you for your undivided attention. Any questions?
Yes. Thank you, Mike, very much. We do have a few questions. Are there any standards for exoskeletons?
Actually, there are. A couple of years ago, the American Society for Testing and Materials just established a committee, and that committee is known as the F48 Committee, and it is to establish standards for exoskeletons as well as what are called exosuits. So that will lead to setting some industrial bar, if you will, so that the manufacturing of various products will meet a certain performance standard. And that would be based on criteria established by a variety of stakeholders, whether it's those that are manufacturing the product, as well as those who are going to benefit from the use of the product.
Thank you.
To answer your question?
Yes, it did. I do have a couple more. Other than cost, what are some of the other barriers to wearable technology?
Well, I think the most substantial barrier is, and I mentioned it in this presentation, is apprehension, is how people will feel their data is being used. So I think, again, as I mentioned, what needs to be done is there needs to be good communication, transparency in the planning for using wearable technology. And I think if we go about, being transparent, being upfront, in engaging the worker in the process of what we're trying to do, share the results with them, and for all to reap the benefits, I think will help to create much more credibility. But it's just like anything else. If we keep workers in the dark, if for whatever reason they're suspicious about how that data could be manipulated against them, then there will not be acceptance there, and there will not be buy-in, if you will.
A couple more. Is there a wearable technology for silica dust?
Not that I'm aware of. There's technology for detecting particulate in the air. However, I don't know of any technology specific to silica dust that you're referring to.
Okay. With that or other uses in mind, as we look down the pipeline, so to speak, what other technologies do you, wearable technologies do you think will come into practice?
I've already mentioned a few that were in the development stage in various universities. But there's one other interesting technology that caught my attention not too long ago. And that is technology which is applicable to the healthcare industry and managing patients. Two areas. One is being able to manage patients' vital signs remotely and conveniently. but also in the minimization of wound healing time. So this one technology that I was becoming informed about uses printed heaters and electric stimulation implemented into bandages. So if you will, these bandages have integrated the heater and electric stimulation. And what that does is that brings about much more, speeds up the recovery time. A fascinating application of technology. It's not yet out, but it's been successful in the trials. So what I imagine is that could be introduced within the next year, based on my understanding.
Thank you, Mike, for providing us with a roadmap for better equipping our workers from a safety standpoint. Please take a 10-minute break, and our final speaker will address the intricacies of contractor vendor compliance. We'll be right back.
CBIA's extensive member savings offerings? Learn more about programs like our partnership with Training Network Now, an online service which offers safety and health training videos for your employees.
One of the more frequent questions that we have encountered recently has been a number of companies making new demands on their vendors or their contractors. Joining us to understand the maze of OSHA and safety issues in regards to this topic is Megan Baroni, a partner with Robinson Cole. Megan, welcome. Thank you for joining us.
Thanks for having me virtually. Okay, so everyone, thanks for hanging in there today. I know I'm the last presenter here between you and the weekend, so hopefully it will at least be engaging as we can be in this environment. And you'll learn a little bit of something. We will save some time for Q&A at the end, so if you have questions, feel free to enter them in, and we'll try to get to them. So we are covering today contractor compliance and oversight. There's a lot that we can cover on this topic, but what we're going to focus on today is what you see on your screen there. So the first thing I'll talk about is just generally the different roles at a site, an employer, an employee, and the contractor, and how we define those roles. The second thing I'm going to talk about in quite a bit of detail is the multi-employer citation policy that OSHA has with regard to job sites where there are multiple employers. The third thing I'll talk about are record keeping and reporting obligations when you're dealing with contractors. And then the last thing I'll touch upon is COVID guidance, and I know that's been covered a bit, but I'll talk about it a little bit more in the context of a multi-employer workplace. So the first thing we're going to talk about is who is an employer, who is an employee, who is a contractor. It's important to note the definitions for these terms in the statute and the regulations. So I've got them up here on the slide. They're not terribly elucidating. I think the definition of employee is my favorite. So an employer is a person who's engaged in a business affecting commerce who has employees. An employee is an employee of an employer who is employed in a business of his employer, which affects commerce. So that's kind of a roundabout definition. And contractor, we don't really know what contractor means because OSHA doesn't really think about the contractor relationship so much as the employee and the employer relationship. Despite the fact that we all may think it's an easy question of who is our employee and who is not, this is actually a very difficult question to answer sometimes in the context of OSHA regulations and violations. So to flesh this point out a little bit more, I want to take you through the example of a case that dealt with this issue. It was heard before the Occupational Safety and Health Review Commission with regard to Royal Construction Company here in Farmington, Connecticut, probably about 5 years ago. So Royal Construction Company was cited for a number of OSHA violations, failure to have a written HAZCOM program, failure to provide fall protection, a number of violations involving improper use of a ladder, and a few others. OSHA cited Royal Construction for these violations, and Royal contested. One of the reasons that they contested the citation was that Royal claimed that the workers were not his employees, the workers that were involved in these alleged violations. The Review Commission disagreed with Royal, and they held that to assess whether an employer-employee relationship exists, you must look at the hiring party's right to control the manner and means by which the work is accomplished. So that's the standard, and then they kind of went through a number of different examples to show why Royal was, in fact, the employer for these violations. In this case, those workers identified the head of Royal Construction on the site as their employer. They responded to the head of Royal Construction on the day of the inspection when the head asked the workers to come down off of a roof when the inspector was there, and the workers complied. And the Review Commission actually used that as evidence of the employer-employee relationship. Royal provided materials, tools, trailer, equipment for these workers. They determined when the workers would work, how long they would work. The work that was being performed by the workers was a part of Royal's regular business, and they were paid on an hourly basis. And so based upon all of those things, the Review Commission determined that these workers were Royal's employees. So I think we can go to the next slide here. Based on this case, these are some of the questions that we need to be asking ourselves when we are, at a site that involves contractors. Oftentimes we hire subcontractors, we might hire temporary workers, independent workers. You may in your head think this is not my employer, because we all think we know what an employee-employer relationship is. But for OSHA purposes and for health and safety purposes, we need to think a little bit more broadly. So sort of based on the lessons that we learned from this case, you really do have to ask yourself, who is paying this person? Even if it is sort of on an hourly basis, I mean, they don't just have to be on your payroll in order for them to be considered your employer. Who controls the scope of the work? Who's providing them with their equipment? Who's telling them when they can work? What's the duration of that? But really sort of the most important thing, and probably the least detailed on the list, is the last one. Who has the authority to control the work? That's a really broad, consideration. And, even thinking back to the Royal Construction case, just thinking about, the Review Commission using as an example of employment, the fact that the head of Royal Construction asked the workers to come off the roof when the inspector was there and they complied, as one of the factors that demonstrated an employer-employee relationship. That's pretty broad. So, it's important to remember when you're thinking about OSHA regulations that you may not think somebody is your employee, but for the purpose of health and safety, they may be considered to be your employee, and you may be citable if there are violations that impact them. So one of the ways this really plays out is through OSHA's multi-employer citation policy. So we're going to talk about that next, and I'm going to go through this in a bit of detail. I think this one is really important for people to be aware of, sort of understand how it works. OSHA has a pretty detailed policy on this. It walks through examples. So we're going to walk through some of the examples of workplace situations that may or may not result in citations. So the multi-employer citation policy is a policy regarding multi-employer work sites in every industry. There can be more than one employer that is citable for a hazardous condition that violates an OSHA standard. And so, we're going to walk through that now so that we have, a better sense of exactly what that means. This is really a two-step process to figure out if you're going to be cited under this multi-employer citation policy. So the first step is to determine if the employer falls within one of the following categories. We'll go through each of these in a lot more detail on the coming slides, but just generally, there's the creating employer. That's generally the employer that caused the hazardous condition. There is the exposing employer. And that's the employer whose own employees are exposed to the hazard. The correcting employer, that's an employer that has the ability to correct the hazard. And then there's the controlling employer, and that is an employer who has general supervisory authority over the work site, including the power to correct or instruct others to correct health and safety violations. So the first step is to figure out if the employer falls into one of these categories, and they can fall into more than one category, as we'll see as we go through. And then if so, did the employer's actions meet the obligations required of the particular category? So let's start with the creating employer. As I mentioned on the previous slide, the creating employer is the employer that caused the hazardous condition that violates an OSHA standard. And so the second prong of that analysis is pretty basic, and employers cannot create conditions that violate OSHA standards. If they do so, they will be citable even if their own employees have not been exposed to that hazard. So as an example, and so I hope this won't be too tedious in a virtual environment. If we were in person, I would probably be going through these hypothetical situations and asking for a show of hands as to whether people think there was a violation or which category the employer would be in. But I'll just have to ask my stuffed animals to do that, I guess, for now. Or you can just do it at home. So I'm going to walk through a couple of examples to sort of provide a little bit more detail around how you can become a creating employer or how you can avoid becoming a creating employer. So the first example I'll give is that you have an employer host, so that, sort of the employer that operates the factory. It contracts with Company S to service machinery. The host fails to cover drums of a chemical despite Company S's repeated requests that it do so. And this results in airborne levels of the chemical that exceed the permissible exposure limit. So the step, we got to go through this two-step process, right? So we got to figure out if this is a creating employer, and we're talking about the host. And the host is a creating employer here, pretty obviously, right? Because they created the hazard by leaving the drums uncovered, and which resulted in these exceedances of the PELs. And then step two, the host failed to implement measures to prevent the accumulation of the air contamination, even though Company S continued to ask it to do so. It could have easily met the obligation by just covering the drums. And so they failed to do that, and the host is liable as a creating employer. On the flip side, I'll give another example where employer M hoists materials onto the 8th floor of a building, damaging perimeter guardrails. Neither its own employees nor the employees of any other employers on the site were exposed to the hazard. It takes effective steps to keep all the employees, including all the employees of the other employers at the site, away from the unprotected edge, and it does not have the authority to fix the guardrails itself. That's not its job at the site. So this employer is a creating employer because it did cause a hazardous condition by damaging the guardrails. However, when we move on to step two to see if they acted appropriately, they lacked the authority to fix the guardrails, so they could not do that. But they took immediate steps to keep all of the employees, no matter whose employees they were on the site, away from the hazard. So this employer, even though it is a creating employer, doesn't meet the second prong of this test, and so it would not be citable. So, that second example is an instance where you did create a condition and you were able to take steps to avoid a citation. So, two sort of good examples there of a creating employer. So I'm not seeing the slides anymore. Are those visible? Is there a way to know that? Okay, there we go. Okay, so the next employer we'd like to cover is the exposing employer. So the exposing employer is an employer whose own employees are exposed to the hazard. And for step two, the exposing employer is citable if it knew of the hazardous condition or failed to exercise reasonable diligence to discover the condition, and it failed to take steps consistent with its own authority to protect its employees. So one thing that's really important to know, if you're worried about exposing employer liability, is that if an exposing employer has the authority to correct the hazard, it is citable if it fails to do that. So if you have the authority to correct, your employees have been exposed, and you have the authority to correct the hazard, even if you didn't create the hazard, you will be citable if you did not correct the hazard. If you do not have the authority to correct the hazard, so kind of going back to the example that we just gave, where the guardrails were damaged, but the employer that damaged them did not have the authority to fix them at the job site, you have to go through sort of a three-part analysis, and you as the exposing employer will be citable unless you do all the three of these things. You need to ask the creating or the controlling employer, we'll get to the controlling employer in a couple slides, you need to ask them to correct the hazard. You need to inform your employees of the hazard, and you need to take reasonable protective measures. So again, thinking back to our last hypothetical, it seems as if that employer did those things. If there's an extreme circumstance like imminent danger, an exposing employer can be citable if they don't remove their employees from the job site. So if the condition is really that dangerous, that can be an obligation of the exposing employer. So I'm going to give you an example from the guidance for the exposing employer. So the example is unprotected rebar on either side of an access ramp presents an impalement hazard. Subcontractor E, an electrical subcontractor, does not have the authority to cover the rebar. However, several times, subcontractor E has asked the general contractor to cover the rebar. And in the meantime, subcontractor E instructs its employees to use a different access route that avoids most of the uncovered rebar and requires them to keep as far away from the rebar as possible. So in this analysis, the step one is this an exposing employer? And the answer is yes, this is still an exposing employer, because despite the fact that they required their employees to take a different route, the example was that it avoided most of the uncovered rebar, but not all of it. So there still was a hazard there. But when you move on to step two of the process, the subcontractor E made a good faith effort to get the general contractor to correct the condition, and they took feasible measures to minimize the exposure to their own employees. So under the guidance, this would not be a citable situation. Okay, so the next one we will move on to is the correcting employer. So a correcting employer is an employer who is working on the same site as the exposing employer, and they can be responsible for correcting the hazard. So this could be, an employer who's responsible for installing or maintaining certain equipment at the site. The correcting employer is required to exercise reasonable care in preventing and discovering violations and meeting its obligations of correcting the hazard. So this is another example of this. It's a bit lengthy, and I hope they're not tedious to read through, but I think these real world examples are really helpful to figure out what sort of all of this complicated and general language means in the workplace. So our example for a correcting employer is that employer C, a carpentry contractor, is hired to erect and maintain guardrails throughout a large 15-story project. Work is proceeding on all 15 floors. The carpentry contractor inspects every floor in the morning and then again in the afternoon every day. And it also inspects areas where material is delivered to the perimeter once the materials vendor is finished delivering the material. Other subcontractors at the site are required to report damaged or missing guardrails to the general contractor, who would forward these reports to the carpentry contractor. The carpentry repairs the damaged guardrails immediately after finding them and immediately after they are reported. On the project, a few instances of damaged guardrails have occurred other than where material has been delivered. Shortly after an afternoon inspection on floor 6, workers moving equipment accidentally damage a guardrail in one area. No one tells the carpenter of the damage, and the carpenter has not seen it. An OSHA inspection occurs at the beginning of the next day prior to the morning inspection of floor 6. None of the carpentry contractor's own employees are exposed to the hazard, but other employees are exposed. So the analysis for step 1, the carpentry contractor is a correcting employer because it is responsible for erecting and maintaining fall protection equipment, the guardrails. But under step 2, the steps that the carpentry contractor implemented to discover and correct damaged guardrails were reasonable in light of the amount of activity and the size of the project. And it exercised reasonable care in preventing and discovering violations. So it's not citable for the damaged guardrail since it could not have reasonably known of the violation. So an interesting thing to just note here, the language that sort of jumps out to me in this part of the analysis is that it exercised reasonable care in light of the amount of activity and size of the project. So if you recall, the carpentry contractor was inspecting in the morning and inspecting in the afternoon. It's a 15-story project. There's work on all floors. That factual situation, inspecting once in the morning and once in the afternoon for the purposes of this guidance, appears to meet this reasonable care standard. It's reasonable care is subjective, and it's always difficult. It appears very frequently in laws and regulations, as I'm sure many of you have experienced, and it can be very subjective. But it's important to just kind of think about, what is the scope of the project? What's reasonable? How many times can this contractor really get out there and inspect? Work's happening on every floor every day. So it seems reasonable that the contractor is out there inspecting. I mean, in this case, twice a day. That is a lot of work. It's that's a substantial undertaking. But the situation might be different if work were only proceeding on half the floors or a quarter of the floors at any time. So it's important to just sort of define what this process is up front and make sure that you think it's reasonable, and reevaluate it as the work continues to make sure that the process doesn't change. Because if there wasn't a process in place where this carpentry contractor was doing these inspections on a daily basis, the situation probably would have been significantly different. So the next and final employer that is covered under the multi-employer citation policy is the controlling employer. So a controlling employer is one who has general supervisory authority over the work site, including the power to correct safety and health violations itself or to require others to correct them. So how do you become a controlling employer? There are many ways that control can be established. It can be established expressly by contract. It can be established just by your actions. So I want to talk through a few of the ways that you can become, that control can be established to become a controlling employer. So, by contract, there can be an express provision in a GC's contract that gives them the authority to control safety and health at the site, that gives them the authority to require other employers at the site to adhere with health and safety requirements. That would be, a pretty easy case to demonstrate that this employer is a controlling employer. It's explicit in the contract. On the contrary, there can be times where it's not explicit in the contract. There's really no statement as to sort of the overall right to control health and safety, or sometimes there might be a provision in the contract that specifically says that the general contractor does not have such a right. The controlling employer status can even be established in those cases if there are other provisions in the contract that are broad enough so that this GC's contractual authority is such that it would necessarily involve safety. Some of the examples of that would be if there are provisions that allow the GC to resolve disputes between subcontractors, to set schedules for work, to determine construction sequencing, those types of things. If those provisions are in a contract and a GC has control over those types of things, that GC may be found to be a controlling employer for the purpose of this policy, even if there's no explicit provision in the contract that gives them the right to control health and safety, or, as I said at the outset, even if there's a provision that says they do not have that right. And then lastly, control can be established without contractual authority at all. It can be established just based upon actions. So if an employer in actual practice is exercising broad control over subcontractors, then that employer may be considered to be a controlling employer even in the absence of contractual provisions. So let me just walk through an example of where a controlling employer can sort of become a controlling employer without having an explicit contractual provision. So construction manager M is contractually obligated to set schedules, construction sequencing, require subcontractors to meet certain specifications, negotiate with trades, resolve disputes between subcontractors, direct work, and make purchasing decisions which affect safety. However, the contract states that M does not have the right to require compliance with health and safety requirements. Further, subcontractor S asks M to alter the schedule so that S would not have to start work until another subcontractor had completed installing guardrails. And M is contractually responsible for deciding whether to approve the request to modify the schedule. So in this case, step one, even though contractor M does not actually have contractual authority to cover health and safety, there were many other provisions in the contract that we've discussed that would sort of lend the GC to have that right. And so in this example, those other provisions in the contract are broad enough that they would be found to be a controlling employer. So in this case, under step two, I think this is a pretty simple result. If they are a controlling employer, if they do not grant this request to alter the schedule, and this subcontractor has to go up and do its work before the guardrails are installed, I think it's fairly obvious that they would be violating a standard, and so they would meet that second prong as well. So that's just an example of how you can become a controlling employer, even when you were contractually trying to absolve yourself of that title. So step two of this analysis is that a controlling employer must exercise reasonable care to prevent, if we can just go back to the prior slide really quickly. Sorry about that. To prevent and detect violations on the site. So this concept of reasonable care is coming up again. And one of the things that they say, I kind of think this is a really difficult thing to figure out what it means in practice, but we're going to talk through it. The extent of the measures that a controlling employer must implement to satisfy this duty of reasonable care, and this is right out of the guidance, is less than what is required of an employer with respect to protecting its own employees. Now, sort of based on everything we've been talking about here, that seems a little bit odd because we've been talking about how, employers on multi-employer sites are required to make sure that the site is safe for everyone, not just their own employees. But we're going to talk through an example in a minute that might help to shed a little bit of light on this. So now we can move on to the next slide that provides a little more detail about reasonable care. What is reasonable care? How do we figure out what care we need to be using if we're potentially going to be a controlling employer? Well, you need to look at the scale of your project, the nature and the pace of the work, the frequency of the number of types of hazards, how the work's going to change. This is all to determine how frequently you should be inspecting, what level of oversight should you be providing. If the work is moving really quickly, on the one hand, you might not have the ability to be out there all the time inspecting, and on the other hand, you need to make sure that you're catching all of the work tasks in your inspection process so that nothing is slipping through the cracks. One of the things that the guidance mentions is it's important to know whatever you can find out about the safety history and the safety practices of the employers that you're controlling at the site. If you have knowledge that an employer that you are supervising or you have control over, has violations in their past, that's a situation where you're probably going to need to be inspecting more regularly than you would otherwise. If you know nothing about the employer that you're supervising, that's another situation that you'd probably want to be inspecting with a little more frequency. If you've worked with this employer before and you know that they have a stellar health and safety record, that's something you can take into consideration and maybe inspect. You can't avoid inspecting altogether, right? But you can inspect a little bit less. So it really takes, some hard thought about the job and the employers that you're working with to try to figure out what reasonable care means in this situation. So let me just talk you through one example, sort of going back to this concept that you don't need to provide the same level of protection that you would be providing to your own employees. I thought that this example was helpful. So employer GC subcontracts with sub E, an electrical subcontractor. GC has full contract authority over sub E, and sub E installs an electrical panel box, which is exposed to weather and implements an assured equipment grounding conductor program as required under the contract. It fails to connect a grounding wire inside the box to one of the outlets. This incomplete ground is not apparent from a visual inspection. Further, GC inspects the site with a frequency appropriate for the site in light of the factors we've already discussed. So that's a little bit of a hint of where we're going. It saw the panel box, but it did not test the outlets to determine if they were all grounded, because sub E represents that it's doing all of the required tests on the receptacles. GC knows that sub E has implemented an effective safety and health program. And from previous experience, it also knows that sub E is familiar with the applicable safety requirements and is technically competent. GC asks sub E if the electrical equipment is okay for use and was assured that it is. So step one, I think it's pretty clear GC is a controlling employer. It has general supervisory authority over the site, including the contractual control over sub E. But looking to step two, and what was reasonable care, GC did exercise reasonable care in this instance. It did its due diligence about sub E, right? It determined that it had the technical expertise, it had the safety knowledge, it had implemented safe work practices. It conducted its inspections appropriately, and it made some basic inquiries into the safety of the electrical equipment. So under these circumstances, the GC was not obligated to test the outlets itself to determine if they were all grounded. It was entitled to, it had exercised reasonable enough care to rely upon sub E's representations and its track record in not doing that. So the GC would not be citable here as a controlling employer. So that's an interesting example, because it's one example to try to show us when a GC, has exercised reasonable care and what the distinction is between doing that for your own employees and doing that for others' employees. So, I know this is a really detailed policy. And we could talk about this for quite some time, but it's really important to know that on any multi-employer work site, OSHA is looking at all of these options for citations. You can be cited even if this wasn't your own employee that was exposed to the hazard for all of these reasons. So it's just really important to kind of keep these in mind when you're working with multiple employers on a site. It's not good enough, unfortunately, to just rely upon, what your own health and safety plan is for the site. You have to really kind of be aware of what's going on around you. And, as may be obvious from some of these examples, you can be cited in sort of more than one instance at a job site. You can kind of see in some of these examples how you might fall into even more than one of those categories. So I think that's enough for today on the multi-employer citation policy, but Certainly, if there are any questions, feel free to type those in and we can try and take those up at the end. So the next topic I want to just generally touch upon is record keeping and reporting responsibilities in the context of contractors. So as many of you know, you're required to record injuries and illnesses and also report those for workers on your payroll. You must also record injuries and illnesses and report those injuries and illnesses for employees who are not on your payroll if you supervise these employees on a day-to-day basis. So, you know, the self-employed people, independent contractors, do you need to put these people on your, do you need to report and record their injuries? You do if you supervise them on a day-to-day basis. We can just advance to the next slide. Thank you. Employees from a temporary help service, same thing. If you supervise them on a day-to-day basis, you need to be recording and reporting their injuries. Contractors, same thing. You need to be reporting and recording if you supervise them on a day-to-day basis. Well, what does that mean? Supervise them on a day-to-day basis. You know, there's a lot of FAQs that OSHA provides. And so day-to-day supervision essentially means that, you know, in addition to specifying the output, the product, or the result to be accomplished by a person's work, the employer supervises the means, methods, and processes by which the work is to be accomplished. So, you know, I don't know how much more detail that gives you besides day-to-day supervision, which one is more helpful. But it's just important to remember that you need to keep these folks in mind when you are deciding when you're reporting and recording. It's not just your payroll employees, it can be others at a site. And the last thing I'll say is that you only report and record an injury or illness one time. So if you've decided that that's your responsibility and not the contractor's responsibility or not the temporary help service company, then you report and record that and they do not, or vice versa. So it's very important to decide how this is going to be handled. Make sure we're doing it appropriately, again, following the day-to-day supervision standard, but to make sure that you're communicating with the folks that you're working with to make sure that things are being recorded and reported appropriately. So, so the last thing I want to touch on here is COVID. I mean, it's kind of hard to give a presentation on anything in 2020 or 2021 without saying the word COVID. So, you know, as you guys all know, OSHA has been issuing quite a few guidance documents over the last year plus with regard to COVID and the standards that we all, you know, there's no new standard yet, but there are a lot of guidance documents that will help employers to figure out how to deal with COVID and the potential exposure in the workplace. So obviously, we need to make sure that we're protecting our own employees with regard to COVID exposures. But, you know, obviously, you know, COVID spreads. That's one of the issues about the risk associated with COVID. And so we need to make sure that we are also protecting our employees by making sure that other people that enter our workspaces, including contractors, are following the appropriate rules. So, you know, things that you need to keep in mind are, you know, if you have your own COVID plan in place and you know how you're addressing COVID on your work site, you know, you have assessed the exposure hazards, you have a prevention program in place, and you've determined what measures you're going to take in certain circumstances, then you need to make sure that other people, contractors, and the like are complying with those same rules when they're in your workspace. Because, you know, based on everything that we've talked about already today, you can be liable for creating conditions even if people exposed on your site were not your own employees. But with regard to COVID, you also need to make sure that you're protecting your employees from other people that enter the workplace. So, I'm not going to go through all of the details of COVID, COVID preventative measures. That could be, a whole day, and I'm sure has been talked about already. But it's important to note that this issue of COVID protocols and protections will come up in the context of contractors as well. That's pretty much it. I'm happy to take questions at this point. I think, my sort of parting thought that I'll leave you with is that, the best thing that we can do in situations where we're overseeing contractors or dealing with their own contractor compliance in addition to our own is to try to be as clear as we can up front with regard to who is going to be responsible for what. So I know, I just told you about situations where contractors and GCs tried to create contracts to explicitly state who was and was not responsible for health and safety violations. And sometimes it doesn't work out, right? Sometimes there are other provisions in the contract that, sort of negate that provision or provide more information that sort of, creates a different situation than you were trying to create in a contract. There's always the risk of that, but it's a best practice to make sure that we are defining the health and safety roles on a site up front as best you can. But even doing that, we still need to be cognizant of the health and safety plans, protocol, and requirements of the subs that we're working with. It's as we've seen in this presentation, not good enough to paper a contract and then turn a blind eye to what's actually happening in practice if you're out there observing things that or suspect could be an issue. So sort of the parting thoughts before we turn to Q&A is contracts aren't perfect in these situations to define the roles and make sure that they stick. There's certainly some other things that we all need to do to make sure that health and safety requirements are being met. But contracting and prior planning is a very good way to sort of set those expectations and make sure that you have a checkpoint to know if those expectations are being followed on a going basis. So with that, I think, Philip, if you've gotten any questions, I'm happy to try to answer them to the best that I can.
We do. Well, you never said it would be easy, so we do. What about subs on a project that we supervise during a project, but not beyond the end of a project? For example, on a 6-week project.
Yeah, so that's a great question. If you're worried about being a controlling employer in that situation and you've brought in a sub and you're supervising them, then I think the answer is you need to be concerned during the period of time that you're supervising them and you're working on the project. But once the project is over and they're no longer under your supervision, you would no longer be their controlling employer. It would be pretty hard to establish facts that would demonstrate that you would remain their controlling employer even when they were now, off working at another job site. So yeah, I do think it would be limited in time to the period that you would be working together on that same site.
We have a couple more. We talked about the distinction between an employer and a contractor. What are some factors that might weigh in favor of a worker being classified as a contractor rather than an employee?
Yeah, okay, that's a great question. It kind of goes back to that case that we were talking about at the very beginning. And that case really went through a number of factors to show how you become an employee, even if, the employer didn't think you were an employee. Certainly the way they're paid is important. That is not the be all and end all by any stretch of the imagination. But the way someone is paid is important. If you hire a subcontractor company and their employees are paid directly by the subcontractor, that is an extra layer between the GC and the employee of the subcontractor that might sort of weigh in favor of it being a contractor. The other thing is, the ability to control the manner in which the work is performed. I mean, that is really the crux of what we're getting to when we're figuring out who an employer is. So if you've hired a subcontractor to do work that they specialize in, right? Let's say it's a construction site. So we were talking about Royal Construction. You hire an electrician. If that electrician or the company is really coming up with its own means and methods for how they're doing the work, that is going to lean more in favor of the party being a contractor as opposed to it being an employee. So, that the ability to control is really the most important. And so I would say if you're trying to avoid that situation, the best thing that you can do is give as much autonomy as possible to determining those means and methods to your subcontractor.
Understood. We have one more. Is there a category of employer under the multiple employer citation policy that is cited the most or is subject to the biggest penalties?
Yeah, that's a great question too. And I've not done any real research on this. But, it's interesting. I would say, so don't quote me on this because I'm just kind of guessing. But I would say, the creating employer is an obvious one because they've created the hazard. That type of an employer has the potential for most liability on a multi-employer site or not. Because again, there's sort of a direct line between the hazard and their actions. They've caused it. So I would say a creating employer is probably one. That's one of the bigger ones. The exposing employer, that's a biggie because it's your own employees that have been exposed, but you didn't necessarily create the condition. So, creating the condition, in my mind at least, can be among the heavier hits under the penalty policy and under the number of citations.
Thank you, Megan. That about covers it. I suspect this issue will not go away anytime soon, so we thank you for sharing with us some of the strategies in addressing them. We have covered a wide assortment of topics in the past few hours. We hope that you have found the time well spent, and we ask that you take a moment to complete the program evaluation which is found in your chat box. On behalf of CBIA, I would like to extend a heartfelt thank you to all the speakers who took time out of their busy schedules to present for us, and most importantly, extend our deep appreciation and thanks to our sponsors, Fuss and O'Neill. Please do what you can to stay safe, and I hope this is the beginning of a great weekend. Goodbye.